Anu? Anu. Okay. Good morning to all. So we are beginning Honorable Vice Chancellor, Dr. Mohan Kundumel sir, Pro Vice Chancellor, Dr. Vijayan sir, Dr. Jayan, Dr. Manoj Kumar, Registrar, Dr. Dattatreya Rao, who is a member of NCISM, Dr. Prasanna N. Rao, Principal, Hassan College, Dr. Hemant Kumar, who is the department head, HOD Department of Cellulendra, NIA Jaipur, Dr. Suhas Kumar Shetty, Principal, KLE Belgaum, Dr. T.D. Sri Kumar, Principal, Government Ayurveda College, Tripunithura, and respected delegates and faculties. As once in a while, we are conducting seminar as a disseminating of knowledge. This time, it is a part of Azadi Ka Amrita Mahotsav, the 75th Independence Day celebrating. As a part of it, we are organizing a national seminar on Ayur Sports. Naturally, there is a question why we are conducting a sports-related subject. Because even though Ayurveda is not directly giving any reference to sports injury management or other, but the physical fitness is considered as very much important in Ayurveda. And there we can see scattered references about sports also. And some of our doctors is practicing sports medicine as a profession itself, particularly Dr. Arshad and Dr. Matthew Wembley. And other doctors also is there in this way. So we want to give an academic support. That means even though we are practicing, we are not getting knowledge about sports and sports medicine and what Ayurveda can contribute to the sports field. So we plan to make an awareness about Ayurvedic doctors and the sports person of Kerala, at least in Kerala. So we started, that is a part of it, we started this seminar. And of course, before that itself, we plan to conduct a PG diploma course in Ayurveda sports medicine. And 3 years back itself, through Kerala University of Health Sciences, we have submitted a syllabus to the CCIM, then CCIM, and recently to the National Council of Indian Medicine also, we have submitted the syllabus. And it has to be started from the Central Council of Indian Medicine. So we, as some knowledge about sports is a must for as a practice in Ayurveda, it has to be accepted by the sports community. So this year, we plan to start an MPhil course in sports medicine Ayurveda, and we submitted the syllabus and regulation to the university, and KHS was ready to recognize, and it approved, the academic council approved it, and most possibly from the next year onwards, the MPhil sports medicine Ayurveda will start from the KHS. So that will giving an acceptance to Ayurvedic medicine by in the academic field. So at least the practitioners can say we are having studied some sports, because that syllabus itself includes the biomechanics and kinesiology and kinanthropometry are included in it. And of course, from the references of Ayurveda, the Bhagana Chikitsa and Prana Chikitsa, we can manage the acute injury occurring to the sports. Of course, some formulations are needed for the present, changing from the older ones like Thaila and other. So we are new formulations is coming to the field. And then, of course, there is for endurance to enhance the sports, enhance the endurance of sport. That depends on the events. Every sports person wants to enhance his or his, and so there are chances of the medicines for which can injure. And of course, Ayurveda is having the rehabilitation of the chronic injury rehabilitation. Ayurveda can contribute a lot. That is the objective of this seminar. And let me come to my duty. I welcome Dr. C.P. Vijayan, Pro Vice Chancellor of the Kerala University Health Sciences, who is always supporting the school, all programs. Not only this seminar, even we are introducing any new thing, he is always giving directions and supporting us. So I am very, with the immense pleasure, I welcome Dr. C.P. Vijayan for this presiding this meeting. Next, Dr. Mohan Kundumel, sir, the Honorable Vice Chancellor of Kerala University of Health Sciences, who is always supporting this Ayurvedic fraternity, and all the new programs. I think he may be the one of the beginner of this seminar, because he once told me that we had to conduct some thing about the connection with Asadika Amrita Mahotsav. And I thought then it can be with the, and always he's promoting sports also. So I thought this is the occasion to start a seminar of Ayur Sports. Both will be benefited. That means Ayurveda also can get an entry in it. And I wholeheartedly welcome Dr. Mohan sir for inaugurating this seminar. Next, I welcome Dr. Dr. Jayan, who the faculty dean. Definitely, he is one among us. So I welcome Dr. Jayan for felicitating in this meeting. And Dr. Tom Joseph is the chief guest and expecting his arrival within minutes, because he told he will be with 9:45, he'll be here. And I think everybody may be knowing him. Tom Joseph is an Arjuna awardee, a volleyball player. At least 12 years represented India. And once in 2009, he led Indian volleyball team in Doha. And he got many awards, including the 2014 Arjuna Award. Before that, he got G.B. Raja Award, Jimmy George Award, and so many awards here at Acute. And he is residing at Tripunithura also. So we thought he'll be a right choice as a chief guest for this sports seminar. I welcome Dr. Tom Joseph to the seminar. Next, Dr. Dattatreya Rao. He was a former professor of Venkateswara Ayurveda College, Tirupati, and now nominated as the National Council of Indian Medicine board member. And he is one of my good friends. And immediately I told there is a program. Before that, it's last month, he was ready to come to there is a training program, that is a training for advanced research. And due to some technical reasons, he are unable to enter before 7 p.m. and he entered by 7:30 only. That means by that time the inauguration was over. So even though that he was present in that, I welcome Dr. Dattatara Rao for this national seminar. Dr. Prasanna N. Rao, who is the principal of the Hassan College, definitely he is very well known to Kerala also, because many of the students are studying and at least in the UG or PG at Hassan College, and he has good connection with us. And I myself, because being a PG Shalyachandra, we are having a same National Service Association members. So we are knowing earlier. And immediately when I contacted, he said, no problem, I will be there. So I welcome Dr. Prasanna N. Rao for the national seminar. Dr. Hemant Kumar is a HOD of Department of Shalyachandra, NIA Jaipur. Before he was working in Hassan College, there itself he is known to me, and he was also ready to, because there in NIA Jaipur they are going to conduct a collaborative research in the sports field in collaboration with the DAIS, and that is Dr. Arshad, who is an expert today. He's presenting a paper here. In collaboration with the Arshad, they are going to conduct a research program in wormology and sports. So he said, I am interested what is going on in Kerala, in the Ayurveda fits and sports. So he was ready to participate in this. I wholeheartedly welcome Dr. Hemant Kumar for the national seminar. Dr. Suhas Kumar Shetty, he is actually for almost all the programs he is cooperating with us, even whatever the MPhil classes conducting or the training programs. So this time also we invited him and he readily accepted our invitation, and we are going to do a collaborative research Belgaum University in Ayurveda field in some conceptual research. On my behalf and the School of Fundamental Research, I welcome Dr. Suhas Kumar Shetty. Dr. P.D. Sri Kumar, Principal, Government Ayurveda Tripunithura, he is always cooperative with the School of Fundamental Research, and he is ready to encourage all our works. So on behalf of my School of Fundamental Research and University, I welcome Dr. P.D. Srimar, who is present here. Then Dr. Sriraj S.K., Associate Professor of the School of Fundamental Research, who is giving the vote of thanks. I welcome Dr. Sriraj S.K. to the seminar. Then I welcome all the delegates who came here by starting the program. Of course, we are expecting some more also. So I welcome all the delegates. And lastly, I would have told in the first itself, I congratulate all the medal winners of Commonwealth Games for India, and particularly Eldo Paul, who is the resident of Ramapuram near Tripunithura. By this, let me conclude my welcome address. Thank you. I invite Dr. C.P. Vijayan sir for presidential address.
Honorable Vice Chancellor of Kerala University of Health Sciences, Professor Mohanan Kundumal sir, Registrar of the University, Professor A.K. Manoj Kumar sir, Professor of School of Fundamental Research in Ayurveda, Professor Sudhikumar sir, Chief Guest of the Day, Sri Tom Joseph Arjuna Awardee, Professor Dattatreya Rao, Member of National Commission for Indian System of Medicines, Dr. Jayan, Dean, Faculty of Ayurveda, Kerala University of Health Sciences, Dr. T.D. Srikumar, Principal, Government Ayurveda College, Tripunitura, Nation for Indian System of Medicine. Dr. Prasanna N. Rao, Kerala University of Health Sciences. Dr. T.D. Srikumar, Principal, Government Ayurveda College, Tripunitura, Nation for Indian System of Medicine. Dr. Prasanna N. Rao, Principal, SDM College, Assam. Dr. T.D. Srikumar, Government Ayurveda College, Tripunitura. Dr. P. Hemant Kumar, Dean, National Institute of Ayurveda, Jaipur. Dr. Suhas Kumar Shetty, Principal, KLE Ayurveda Mahavidyalaya. Dr. Sriraj SK, who is the convener of Ayur Sports, Associate Professor of SFRA. Dear delegate and faculty members, in connection with the celebrations of Azadi Ka Amrit Mahotsav, we are lucky to have a national seminar in relation with Ayurveda and sports, named as Ayur Sports. In fact, Ayurveda can do a lot in the field of sports and sports medicine. Ayurveda is having a branch of its own, Swastavrata, to improve the general well-being of all individuals, which will improve the general well-being of athletes and make them more fit for the sports activities. And also, the injuries can be prevented effectively. And if there are minor injuries or chronic injuries, yes, Ayurveda can help the athletes and also to come back to the field and track at the earliest. So, and at the same time, as mentioned by Professor Sudhikumar, a course is also planned by SFRA and in Kerala, affiliated to Kerala University of Health Sciences in sports medicine in Ayurveda. So this national seminar is all the more relevant because of all these reasons. And our 75th anniversary celebrations of Indian independence, in connection with that, yes, it is having a very high relevance. I am not going to take too much time. We are waiting here to hear from our Honorable Vice Chancellor, our Chief Guest, and also from various stalwarts in the field of Ayurveda. So I am wishing all success for this program. Over to you, Professor Sudhikumar. Sudhikumar sir, over to you.
Okay, sir. Okay, sir. Okay, sir. Sir, I invite Honorable Vice Chancellor, Dr. Mohan Kundumel, to inaugurate Ayur Sports, the national seminar. Please, sir.
A very good morning to you all. Sarve Bhavantu Sukhina. My colleague in the university, Pro-Vice Chancellor, Professor C.P. Vijayan, the chief guest, Arjuna Awardee, Kerala's pride, Sri Tom Joseph, the registrar of the university, Dr. Manoj Kumar, NCISM board member, Dr. Dattatreya Rao, the dean of the university, Dr. Jain, principal of Tripunitura Ayurveda College, Dr. T.D. Srikumar, principal of SDM College of Ayurveda, Hassan, Dr. Prasanna N. Rao, dean of Shalyatandra National Institute of Ayurveda, Jaipur, Dr. P. Hemant Kumar, principal of Keli Ayurveda Mahavidyalaya, Dr. Suhas Kumar Shetty, and Dr. Sriraj, Associate Professor and Convener of Ayur Sports. We are actually creating a history, a landmark event. University is celebrating the Azadi Ka Amritotsav, and we are having a national seminar on sports and Ayurveda. Initially, we were wondering what is the connection between Ayurveda and sports. But then when we look back, for the last hundreds and years of the country, the physical fitness of the soldiers were met by the Ayurveda physicians. When you come to Kerala, we have a great tradition of Kalaris, and these Kalaris trained soldiers of the then princely state. And these soldiers, when they get injury, the ashans or the teachers of these Kalaris used to treat them. And they have a unique system of marma chikitsa. And they used to train them to promote their health, to increase the stamina of the soldiers, and to make them powerful. A burst of energy can come during the war, and they can sustain. And then when you look at sports, this is what is needed. This is needed in sports. A sportsman needs, health has to be promoted. He needs stamina. He must be able to give a burst of energy when needed. When you are running 100 meters, you need a burst of energy. And when you are running marathon, you need a lot of stamina. And then you should know techniques of reducing injury. And all these things have been practiced in our state and probably rest of the country also. And even today, we have these Kalaris. Even today, we have these Marma Chikitsa centers. And they are doing good job, but unfortunately, they are not scientifically validated. Unfortunately, nobody has documented it. And therefore, and that is the business of the university. University will have to document such knowledge, and these knowledge are slowly disappearing. Many sportsmen get dislocations, fractures, and these dislocations and fractures were treated by these Marma Chikitsa people, the Kalari Chikitsa people. And then how we can translate it into the real sports event. In fact, when an injury happens, modern medicine uses the finest techniques of surgery. But then, can you do the injury reduction? Can you reduce the problems without surgery? Can Ayurveda help in that? The physiotherapy which we are practicing in modern medicine and the Marma Chikitsa and Kalari Chikitsa, they are parallel. So can we scientifically validate, and can we use it? Can we brand it? So this is the job of the university, and the very purpose of this national seminar is to have a thinking of all the concerned, and then we have to document it. I hope we may be able to document a treatise on Ayur Chikitsa, sports Chikitsa, or Kalari Chikitsa, or Marma Chikitsa, a book, and which will explain all these things, how all these things can be done. And we have to promote health. And there are a lot of medicinal things, or what we call as special foods available in Ayurveda, which has been used to sustain energy, sustain stamina. So we can prescribe that, we can validate that. So the university's aim to start a course, MPhil in sports Ayurveda, is mainly for that. And university is asking the National Council, why not we have a PG diploma in Ayur Sports? So let us have create a syllabus. Let us create a curriculum. So these are all the areas. We are opening up a huge area. And when India is getting a lot of medals in Commonwealth, games. It is time for us to make our sportsmen to get more medals in Olympics, more medals in international games, Asian games, and for this, Ayurveda can contribute. In fact, Ayurveda has contributed hugely earlier times, not only for sports, but to protect the health of the soldiers. That's what I was saying. The soldiers' health was protected by Ayurveda, and the sportsmen are now the soldiers. And therefore, we must have a good documentation, we have good programs and good books, and we have the best faculty here with us. I request your support and let us move forward. With these few words, I declare this national seminar on Ayur Sports inaugurated. Thank you.
Thank you, sir. Now, I would like to call upon Dr. A.K. Manoj Kumar, sir, Registrar, Kerala University of Health Sciences, to felicitate the gathering. Welcome, sir.
Honorable Vice Chancellor, Professor Mohan Kundumal, sir, other dignitaries of the day, dear delegates. As told by the Honorable Vice Chancellor, the real strength of Ayurveda is not being explained, not being explored in terms of modern scientific methods. And I think 1,000 miles to go. Today, we all together say this is the first day. This national seminar is the first day for the long journey ahead. And I wish everything best for the day and a lot of expectations by evening today. And whatever the outcome comes, as sir told, university is ready to do the follow-up in all aspects. Wishing everything best. Thank you. Thank you so much. Sir, over to Sudhimar, sir.
Thank you so much, sir. Now, I would like to call upon Dr. Jayan D, Dean Faculty, KHS, for felicitation.
Very good morning to one and all. Am I audible? Very good morning to one and all.
Yes, you are audible. Jay.
Yes. It's indeed a very much happy day today, as we are beginning the national seminar on Ayur Sports. Already in Kerala, we have exclusive Ayurvedic hospitals which are working on sports Ayurveda, and hundreds of sportsmen are being treated by Ayurvedic experts in sports Ayurveda. The Todupuzha hospital under ISM is also functioning very well in this field, and hopefully this will kindle a flame that will spread all through the country in the field of sports Ayurveda. And I congratulate the School of Fundamental Research in Ayurveda for this beginning. Just like in case of yoga, yoga was initially devised for attaining moksha or salvation. But later, the therapeutic aspect of yoga was found out by the experts in the field of yoga, as well as experts all around the globe. Just like that, Ayurveda is also venturing into the field of sports injury management. Just like small injuries are easily managed, and even rotator cuff injuries, tennis elbow, ACL tear, all these things are nowadays managed by Ayurvedic physicians. What we need is a scientific validation of this thing and a documentation, and probably, as all the other speakers were telling, proper courses for sports Ayurveda. So I wholeheartedly congratulate the team of SFRA and the wholehearted support from the university. Thank you for all those things, and I wish all the best for this national seminar. Thank you.
Thank you, sir. Now I'd like to call upon Dr. Suhas Kumar Shetty, Principal and Medical Director, KLE Ayurveda Mahavidyalaya, Belgavi, to felicitate the gathering.
A very good morning to all of you. Honorable Vice Chancellor Dr. Mohanan sir, and the entire officials of the university, the faculties and the director of the School of Fundamental Research in Ayurveda. At the outset, I'm very happy to be part of this very unique national seminar, Ayur Sports, being organized by the School of Fundamental Research in Ayurveda, and especially in terms of the various aspects of activities that has been happening here. So in the recent visit, when Honorable Vice Chancellor visited our university a couple of months back, we were very happy to have a lot of interaction in our university, as well as when he visited our institution, we had initiated various projects. And since then, very happy to have association with the university as well as the School of Fundamental Research. And especially in this aspect, really appreciate as a part of the Azadi Ka Amrit Mahotsav that the School of Fundamental Research has initiated this integrating Ayurveda with the sports medicine. In fact, our institution was also one of the pioneer in the institution to have started this particular initiation of integrating Ayurveda with sports medicine, and for which we had started the OPD of the sports medicine in January 2019. And since then, we have an exclusive OPD dedicated for the sports medicines called as Krida Ayurveda. And we have the specialist of the Department of Shalya Tantra who have been handling different types of sports injuries. And in fact, we also have started few of the research projects as well as the dissertation related with this. In fact, we have just completed 2 such projects and 2 are ongoing. And we could see definitely that when we are able to integrate Ayurveda with Marma Chikitsa, physiotherapy, we are getting very good results in the sports injuries. Not just restricting to the different aspects of the curative aspect, but also plenty of interest being taken in the preventive aspects also to improve their fitness, endurance, especially when it comes to the use of the different practices like Abhyanga, especially in terms of the Udvartana, different lepas, bandhas, etc. I think if it is done, definitely we are going to improve the endurance as well as the fitness of our athletes as well as sportsmen. And this particular initiating the MPhil course in the university is really appreciable, and we'll be very happy to be associated with all the activities of the universities, and especially wishing this seminar a grand success on behalf of our university, KLE Academy of Higher Education and Research, Belgavi, and our Ayurvedic institution, which is one of the oldest institution in the state of Karnataka, Sri BMK Ayurveda Mahavidyalaya. So thank you once again for making a part of this particular program and wishing this seminar a grand success. Thank you very much.
Thank you very much, sir. Now, I'd like to call upon Dr. P. Hemant Kumar, Dean PG, Head of PG Department of Shalya Tantra, National Institute of Ayurveda, Jaipur, for facilitating.
Namaskar. Is it clear? Voice is clear? Hello?
Hello, clear.
Clear.
Yes, sir.
Om Dhanvantaraya Namaha. Om Manjunadaya Namaha. Respected Honorable Vice Chancellor, Pro Vice Chancellor, Registrar of Kerala University of Health Sciences, Dr. Sudhi Kumar, and all stalwarts of this seminar, and various dignitaries attended this seminar. And I welcome all the delegates for attending this national seminar on Ayur Sports organized by School of Fundamental Research in Ayurveda and Kerala Health University. I am very happy to invited this workshop. See, our National Institute of Ayurveda, deemed to be university, already started Marmology and Sports Medicine, Marma Chikitsa and Krida Beshaja MSc course for 2 years, and already first batch already started in our university. It comes under now under Shalyatantra department, and we started Marma Chikitsa OPD clinic also is there. And I am very happy Kerala University of Health Sciences also starting these type of courses for promoting Ayurveda in the field of sports medicine. See, Ayurveda is an evolutionary science and system that perpetually renews itself as each generation interprets and applies in profound principles. Like the principles of modern medicine, the core insights of Ayurveda about life and health are relevant to today's modern society, like these were for old generations. Sports medicine has always been difficult to be defined because it is not a single specialty, but an area that involves many branches. Sports medicine is a branch of medicine that deals with the physical fitness and the treatment and prevention of injury related to sports and exercise. It is a new horizon of Ayurveda practitioner with innovative development of health practices. In sports medicine, mainly Mamsa, Asti is the main dhatu, and Snayu, Kandara are Upadhatu, ligaments and tendons are Upadhatu, which deals with the sports injury. Its main aim is to render the best health service in sports and traumatic injury. Practice Marma Chikitsa treats efficiently chronic bone and joint injuries with Ayurveda specialty medicines and procedures like concussion, muscle cramp, anterior cruciate ligament sprains, ankle sprain, shin splints, muscle strains, or post-traumatic stiffness is a common in sport injuries. See, many of Marma points have great importance in the sport injuries. Marma therapy has a wide range of application for physical, psychological, and spiritual health. This science can be used for preventive, promotive, and therapeutic purposes. Marma Chikitsa or Marma point stimulation is having a great impact in physical and mental performance of sports person and heals their injuries. Ayurveda can be best scheduled via Dinacharya, Rutucharya, and Panchakarma can keep them healthy. Ayurveda has some unique features such as Prakriti Parikshana, Sara Samhana, Sattva Parikshana, and Agni, which can be very helpful for sports person to select their sports, athletic activity, or their role in particular game or sport. The approach of Ayurveda may additionally help a sports person in determining his role in particular sports, which may yield a better performance and satisfaction level. This strength of Ayurveda should be used for the benefits of sports people. Definitely, this is the exact time to develop Ayurvedic principles and Ayurvedic procedures and Marma Chikitsa in sports medicine. Definitely, this workshop is a very helpful for all the Ayurvedic practitioners and Ayurvedic fraternity. And I hope the great success of this conference. And I am very thankful to organizers giving opportunity to share my views in this seminar. Thank you. Namaskar.
Thank you, sir. Now I kindly request Dr. T.D. Srikumar Sir, Principal, Government Ayurveda College, Tripunithra, and Dr. Sutikumar Sir, Professor, School of Fundamental Research in Ayurveda, and Dr. Sriraj S.K., Associate Professor, SFRA, Convener, Ayur Sports, to kindly light the lamp and officially inaugurate the ceremony.
Honorable Vice Chancellor Dr. Mohanan Kunnumel sir, Honorable Pro Vice Chancellor Dr. C.P. Vijayan sir, respected Registrar Dr. Manoj Kumar sir, dignitaries viewing this program on digital platform, delegates and other dear faculties. First of all, let me express my gratitude for being invited me here to deliver a few words in front of you. It's with utmost pleasure I am standing in front of you. And as we know, as our Ayurveda is as old as our civilization, despite the manifold modern advances, Ayurveda still holds a predominant position in the country. The reason for this are because of its public attraction. Here, SFRA is starting a new venture in respect of sports medicine. I hope it's a very good endeavor to fetch you some good values for serving Ayurveda to the public. Of course, Ayurveda have laid many basement stones in respect of marma, considering the whole body and its categorization into different forms like Sadhya Pranahara, Kalandra Pranahara, Vaigalyagara, Rujagara, etc., etc. So, based on this basic principle, if we could develop a scientific explanation for this sports injury in relation with marma therapy, it would be of great value for the Ayurvedic system. I express my best wishes for this great endeavor and all the best. Thank you.
Thank you so much, sir. Now, I'd like to call Dr. Sriraj S.K., Associate Professor, SFRA, Convener, Ayur Sports, for word of thanks.
most respected dignitaries on and off the dais, respected faculties, and dear students, I'm here to present the word of thanks on this occasion. As far as SFRA is concerned, this is one of the most prestigious moments for us to host a national seminar on Ayur Sports. First of all, I would like to thank the most respected Honorable Pro Vice Chancellor of this Kerala University of Health Sciences Kerala, Dr. C.P. Vijayan sir, for his position of presiding over this function. Thank you, sir. And next, I would like to thank the Honorable Vice Chancellor of KUHS, the most respected Dr. Mohan Kundamal sir, for finding time to inaugurate this function. And in his absence also, we would think he will join us sooner, Dr. Tom Joseph, the Arjuna Awardee, who have been consented to be the chief guest of this function. And I thank him. I hope he will join soon. And I would like to thank Dr. A.K. Manoj Kumar sir, the registrar of KUHS, for facilitating the function. Thank you, sir. And Dr. J.N.D., the Dean Faculty Ayurveda of KUHS, for facilitating this function. Thank you, sir. And Dr. T.D. Srikumar sir, to be the principal, Government Ayurveda College Tripunithura, and he has been here for the function. And thank you, sir, for finding time. And Dr. P. Hemant Kumar sir, Dean PG, Head of the PG Department of Shalyatantra, National Institute of Ayurveda, Jaipur, for finding time to participate in this function. Thank you, sir. And facilitate the function. Thank you, sir. And Dr. Suhas Kumar Shetty, Principal and Medical Director of Kerala Ayurveda Mahavidyalaya, Belgavi, for finding time and facilitating this function. Thank you, sir. And in their absence also, I would like to thank Dr. Dattatreya Rao, the nominated NCISM board member, and Dr. Prasanna and Rao, Principal, SDM College Ayurveda Hospital, Hassan, for their consent in facilitating this function. And not but the least, the function, I would like to thank Dr. Sudhikumar KB sir, the Professor, School of Fundamental Research in Ayurveda of KUHS. Without him, this function or this program will not be materialized. Thank you, sir. And I would like to thank our colleagues in SFRA and the participating delegates and also the technical support team. Thank you all.
The programmatic open-label randomized trial on the effectiveness of adhesive patches mode on the Dashamulak Shira is in exercise-associated muscle cramps with respect to electromyography was organized. And the first prize is backed by Dr. Rashmi BG. I kindly request Principal, Government Ayurveda College Tripunithura, Dr. T.D. Srikumar sir, to honor the winner. In the absence of Dr. Rashmi BG, the award is collected by Dr. Rohit. I kindly welcome you. A logo competition was also organized as a part of the national seminar Ayur Sports, and the logo selected and the prize is backed by Dr. Navya Ramesh. I kindly request her to receive the prize from Dr. T.D. Srikumar, sir.
Thank you, sir. Our first session will be led by Dr. Arshad P., Chief Physician, Sports Medicine, Daisman Sports Medicine Nutrition Center, Kondoti, on the topic Management Techniques of Sports Injury with Research Aspect. He is the Managing Director and did postgraduate diploma in Sports Medicine and Nutrition from Apollo Hospital, Hyderabad, and worked with Sports Authority of India, Bangalore, and treated many international and national athletes. He has great record in his career and very popular in Indian athletics and sporting field. He is the first Ayurvedic sports medicine doctor to serve Sports Authority of India. I'd like to welcome Dr. Arshad P. for the session. The session will begin shortly after a tea break.
Please note, those who haven't completed the registration, please report to the help desk immediately. Take note, those who haven't completed the registration for the seminar, report to the help desk immediately. Thank you.
Please note, ടീ ബ്രേക്കിന് ശേഷം എല്ലാവരും സെമിനാർ ഹാളിലേക്ക് എത്രയും പെട്ടെന്ന് എത്തിച്ചേരേണ്ടതാണ്. ഇതുവരെയും രജിസ്ട്രേഷൻ പൂർത്തിയാക്കാത്തവർ ഹെൽപ്പ് ഡെസ്കിന്റെ അടുത്ത് പോയിട്ട് രജിസ്ട്രേഷൻ പൂർത്തിയാക്കേണ്ടതാണ്.
Hello. Oh. Good morning. Respected Dr. Sudhimar sir, Dr. Sailesh sir, Dr. Sriraj, and all my dear friends. Today is one of my, what I say, after COVID, and I was struggling for my life for a period of 1.5 years. Many of you perhaps may know or may not know. And I was practicing sports medicine for the last 20 years. And last 1 year, I was studying oncology because I was a victim of cancer for last 1.5 years and doing chemotherapy right now. And fortunately, because of the prayers of you all, I'm here. I'm proud to be, say, I'm fit to do all activities right now. And today I want to express you some of the facts, what I gained in the last 20 years in Ayurvedic sports medicine. The Ayur Sports, the name I coined 20 years back, Ayurvedic sports medicine. How I came to this field, because I was not a brilliant student when I was studying for BAMS, an average student, but I find the possibility in the difficulties. We have so many difficulties while we are studying in Ayurveda, but I find out the possibility. What is the possibility of Ayurveda to get achieve a good practice than an orthopedic surgeon, than a modern sports medicine specialist? I found out that orthopedics Shalyatandra has a Marma Jigilsa has a great potential that I can achieve a good position in national and international level. And more or less, I am very much happy. I gained the acceptance for that it's a dedicated practice. And what I were to disclose you, the skill works 20%. Your attitude and your dedication is the 80%. And that should be the main focus area. Now is the all the arena is information overload. You have a lot of information that I will tell you in the details, but you should focus on specific subject. That is my opinion. And today I'm going to, it's only 1 hour session. I can't tell you all the things in the 1 hour. Gives you some of the glimpse, some of the essence, what we can do in sports medicine, better than modern medicine. Many of the conditions which is known to have surgery could be easily managed without surgery and can be rehabilitated and function restoration and back to sports or back to normal life without any agonizing problem and much lesser time and much less cost. That is a great advantage, I have to say, in integrated treatment. For that, we have designed a protocol that is no surgery, speedy recovery, quick action Ayurveda, advanced integrated approach. What is integration? How we integrate the physiotherapy and some other physical modalities, some exercises, some kind of functional training to to manage the injuries and rehabilitate the injury and prevent the injury. All these things is great important. I will go into the next slide. You can see this is I star icon of India. whenever you are treating, the sports is a very prestigious event. You know, if you are treating a sports person, if anything happens, it is affecting their career as well as your career. This was the question I got, or I met with when I was practicing 20 years back in Sports Authority of India, Bangalore, and I was the first doctor to serve Sports Authority of India. The all senior orthopedic surgeon and modern sports medicine doctors asked me in SAI, Sports Authority of Bangalore campus, whether you have treated any international athletes. No, I don't. And whether you have treated any national athletes. No. Whether you have treated any state athletes. No. Whether you have treated any district athletes. Whether you have treated any athletes. No. Then still we have a courage. What is the courage? I don't treat asthma. I don't treat kaya chikitsa, shalakya. I don't treat anything, skin, nothing. Why? You know why? Because I don't know. That's the answer. I only know this one. So this is my focus. So I promisingly and heartily told I can. So they ultimately, when I was going to SAI, I was only 26 years old, 26 or 26, something 26. And I was not even like mistake like this also. And the senior doctors are always there sitting there. They told me, even we have 30, 40 years of experience. We are not ready to take risk. How can you, a boy like you, take the risk to treat the nationals? But fortunately, I never forgot the name. Every time there is a huddle, there is a stacking stone or a huddle in front of me, there will be the hands of God coming to me like I am here. After the cancer also, that time also, Anju Bobby George, husband, Dr. Bobby George has come to me and he helped me. He has a very good experienced doctor. He told me without my previous history, he informed the director of Sports Authority of India. He's a very good doctor. I know him very well. And let me accommodate into the Sports Authority of India. That was the real build of Ayurvedic sports medicine, actually. Because we didn't get any exposure in Sports Authority of India at that time till yet. And I was on the time in 2000. It was in 22 years back. In 2000 in Sports Authority of India, Bangalore campus. And I got acquainted with a lot of athletes and many of that injuries get cured. That may be because of our academy studies in Kottakkal. They're having a lot of Shalyatantra cases, a lot of fracture cases, a lot of Marma cases. That only I studied. I never posted for gynecology. I didn't even went one day for gynecology posting. Because I don't want to go gynecology. And I didn't went even for Manasika Roga. I didn't even go to rural posting. I only went for all the posting. I went to orthopedic sector. That is in District Hospital, Manjeri. And after that, I went 2 years with an orthopedic surgeon. That is in Calicut, Baby Memorial Hospital, Dr. Schiller Jose. He also gave me a lot of experience. And before that, I was studying in Apollo Hospital, Hyderabad, with the Dr. Bhaktiyar Chowdhury. He was my mentor and guru. He is a former Indian cricket team and Indian athletic team doctor, served for Indian athletic for 16 years, and is MD Switzerland from Germany, Switzerland. And he's a very good visionary, Dr. Bhaktiyar Chowdhury. If you are ever get a chance, try to get attached with him. It will be making a wonderful experience in your life. So that's he was from AFMC, Armed Force Medical College. So so strict. You have to come to the college at 9 o'clock. If you are coming by 9:01, he will enter. He will allow to enter the class, and you have to stand up to 3 hours in the desk. Such kind of very strict personality. So strict is always there in discipline, and strict is always there in sports. That's a prime and thing you have to understand. And this everyone shown that's Neeraj Chopra. You might have seen the first gold medal for India in athletics and in the Olympics. And that was the thirst for the last many years. And we have such, not like Neeraj Chopra. We have treated so many national athletes like javelin throw, Sri Ranjini and Aparna Roy and Basina Muhammad. All these are national champions. These are treated from our center. So that we made a caption, we made a tagline. If something stands between you and your success, make your dreams come true and fast. We'll do. Because all these athletes are now coming to Ayurvedic treatment only. They are not going to modern medicine. This Aparna Roy is a 5 times national record holder. It's a 5 times national record holder. He came to our hospital for 7 times for different type of injury, meniscal injury, ligament injury, rotator cuff, and ankle sprain. All are advised for many times advised for surgery. He didn't even touch a single needle in his body, and he is recovering and doing very much fast and gaining much more performance in sports. And we can expect a gold medal in the Olympics through Aparna Roy. That will be a great achievement for Ayurveda also. And next slide. And you can see now I was speaking with the Shafiq, and he is a student in is a PG student in Toronto as a football player. He was coming from our place. He's now getting more than 1 crore rupees. His family is coming from a poor situation. He came from, he was coming to our hospital when he was studying in the 7th standard. Now he is around 23 years old. He now is playing for Jamshedpur FC, and he's playing for Mumbai football club also, getting more than 1 crore rupees per year. So he's our brand ambassador. He's going to be our brand ambassador most probably. So this will be getting a good acceptance, because when you are treating normal person, why I am getting attraction to this now? When you are treating a normal patient, or Shankaran or Mohammad Kutti or Joseph, it will not get much acceptance. But we were treating a sports person. If you are getting a severe injury and getting cured and getting back to normal and getting much performance, we could be getting good acceptance. The people will be getting, and the media and all the society will be knowing that it's a sports medicine center, or some of the treatment is there, and you have to get the acceptance. This is the some of the acceptance. You can, in the African place, they came to our hospital from Ghana, Ivory Coast, and what do you say, Senegal. So many places we are getting, and Sudan. And you might have seen the picture also, Sudani from Nigeria. Like that is actually Sudanese from, not from Nigeria, Sudanese from Sudan. But it's all the people look like black in our place, especially why I got this practice now. That is also great advantage for me, because I am coming from a Mecca of football, that is Malappuram district. Their blood is always with football. If any persons from Malappuram district can understand easily. If you are having World Cup, European Cup, all the cup, it's a celebration like a Eid or a Onam there, because it's all the places will be flooded with the flexes of Messi, Ronaldo, and the team fans association meetings. And that's the reason in our locality is a Kondoti municipality. There are around 22 turf clubs, turf stadium. So each and every ground will be in 3-4 injuries per day. So we are getting minimum 60 to 70 fracture cases and sports injuries per day at that time before COVID. So such a kind of, we have treated, we have documented. Last day we spoke to Sports Authority, National Institute of Ayurveda in Delhi. At that time, we have documented more than 2 lakhs case. That's the highest number in India. Why I got no? Because our place is such a place, is a very popular and familiar for football, and much kind of injury, fracture, dislocation, patellar tendon injury, trochlear dysplasia, and ankle injury, all the injury mentioned in the textbooks, and even those are not mentioned in the textbooks also, we could attain that knowledge. That's the great advantage for me, that not because of my skill, my area is a special area. That is the thing I realized. My area is a area for the football. Though when I was studying for Ayurveda, I was also a football player. I was also playing. The Shukur is here. We have so many programs when I am studying in Kotak. So because football was my passion. Even when I was having chemotherapy, at that time also I came to Perindalmanna to see the AMI football tournament, because it was my passion. So every patient, every doctor should have a passion. This is my passionpreneurship. What I say, it's not an entrepreneurship like this. It's my passionpreneurship. I will become a sports medicine doctor. So if you have an intention to become a sports medicine, you should know what is that kind of sports you are active. So if you're a forward player, is telling that when I am kicking a corner kick, I am not getting power to kick. Then you know how the corner kick. Without knowing the corner kick, you cannot do how to treat, because the corner kick is the kick which is maximum use of the adductor muscles. So which of the muscles have been involved? This adductor magnus, adductor longus, adductor brevis, or pectineus. All these muscles are grouped into, and quadriceps muscles are having a function also that I will come to picture. So these are the world-class athletes. You might see in this Krishna Punia, Mandeep Kaur, and solving the problems makes you rich. You know the idea? If you are solving a problem, that will make you rich. I am solving the problem of the athletes and sports person. So I will become rich by socially, economically, mentally, and professionally, and everywhere. So if you have to solve the problem, when you are solving a problem of the small kids, then you will become a pediatrician. If you are solving the problem of a prasudi, then you become so whenever you are in the practice, you have to solve the problem. And that the caption you might have already seen many times: one who falls and gets up into much stronger than one who never fell. I fall many times in my clinical practice. There are so many difficulties, there are many cases of failure, because of first, when you are taking fracture cases, lot of complications. You know what are the complications of fracture? Malunion, infection, non-union, delayed union, avascular necrosis, shortening. All is the complications of fractures that will happen. So whenever there is a problem, you should realize the problem. You will relearn, unlearn and relearn. So that will make you much more strengthened. And this is the one of the message I have to say: not generalize, but you specialize. If you are for everyone, that is equal to you are for no one. You understand? If you are for everyone, that means you are for no one. If you are better to be different, as long as different is better. And in the middle of every difficulty lies the opportunity. You have to kept all these captions. And common sense is not common, that I will show you from the next slides, and often seems to be nonsense. And transformation from ordinary like me to legendary, it make 80% of the mindset and 20% of the skill. You may be having a rank, you may be having all the skill, full A+, that may not be worthful. You have the good mindset to achieve conquer the world. And let me come to the picture. What is the evidence-based treatment? Today I am going to tell you not the postulations, but the evidence-based treatment protocol compared with modern orthopedic and surgical procedures. These are the things what we can do, what we are doing in our clinical practice. Many of the things may be there. We have to find out whether it can be treated or not in the future. But these are the things what we are doing, which are advised for surgery, can be successfully treated by Ayurvedic integrated treatment. That is meniscal injury like patellar dislocation, ligament sprain, patellar tendinitis, tendinopathies, that is in the knee and the shoulder. You can treat Bungard lesions, Hill-Sachs lesion, slap tear, labral lesion, rotator cuff tear, that is supraspinatus and infraspinatus, that kind of tear, and groin injury that no one can heal as Ayurveda can do. Abductor injury, athletic hernia, and glamorous groin. All these things we are treating in conservative way, which is mostly treated by surgery in modern medicine. And this is one of the picture. It's a sportsman and this is a goalkeeper and fell by hitting the post. You can see the fracture. It's an intra-articular fracture. You may see that shaft of the fracture will heal. You can do anything, it will heal. This you know how the fracture healed. That's stage of hematoma, stage of proliferation, stage of callus formation, stage of consolidation, stage of remodeling. All the stages you might have studied, but you have to put the joint in alignment. That is the principle. But if you have an intra-articular fracture, it is very difficult. If you are having this kind of fracture, this fracture was referred to hand surgeon, normally not an orthopedic surgeon. It's a hand surgeon. He advised for a fixation, and he was informed the patient there may be stiffness We are not 100% sure. There may be this patient was referred to a major orthopedic hospital in Calicut. I am not mentioning the name of the hospital. The hospital name is inside the X-ray itself. So they came to us. You see, this is never mentioned in Ayurveda, any textbook of orthopedics. This is logical thinking. What we have to do, you can see, we have put a ring, like a ring, by cutting a splint, and made the correction of the distal end of the proximal phalanges. You can see distal end of the proximal thumb we immobilized by means of a ring. Whenever we are making a ring, that may be making compression on the distal phalange. So we make a pad, cushion pad there, and there was an angulation. There was a lateral angulation of the distal fragment. So to maintain that angulation, we made a splint or an angulation string towards the U clip there. Simple logic. The orthopedics, all the orthopedics management, what we are doing, that's not me mentioned in the textbook. You have to think how to reduce it. So, but you have to understand the basic things. Whenever you do an injury management, it should be managed properly and bandaged and immobilized in the resting position. Resting position. Resting position means if you have a biceps pull, suppose if you have biceps injury, how will you immobilize? This is the resting position is like this. You put the bandage like this. If you have a triceps injury, how will you immobilize? How is the resting position of the? If you have triceps injury, if you are immobilizing like this, it will you will put like this straight. That's the resting position. If you have a forearm injury, you have to immobilize in the mid-prone position. That's the resting position. Don't put like this. If you are putting like this, it's supinated and the interosseous membrane and the supinators will be stretched and the bone will be defragmented. And each and every, if you have a tendinitis in the Achilles tendon, you have to immobilize the plantar flexion. If you have a footballer's ankle injury in the anterior medial malleolus, you have to immobilize in the dorsiflexion. If you have a lateral inversion injury, you have to immobilize in the lateral angulation. If you have a deltoid ligament injury, you have to do medial angulation. It's like every injury, whenever you are a supraspinatus injury, how you immobilize? How you immobilize? Your supraspinatus, where it is attached? It is attached in the greater tuberosity. So whenever you are attaching, if you are immobilizing like this, it will be departed. So whenever you have any supraspinatus injury, you have to immobilize like this abduction. So the supraspinatus will be resting. So you have to put a something pillow over something splint here and a shoulder like this. So it will heal very easily. So each and every injury, there is a position of bandaging that is not mentioned in books, but it's mentioned in the original insertion. So whenever you have any injury, suspicious of injury, if you have any scuffed injury, suspect. Scuffed is a most common injury in the wrist. And you have to do X-ray after 7 days also. Whenever you have a scuffed injury, you can't see the injury scuffed fracture on the first day. That's the main thing. And you have to tell the patient, come after 7 days, take one more X-ray. At that day, you can see the scuffed fracture, proximal scuffed fracture very easily. And if you have a scuffed fracture, you have to take a immobilization in cup holding position. That's the correct healing position. Each and every joint injury has to be treated in resting position. That is the main thing we have to understand. You see, this is the logical bandaging. And because I didn't underwent this kind of treatment before, only logical application I've done, because I don't only experience this kind of fracture, whether this fracture can be healed. Now, many doctors of our area will be sending us message or picture of the X-ray, whether this can be treated or not, doctor. It can be treated according to your logic. How you can treat, that is the main thing. I will show you some of this. You can see, so this was the picture, and after the reduction, can you see any kind of deformity in the joint? You can see, I will show the video. This is the picture. The patient doesn't have any movement restriction at all. He's doing all the activities. You know, the patient was not came to our hospital for review. He was not came. by taking, we are documenting all the cases. Then we call the patient his number. Please come. Then he was say, I'm going job. I don't have any time. So please come and take an X-ray because why should I take it? I don't know any problem. You come and we given the money. All the cases I will show here for taking MRI, we are paying for them because after curing, two type of patients never come to our hospital. You should understand before going to practice. One type is if they are cured completely, they won't come. Another type, if they don't cured, also will not come. So we don't know which patient is not come. So what we are doing, we are writing all the patients in a document and calling them. And if you are giving some medications and every day one doctor will be there, how your improvement, that should be there. In your clinical practice, everything should be you notified, not a documentation. But you should document everything in a proper way. Then you will understand if the patient has come, then we will go, oh, we are given this medicine, it's cured. I got a medicine for trigger finger. Rumosan was the name. That medicine is no more. Why I given that medicine now? Actually, to be frank, don't tell anybody. The patient came with trigger finger in my hospital. I was searching for that medicine at that time because when I was practice started, and it is a joke actually. I was thinking which medicine has to give. Then I thought that this medicine will be going to expire on December. Let me give this. But it has an indication. The combination was there. But some combination was there. Then I selected that medicine. I given for 3 months, 1 month. And the patient was not coming to me. And because of the written document, I called the patient. How is that? It's okay, doctor. It is completely. Then I recollected that. Again, that medicine given to so many patients, the patients was getting very cured. So if you are having such kind of thing, also documentation is the main thing. You have to document the thing correctly, then you will get the feedback from the patient. You can see, next slide. You can see that I have put a caption, how Chandran achieved range of motion without pain. This is a 72 years old man. I will show the MRI, sorry. Okay, this MRI actually, this MRI. You can see, can you see, read that? I can read from here. Complete tear of superior glenohumeral ligament, usually SGHL, and full thickness tear of superior subscapularis tendon, and subluxation of bicep tendon, and supraspinatus full thickness tear, acromioclavicular joint narrowing, and complete discontinuity of supraspinatus 3.6 millimeter departure, and all these deformity, supraspinatus, subscapularis, superior glenohumeral, coracohumeral ligament, all these ligaments are completely damaged. This patient came to February 2022. This was a patient I was close, one of my close friends' relative, and he was coming by consulting an orthopedic surgeon. The orthopedic surgeon's name is still there in the MRI. You can see. But I don't know whether it can be treated, but I have never treated this case before. So I told that because they are not ready to go for surgery. They advise for surgery, even though surgery, they have to go for a 1.5 month complete immobilization and 6 month physiotherapy. After 1 year only, he can get range of motion. That also 60%. The orthopedic surgeon told that will cost 2 lakhs rupees surgery. So patient not even interested to do Ayurveda, but unfortunately he don't have 2 lakh rupees. So he came to us. The patient has to come to us many reasons, not because of our acceptancy, but they don't have many money to do the surgery. They came to us. Actually, this was the first video when he was coming to us. You can see. You can see all the patients are shoulder patients in my hospital at that time. They are reading pilates bar and some of them doing exercise. This is the physiotherapy unit. He was left. You see, and this is the second day. The treatment aspect I will tell you, but I want to tell you on the 12th day what happened. Now you can understand the first slide, what I have shown me, after 1.5 months, because I mean not having any symptom at all. He's rotating his hand. You see? Then you tell which is first. Whether surgical procedure is first or these are not what is a manipulated video or something. It's a documented thing. You can show. If anybody has any doubt, you can come to our hospital and see the patient. I will share the number also. So you can see, you can tell whether the modern medicine is first or Ayurveda is first. And we can also assess the cost of the treatment. Cost of the treatment maximum is 35,000 rupees, including all the treatment medications. And the treatment duration was only for 24 days because he usually for rotator cuff and Bangard lesion, all our patients go treatment for 14 days, 14 to 21. That is our treatment protocol. And in this patient, because he is 72 and having superior glenohumeral ligament and inferior glenohumeral and coracohumeral ligament, all the static stabilize of the humeral joint also as tear. So we taken a 28 days of treatment, but he's coming still after 6 months also, he is coming still every Monday into our hospital to do the exercises. Because he got a very good, remarkable recovery. So still he is coming per day, every day he is coming for the exercises for retain the joint movement. But he actually didn't want to come, but he's still coming. That's why we taken that video also. And this is another X-ray, MRI. You can see in this MRI, grade 2 injury of deltoid ligament complex, marrow edema in the medial malleolus. This is the second MRI. And first MRI was suggestive posterior impingement angle, acute tenosynovitis involving flux dialysis and anterior tibular talofibular ligament injury and posterior talar, such kind of major injury. This was, you can get the name also. It's a famous triple jump champion of national Indian team. And she was, her name also, you know. And she was advised to do surgery. And from the at the point of surgery, also doctor from all over India, in Miyot Hospital and Fortis and in Coimbatore, all the places they advised, they warned her, you can't do triple jump because highly unstable. Because if you're having a high angle sprain, in triple jump, you know, is a good biomechanical stability is to be there. Unlike in long jump, triple jump has a good biomechanical stability, needed good biomechanical stability of the ankle joint. So the anterior talofibular ligament, posterior talofibular ligament, and the syndesmotic ligament, deltoid ligament, all the ligaments and all the complex has to be in a proper way. Then only you can have a odd impact on the jump. So this case, you can see she became the first woman to cross 14.11 meter. Now, 1 week before, Ashwati Rao B. Ashwati has broken a record. Now you know what is the record of triple jump? Women? You should know. 14.14. 14.40. The last 1 week before, B. Aishwarya. You can Google it right now. Who is the current triple jump champion in India? B. Aishwarya. When she broken the Mayuga's record because she was the current record holder for the 12 years. How she attained that injury, recovered from, not because of the surgery. Even after surgery, they advised not, you can't do triple jump. But we made her to make triple jump by integrated treatment and exercise, this principle, and Ayurveda. And this already mentioned. And this is another one, shoulder MRI. I shown you post and after, pre and post MRI report. You can see slab tear and Bangard lesion. And after 1 year, you have to take an MRI after 1 year only. Don't take an MRI within 6 months because the soft tissue healing will not happen within 6 months. So after considering the time of healing of the soft tissue, Bangard repair and heel fascias, the MRI shows no changes. Because no changes of tear. why I taken this MRI? No, the patient was not having any symptom. He was going for the job and playing volleyball. Then many of my friends are orthopedic surgeon. I sent this video and previous MRI report. They jokingly thought function may be restored, but lesion may be there. They always look for the lesion and where to put screw. Then I called the patient. He was not ready to take the MRI. Then I paid for him. He took the MRI. Then I sent the MRI report, and they told the first MRI may be wrong. Then I asked them, if the first MRI is wrong, why they advise for surgery? That is also culprit. No, they advise for surgery. If the first MRI is wrong, then why should they advise for surgery? He was also advised for surgery, but without surgery he recovered. Then they are telling it cannot be healed. How it can be the Bankart lesion, third clock position, slab tear, and heel fascias lesion could not be healed. So when I took the MRI, they are telling it could not be healed. Another example is that I have not mentioned here. There is a Bankart lesion. You might have studied Bankart lesion cannot be healed. In textbook also we also studied, but we have documented 4 cases. And last case was one football person from our place, Malappuram. He treated for Bankart lesion 1 year before, and again came to me to show just for a visit from going from Dubai and coming from Dubai for vacation. He want to meet and whether anything has to be done. Occasionally pain is coming when I am sitting in the prayer. If the Muslim people having full squat like Vajrasana, at that time occasional pain will be coming. There anything has to be done. This time I have 15 days of leave. Any physiotherapy or treatment has now. Then I told whether were you treated 2 years before you have treated for that. Then I taken the old case sheet. Then it was bucket and tear. Then I told him that whether you can do one more MRI. Then he was very anxious. He was the first guy done MRI without my paisa. He gone to the hospital and done MRI. What he has done now? He brought the old MRI and sent to the same MRI center and given that, oh, you have taken MRI before. Oh, yeah, it's taken. Any treatment done? No, Ayurvedic treatment is done. Oh, then they know that Ayurvedic radiologist, no, Ayurvedic Bankart tear will not heal. They report as say Bankart lesion. Then we brought the report and we see Bankart lesion. A patient does not have any symptom. Then I told him that is there in between the break, lunch break. I will show that MRI also. I not put here. Then I told him to take a second MRI from another center, not disclosing whether you have taken an MRI before. Then he was quite disguised because I have already paid 5,000 rupees. Then this MRI will pay. He taken the MRI and came back to me. No Bankart lesions, no bucket and tear. Then what is the reason? Then I send all these report to my orthopedic surgeon friends. Then it is observatory variance. Every time they have name now. Every time if you have no treatment also they have good name for every disease and every management. We don't have any name, but Saraka has told don't ashamed of your not having the name because you have to treat only. Now evidence-based treatment protocol has been changed. That's a good thing for Ayurveda. You might have heard the anthroposophical medicine, environmental medicine, functional medicine, and you might have heard, no? Now there is a big conference is coming on Ernakulam, 27th and 28th. If anybody is interested, you can register for that. There's a good possibility for Ayurveda, international conference for integrative and functional medicine. Dr. Srikumar, one of the eminent doctor in, is a ENT surgeon, a former ENT surgeon in Lakeshore Hospital. He's turned into functional medicine. The functional medicine is quite similar to Ayurveda. Same as our principle. Mind, body, and natural environmental medicine and anthroposophical medicine. Such medicine is coming hugely in the world, but Ayurvedic doctors are always seeking back to the era. They are not thinking update. So modern medicine people are coming, absorb our everything, and they will making everything, and ultimately we don't have nothing. I will show that. I will give you, anybody needed, I will give you that registration number. It is in Ramada, Kochi. I am also taking one class presentation there or half an hour session for integrity musculoskeletal disorders, integrity approach, and it will be a good thing for you. It's a good international platform. Doctors from Europe and Germany, many other places are coming for that. And what I told no, this Bankart bucket and tear was not there in that MRI report. So observative variance. Then I told him, why the first MRI don't have any observatory variance, second MRI we having not observatory, and only third MRI will be having observatory variance because it is not there. Then I showed the MRI film to another radiologist also. I told whether any bucket handle, no, Arshad, no bucket handle tears, it is okay. Because my sister's daughter is a radiologist and sister's son is an orthopedic surgeon. Without disclosing, I told them, you check this. They are working in Alapi Medical College. I sent the CD of that to them and they whether check there is a name bucket. It is quite normal, no bucket tear. Then I told send the first CD with the bucket tear. It's the same patient. Then how it is healed? Because in modern medicine, the healing process is different. In our system, what you are studying now, healing process is very different. So what we have studied, when you are studying in, when I studied in sports medicine, when I was practicing, you know that ACL full thickness tear will not heal. That I know also, it will not heal because it's already cut. But we can do treatment for ACL. How? ACL is only one, not only one ligament. You have PCL, you have MCL, you have LCL, you have patellar tendon, you have hamstring muscles, quadriceps, VMO muscles, and all the ITB band, everything will be holding the joint strongly. The inefficiency of ACL can be compensated or recouped by the muscle strength. That is by hamstring quadriceps ratio. That is the technique what we are doing. Everything have a technique. The technique make much important than the management. The hamstring and quadriceps ratio, if you are strengthening the hamstring and quadriceps in a 6:4 ratio, then the joint will not go anteriorly. What is the function of ACL? To prevent the knee sliding anteriorly. This function is taken over by the hamstring quadriceps ratio. Why this angle hamstring injuries? How I made this treatment now? Because the hamstring quadriceps imbalance is the main cause of the ACL injury. So what is the Nidana Parivarjan? We can make retrospective, we can make the hamstring quadriceps contraction in a particular way. We can prevent the anterior dislocation of the knee joint. That's why we are doing. And if you are treating a rotator cuff injury, so a rotator and dislocation, you know, shoulder dislocation is always anterior. Is it so? Shoulder dislocation, major 80-90% of the shoulder dislocation is anterior dislocation. Is this anterior? How the anterior dislocation comes? When the shoulder comes from the glenoid cavity towards anteriorly. What is the movement? Extensive external rotation. No, this external rotation is the prime reason for anterior dislocation. And what is the muscle which hold the joint to prevent the jaw coming to anterior dislocation? That is pectoralis major. You have to identify the functional of each muscle. That is kinesiology and functional anatomy and biomechanics. Then you can treat every injury. So what you have to do? You have to strengthen the pectoralis major in a concentric way. There are two ways of strengthening. One is eccentric strengthening. One is concentric strengthening. Eccentric strengthening means which improves the strengthening by elongating the muscle length. Concentric strengthening means it contract or strengthen the muscles by reducing its muscle length. So what we are doing, concentric contraction of the pectoralis major, which will make the humerus, what will make? Internal rotated. You see, humerus joint internal rotated out. Normally concentric contraction ചെയ്യുമ്പോൾ അപ്പോൾ ഇന്റേണൽ റൊട്ടേറ്റഡ് ഉള്ള സാധനം എക്സ്റ്റേണൽ റൊട്ടേഷനിലേക്ക് എത്ര പോയാലും പിന്നെ അത് ആന്റിയർ ഡിസ്ലൊക്കേഷൻ ആവില്ല. ദിസ് ഈസ് ദ ടെക്നിക് വാട്ട് യു ആർ അഡോപ്റ്റിംഗ് ലാസ്റ്റ് 2000 പേഷ്യൻസ് ഇൻ ആന്റിയർ ഡിസ്ലൊക്കേഷൻ and rotator cuff strengthening and what you say subscapularis eccentric strengthening. All the muscles group which hold the shoulder in the glenoid cavity has to be strengthened in such a way that the patient cannot go the anterior dislocation shoulder. അപ്പോൾ അങ്ങനെ വരുന്ന പേഷ്യൻസിന് there will be having slight defect in the external rotation. External rotation ഒരു ലാഗ് ഉണ്ടാവും. അതെങ്ങനെയാ പേഷ്യന്റ് പറയാൻ തരുമോ? ആഫ്റ്റർ 1 or 2 months, ഒരു 3 months ശേഷം പറയും, ഡോക്ടറെ മലർന്ന് കിടക്കുമ്പോൾ ഈ കൈ ഇങ്ങനെ വെക്കുമ്പോൾ കിടക്കുമ്പോൾ തട്ടണ്ട്, ഈ കൈ കിടക്കുമ്പോൾ തട്ടണില്ല എന്ന് പറയും. നമ്മൾ കണ്ണടക്കും. അത് നമ്മൾ മനഃപൂർവ്വം ചെയ്യുന്ന. Deliberately we are doing that because if you are putting like this, it will go more external rotation. Then it will make anti-dislocation. അപ്പോൾ ചെറിയൊരു അതുകൊണ്ട് അയാൾക്ക് ഒരു പ്രശ്നം ഉണ്ടാവില്ല. നോർമലി കിടക്ക തലയിൽ അങ്ങനെ വെച്ചില്ല എന്ന് വെച്ചാൽ ആർക്കും കംപ്ലൈന്റ് ഉണ്ടാവുമോ? ഇങ്ങനെ കിടക്കുമ്പോൾ ഈ കൈ തട്ടും, ഈ കൈ ഇങ്ങോട്ട് എത്തുന്നില്ല. കാരണം എന്താ, കോൺസെൻട്രിക് കൺട്രാക്ഷൻ ഓഫ് പെട്രാലിയം മേജർ കൊണ്ട് ഈ കൈ കുറച്ച് ഇന്റർലോട്ടേഷനിലേക്ക് വരാം. മനഃപൂർവ്വം നമ്മൾ വരുന്നത്. അതുകൊണ്ട് ഒരു കുഴപ്പം അയാൾക്ക് ഉണ്ടാവില്ല. നമ്മൾ 20 years ആയിട്ട് ചെയ്ത ആൾക്കാരുടെ എക്സ്റേ ഇവാലുവേറ്റ് ചെയ്യുന്നുണ്ട്. ഒരാൾക്കും ആർത്രൈറ്റ് ചേഞ്ചസ് വന്നില്ല. നോർമലി ഇത് സർജറി ചെയ്ത ആൾക്കാർക്ക് മുഴുവൻ ആർത്രൈറ്റിസ് ആണ്. ക്യാപ്സുലാർ തിക്കനിങ്, ആർത്രോഫൈബ്രോസിസ്, പിന്നെ അഡ്ഹസീവ് ക്യാപ്സുലൈറ്റിസ്, ഫ്രോസൺ ഷോൾഡർ, എല്ലാ കോംപ്ലിക്കേഷൻസും പോസ്റ്റ് ട്രോമാറ്റിക് സ്റ്റിഫ്നെസ്സിൽ വരുന്നുണ്ട്. Because for your interest only, I was showing this kind of stuff. How this family became happy. You see, this is a police officer and her wife is a nurse in Manjeri Medical College. Bijna, her name is Bijna. Now, I am shown like this now. You can see this slide. What is this fracture, you know? I have written there. It's a olecranon fracture, type 2, displaced olecranon fracture. This was also case I am doing for the first time. I never did this fracture before. You know, olecranon fracture is always advised for tension band wiring. Usually surgery is must. And this patient came to her hospital at the time of Ramzan. We are taking fasting, and I was at the masjid, and Dr. Alex was at the time in the hospital. Alex, he is working in NM Kollam now, right now. And he's doing the Agni Karma, all the courses right now. Alex and Dr. Shamir, Dr. Riaz, all are worked in our hospital. And he called me, Doctor, one case has come, what to do? And I told, what is the case? Olecranon fracture, dislocation. He sent me the X-ray. When I was in masjid, I told, oh, let it be there, I will come. Then why should I let him refer to somewhere? No, because I have an anxiety to do something. Because it's a fracture in the olecranon. You know, what is the anatomical or clinical importance in the olecranon fracture? Anybody? It's not an oral question or something. You can tell whatever you like. Olecranon process always have a attachment of the triceps muscle. When you are having flexion, what will happen? Triceps muscle pull the olecranon process and the joint will depart. So it is always advised for surgery, and minimum 2-3 months it will take after surgery to full range of motion. 2-3 months or maximum more than that also. So, you know, elbow joint is the worst joint. Having stiffness, you might have heard about a lot of injuries, the radial head fracture and supracondylar fracture, condylar fracture, and a lot of fracture, trochlear fracture, all these things happening in the shoulder, elbow. It's the worst joint in our body. When you are taking an elbow joint, you should not bandage or immobilize more than 2 weeks. My opinion, my clinical experience, I immobilize only 1 or 2 weeks maximum. If it is a chronic patient, but later on we go to mobilization techniques. This olecranon fracture, how we immobilize? First I told you, every fracture, every injury has to be immobilized in a resting position. Then if this patient is come to your hospital or your OP, how you immobilize? Exactly. What you shown? Extension. See, don't put in elbow flexion. If you are doing elbow flexion, this will be same like this. So what we have done, you can see in the extension, we have pulled it and the immobilized. Why do extension? There is a problem. That's the next slide. You see, while you are doing extension, the joint fragments overlaps. It overlaps like this. So we have given a 15 to 30 degree flexion in which triceps pull knot will be there. In 50 to 30 degree flexion of the elbow joint, there will not be any triceps pull. If you are having this and up to 50 to 30, after 30 degree, the triceps muscle will be working in contraction. Each and every movement is like that. No, if you have abduction, first 30 degree is supraspinatus, later on ulnar deltoid, middle deltoid. Every degree of the joint is contributed by different muscles. Like that, each and every muscle has a function in different angles. So you have to understand into the triceps muscle have a action only after 15 to 30 degree. That depends 15 to 30 in that range. So what we have done, we have made an immobilization in 15 to 13 degree, not full extension. So it became healed. And meanwhile, I sent this X-ray report to all my friends, even my relatives also, then told, you will be getting good. What? ഇത് നിങ്ങൾക്ക് അടി കിട്ടും. കാരണം എന്നോട് എൻ്റെ അടുത്തൊരു സുഹൃത്ത് ചോദിച്ചു, കോഴിക്കോടുള്ള ഡോക്ടർ, ഇത് വേറെ ആരും ചെയ്തതാണെങ്കിൽ ഞാനൊന്നും പറയില്ല, അർഷദ് ഇത് ചെയ്തോണ്ട് തന്നെ ഞാൻ നല്ല ചെയ്തു പറയാം. അത് ട്രൈസെപ്സ് പുൾ ഉണ്ടാവില്ലേ, ഫ്ലെക്ഷൻ ചെയ്യുമ്പോൾ കൈ റിക്കറന്റ് പ്രോസസ് വിട്ടുപോലെ എന്ത് വിഡിത്ത ചെയ്യുന്ന വെച്ച്. പക്ഷേ 6 weeks, after 6 weeks you can see what is the modern approach that I have to tell. Tension band wire holds the reduction and prevents the posterior quarters opening, and pull triceps band. And this is the tension band wiring is the treatment. And Anju, after 5 years, the another session, okay, patient was completely okay. ഇനി ഇത് 5 years കഴിഞ്ഞാൽ വെദർ എനി കോംപ്ലിക്കേഷൻ ഉണ്ടാവുമോ, നമ്മളിതിന് ആർത്രൈറ്റിസ് വരുമെന്നൊക്കെ. ആഫ്റ്റർ 5 years there was no change at all. ഈ പേഷ്യന്റ് നമ്മൾ വിളിച്ചാണ് 5 years കഴിഞ്ഞപ്പോൾ പേഷ്യന്റ് വി റിക്കോൾ ദ പേഷ്യന്റ് ആൻഡ് ടേക്ക് വൺ മോർ എക്സ്റേ. നോട്ട് അറ്റ് ആൾ ഹാവ് എനി ചേഞ്ച്. ബട്ട് അതിന്റെ കോംപ്ലിക്കേഷൻസ് ആണ് നമ്മൾ പെർമനന്റ് എക്സ്റ്റൻഷൻ ലോസ് ഉണ്ടാവുക മോഡേൺ മെഡിസിനിൽ ട്രീറ്റ് ചെയ്യുകയാണെങ്കിൽ. എക്ട്രോട്രോഫിക് ഓസിഫിക്കേഷൻ, നോൺ യൂണിയൻ, മാൽ യൂണിയൻ, ദീസ് ആർ ആൾ ദ പോസിബിൾ കോംപ്ലിക്കേഷൻസ് ഓഫ് ഒലിക്രോണോൺ ഫ്രാക്ചർ. But in this case, conservative treatment, not at all having any deformity, and the function restoration is much better. You can see the video in the 6th week even. ഈ സംഭവം നടക്കുമ്പോൾ ഒരുപാട് പ്രശ്നങ്ങൾ ഉണ്ടായി, അതുകൂടെ പറയാം. ഇത് മഞ്ചേരി മെഡിക്കൽ കോളേജിലെ നേഴ്സ് ആയതുകൊണ്ട് അതുകൊണ്ട് മഞ്ചേരി മെഡിക്കൽ കോളേജിൽ നമ്മളെ പേര് നല്ലോണം പ്രശസ്തമായി. ആദ്യം ഡോക്ടർ പറഞ്ഞു ഇത് സർജറി ചെയ്യണം എന്ന് പറഞ്ഞാൽ അവിടുന്ന് മഞ്ചേരി മെഡിക്കൽ കോളേജിൽ ഒരു സീനിയർ ഓർത്തോപെഡിക് സർജനെ പറഞ്ഞു. അപ്പൊ മഞ്ചേരി മെഡിക്കൽ കോളേജിന്റെ നേഴ്സ് അവർ സർജറിന്റെ പ്രശ്നം ആലോചിച്ചിട്ടാണ് നമ്മളെടുത്ത് വന്നത്. നമ്മളെടുത്ത് വന്നു ലീവ് കൊടുക്കാൻ നേരത്ത് ഞാൻ ലീവ് ലെറ്റർ എഴുതി കൊടുത്തു. അപ്പൊ അത് കൊണ്ടുപോയി സബ്മിറ്റ് സൂപ്രണ്ട് സബ്മിറ്റ് ചെയ്യുന്ന സമയത്ത് ബിജിന എന്ന ലേഡിയോട് ബിജിന എന്ത് പറ്റി കഴിക്കുക, അപ്പൊ കഴിക്കുക. അപ്പൊ ഓർത്തോനെ കാണിച്ചില്ലെന്ന് വെച്ച് കാണിച്ചു. അപ്പൊ ബഷീർ ഡോക്ടർ, സോറി പേര് പറയാൻ പാടില്ല, ഡോക്ടറെ വിളിച്ചു. ഡോക്ടർ വിളിച്ചിട്ടാണ് ഇത് എവിടുന്ന ചെയ്തത്. അപ്പോൾ ഡേയ്സ്മാൻ, അന്നാ ഈ നീ ലീവ് തരണ്ട, നീ റിസൈൻ ചെയ്തോന്നാണ്, വോളണ്ടറി റിട്ടയർമെന്റ് എടുത്തു, ഇനി കൈ ഒന്നും ശരിയാവില്ല. അപ്പൊ പുള്ളി ആകെ പേടിച്ചു. ഇതൊരു ഓർത്തോപെഡിക്, ഇത് എന്ത് ഇങ്ങനെയൊക്കെ ചെയ്യാൻ പാടുണ്ടോ, ഇതൊക്കെ നിങ്ങൾ ടെൻഷൻ ബാൻഡ് ചെയ്യണ്ടല്ലോ, ഇങ്ങനെ ചെയ്താൽ മാറില്ല നണ്ടത്. ഇവരെ ഹസ്ബൻഡ് ഞാൻ പറഞ്ഞില്ല പോലീസിലാണ്, ഇവർ രണ്ടാരും കൂടെ പിറ്റേ ദിവസം വരുന്നത്. അപ്പൊ പോലീസിലെ ഹസ്ബൻഡ് ചോദിക്കുക, അല്ല അത് ഡോക്ടറെ ശരിയാവുമോ? അപ്പൊ ശരിയാവുമെന്ന് ചോദിച്ചാൽ ഞാനിത് മുമ്പ് ചെയ്തിട്ടില്ല, ഫസ്റ്റ് ടൈം ചെയ്യാണ്. ഞാൻ ഈ സായിൽ പോയുള്ള അനുഭവം ഉണ്ടല്ലോ, നിങ്ങൾ ചെയ്യുമെന്ന് വെച്ചപ്പോൾ ചെയ്യും. അപ്പൊ എന്താന്ന് വെച്ചാൽ ഞാൻ പലപ്പോഴും ആൾക്കാരോട് പറയുന്നത്, നമ്മളെ എളിമായിട്ട് പറയില്ല, ഇഗ്നറൻസ് ഹാസ് ഗ്രേറ്റ് കറേജ്. ഒന്നും അറിയില്ലെങ്കിൽ ഭയങ്കര ധൈര്യമല്ലേ. അപ്പൊ ചില കാര്യങ്ങളിൽ അത് നമ്മൾ ചെയ്യുന്ന കാര്യങ്ങൾ നമ്മൾ കറക്റ്റായിട്ട് മെത്തഡോളജി ഫോം ചെയ്താൽ നമുക്കൊരു ധൈര്യം നമ്മൾ കൊടുക്കണം. അപ്പൊ ഇത് ശരിയാവുമെന്ന് ചോദിച്ചാൽ ശരിയാവില്ല എന്ന് പറഞ്ഞാൽ ഇവർ അപ്പൊ തന്നെ നമ്മൾ അടിച്ചിട്ട് പണിയാക്കി പോകും. നിങ്ങൾ പിന്നെ എന്തിനെ തൊട്ടെന്ന് വെച്ചിട്ട്. പക്ഷെ നമ്മൾ ശരിയാവുന്ന കോൺഫിഡൻസ് എടുത്തു, പേഷ്യന്റ് 100% സാറ്റിസ്ഫൈ. അത് മാത്രല്ല, ഈ പേഷ്യന്റ് അവിടെ പോയി കാണിച്ച് ഡോക്ടറോട് പറഞ്ഞേ ഞാനൊരു വോളണ്ടറി റിട്ടയർമെന്റ് എടുത്തിട്ടില്ല എന്നാണ്. ദാറ്റ് മേഡ് എസ് വെരി ഗുഡ് ഇമ്പാക്ട്. അതുകൊണ്ടാണ് ദിസ് വിൽ മേക്ക് അവർ പ്രാക്ടീസ് മച്ച് ബെറ്റർ. നമ്മൾ റിസ്ക് എടുക്കുമ്പം നമുക്ക് അതാണ് ഞാൻ പറഞ്ഞത്, യു സോൾവ് ദ പ്രോബ്ലം, യു സോൾവ് ദ പ്രോബ്ലം ഓഫ് അതേഴ്സ്, ദെൻ യു വിൽ ബിക്കം റിച്ച് എവറി ആസ്പെക്ട്. അപ്പോൾ ഇത് അതിന്റെ മറ്റൊരു ബാൻഡേജിങ് ടെക്നിക്കാണ് നമ്മൾ ചെയ്തത്. ഇത് ഇമ്മൊബിലൈസ് ബാൻഡേജ് ആണ്. നമ്മൾ സാധാരണ ഇപ്പൊ എൽബോ ജോയിന്റിൽ ഫുൾ ഇമ്മൊബിലൈസ് ചെയ്യാറില്ല, ഇതോ ഇങ്ങനെ ചെയ്യാം. സൂപ്പിനേഷൻ പ്രൊണേഷൻ മാത്രം പ്രിവെന്റ്. ഇപ്പം ഉദാഹരണത്തിന് റേഡിയൽ ഹെഡ് ഫ്രാക്ചർ ആണെന്ന് വിചാരിക്കാം. വാട്ട് ഈസ് ദ ഫംഗ്ഷൻ ഓഫ് റേഡിയൽ ഹെഡ്? റേഡിയൽ ഹെഡിന്റെ ഫംഗ്ഷൻ എന്താ? അത് നമ്മൾ പഠിക്കണം. സൂപ്പിനേഷൻ പ്രൊണേഷനിൽ റേഡിയൽ നോച്ചിൽ ഇങ്ങനെ കറങ്ങുന്നതാണ് അല്ലേ? അതിന് ഇംഗ്ലീഷ് ഒന്നും മനസ്സിലാണ്, മലയാളത്തിൽ പറഞ്ഞാൽ മതി. നമ്മൾ ഇങ്ങനെ സൂപ്പനേഷൻ പ്രൊണൗൺസ് ചെയ്യുമ്പോൾ അപ്പൊ നമ്മൾ റേഡിയൽ ഹെഡ് ഫ്രാക്ചർ ഉണ്ടാകുമ്പോൾ സൂപ്പനേഷൻ പ്രൊണൗൺസ് അറസ്റ്റ് ചെയ്താൽ പോരെ? വൈ ഷുഡ് അബ്രേസ് ഫ്ലെക്ഷൻ എക്സ്റ്റൻഷനിൽ റേഡിയൽ ഹെഡിന് ഫംഗ്ഷൻ ഉണ്ടോ? ഇല്ല. ഓൺലി കോർണർ പ്രസസ് ഒലിക്കോണർ പ്രസസ് അവിടെയാണ് മൂവ്മെന്റ് ഇടുള്ളൂ. അപ്പം വൈ ഷുഡ് ബി ഇമ്മൊബിലൈസ് ദ ഓൾ മൂവ്മെന്റ്? ഇതാണ് ഏറ്റവും കൂടുതൽ സ്റ്റിഫ്നെസ്സിന് കാരണമാക്കുന്നത്. യു ഇമ്മൊബിലൈസ് ദ പ്രൊണേഷൻ ആൻഡ് supination and you can assist the flexion extension, then the radial head fracture can heal very wonderfully. Not at all. Now radial fracture excision is removed from the modern orthopedics also. They are also not doing radial head excision. ഇത് നമുക്ക് ചെയ്യാൻ പറ്റുന്ന. Now you can understood now why this family is living happily. And this is one of the another example you can see. Can anybody say what is the condition? The pre one you can see from here. മനസ്സിലാവണ്ട, പറഞ്ഞോളൂ. From this X-ray, what you can understand? This is spondylolisthesis. A patient with spondylolisthesis. Can anybody can imagine a sport person with spondylolisthesis can do a pole vault and get a national medal in breaking the record in the national meet? She was another athlete. And she was advised for surgery and avoid sports, to quit sports forever for many other orthopedic surgeons. But we are not given any IP treatment, only exercises and muscle balance treatment and relaxation, muscle relaxation and muscle strengthening, core stabilization exercise and functional training also. Ultimately, she became like this after 6 or 7 years. After taking the X-ray, this was the condition, and she became the national winner in the pole vault. This was her condition. This is the patient. And back pain, 80 months she had back pain, cannot practice or jump, pale white, bending spine, treated all tertiary level superspecialists, advised quit sports and complete go for surgery if pain not relief, Ayurveda treatment and massage and external medications, exercise for 3 months, and she became a national record holder. This is the advantage. So after that only we are also treating spondylolisthesis. It is not a surgical disease. We can treat that. If you are provided with good reduction and good traction method, you have to give skin traction and counter traction also on the upper thorax. That I will show you. The picture is here. And this is another athlete, Alina Jose. You can see the picture. And she was getting medal. And you have to enrich the people by enriching the health performance and sports performance and the physical condition. The sports medicine is not a medicine for sports. You have to give the all kind of facilities, exercises, nutrition, and your functional training. When the patient is coming to your clinic with the back pain or knee pain or any whatever may the pain, you should examine the patient by removing his whole dress. That is quite important. You're removing the, if you are treating an athlete, if a normal person also, it is quite mandatory, particularly locomotor system, musculoskeletal system. You should analyze the whole spine, whole leg. Why it is, I will show in the next slide. This is another one. You see, trimalleolar fracture. This is a trimalleolar fracture. There is a caption in the textbook. Policemen never march after trimalleolar fracture. This was treated by us 18 years before. Now we are taking so many trimalleolar fracture. So you can see after 2 years, the patient doesn't know which leg is affected. You can see that same patient X-ray here, trimalleolar fracture. After 12 years, we took the X-ray and patient doesn't know which leg is affected. And we took the case sheet from the hospital. At that time only we knew that the ankle joint is having defect. And we tried to get our video also. You can see no range of motion deficit. Meanwhile, one of my cousin sister, She has a trimalleolar fracture. She has done surgery from Thrissur. Still, after 20 years, she is getting deformity and joint movement restriction. So function restoration and subjective parameters is much better in conservative method as is concerned in Ayurveda compared to modern orthopedics. That is the main thing I have to evaluate you. Now, trimalleolar process, this is another trimalleolar fracture we have taken last few weeks before. You can see that also we one thing we could manage first, then you can realize this can be managed successfully. Otherwise, if you are sending the patients every time for surgery, you think that it could not be treated by Ayurveda. And yes, I am going to knee injury and back pain. Knee and back pain is closely related. Many of the patients after hip arthroplasty, knee pain will be going. Knee and hip has a close relation. Like ankle and knee has a close relation. Hip and back has a close relation. And the patient is come to your OP or the hospital with a back pain. You should analyze the knee joint. You should analyze the ankle joint. You should analyze the hip joint. Then only you will get a proper guideline to prevent the back pain and to rehabilitate it. That I am going to tell you today. That is a special subject. Today's subject I am going to invest. The rest of all the things just mentioning about the sports injuries and sports injury treatment. There are these type of treatment available in meniscal injury. You can see radial tear, horizontal tear, longitudinal tear, horizontal flap tear, parrot spiral tear, and bucket handle tear. These are the tears which can be seen in meniscus. But bucket handle tear is the grade 4 tear, which is quite mostly advised for surgery. That also can be managed conservatively, that I showed. But in my history, I have treated around 10 number of bucket handle tear. 4 of them only documented. Only 2 of them healed completely. 2 of them not healed as bucket handle tear is there. But they don't have any functional problem. That's the thing. 2 cases, bucket handle tear was not seen in the MRI. And 2 cases, bucket handle tear is there still after 1 year also. But the function, they don't have any extension deficit and flexion deformity, locking and instability, fearing of giving away always. And whenever you concern a patient is come to your OP with a knee injury, if the patient is having extension leg, you note the point, extension leg, recurrent locking and feeling of instability, try to avoid that patient. It will not get good result. If the patient is having this extension lag means extension deficit. When we are treating all the patient, we always look for the flexion. But in the knee injury, you always look for the extension first, not for the flexion. Flexion you will get by the time progress. But the extension, if you are not getting for the first time, it won't get forever. So extension is the prime important in the knee injury. So if there is you put the hand below the knee and try to tell the patient to give a pressure on the hand. So when you are getting the pressure on the hand, good pressure, and your hand cannot be pulled out, there is a good extension. So you compared with the normal leg and the injured leg. So if it's a good extension, you can do the treatment. And second thing, recurrent locking. Some locking in extension flexion locking is there. That is also bad indication. And always feeling of giving away, highly instability. When walking, the patient is getting a feeling of dislocation. That also cases will be again function restoration and joint stability will be worse. In such condition, you don't take the treatment and you send the patient to anywhere, no problem for surgery or something. Otherwise, all the patient with the knee injury and meniscal tear, you can treat with, if you are having good exercise protocol, good strength training, you can treat definitely. Your patient will not have any problems in the future. And first of all, many of the patient will come to your OP with injury. You do immobilization for a period of 2 weeks. That is, you have to do the immobilization in a 15 to 30 degree flexion, not in the straight always, slight flexion, you have to immobilize the knee joint. That's the first principle. And you must understand one thing, the meniscal injury doesn't need any hard fall or something. We have history. ഞാൻ മലയാളത്തിൽ പറയുകയാണെങ്കിൽ നമുക്കുണ്ടായ ഏറ്റവും ലഘുവായ മെനിസ്കൽ ഇഞ്ചുറി ഏതെന്ന് ചോദിച്ചാൽ, വീട്ടിൽ നിന്ന് രാവിലെ കുട്ടികൾ പുതപ്പ് വലിക്കൂലേ കിടക്കുന്ന സമയത്ത്, ബ്ലാങ്കറ്റ് വലിച്ച ഒരു സ്ത്രീന്റെ കാല്, വീട്ടമ്മന്റെ കാല് ബ്ലാങ്കറ്റിന്റെ ഉള്ളിൽ കുടുങ്ങിയ ആംഗിള്, അത് തിരിഞ്ഞപ്പോൾ മുട്ടിനുള്ള ചെറിയ ശബ്ദം, ഒന്ന് നോക്കിയപ്പോൾ മെനിസ്കൽ ഇഞ്ചുറി. നമുക്കത് കേട്ടപ്പോഴേ മെനിസ്കൽ ഇഞ്ചുറി, അതൊരു സ്ത്രീക്ക് ഉണ്ടായത്. പിന്നെ ഏറ്റവും കൂടുതൽ മെനിസ്കൽ ഇഞ്ചുറി, ലിഗമെന്റ് ഇഞ്ചുറി ആണ് ലെഫ്റ്റ് ലെഗിനാണ്. നമ്മളെ ക്ലിനിക്കിൽ നമ്മൾ നടത്തിയൊരു പഠനത്തിൽ 56% of the injuries coming on the left, especially in the males. Why? പറയാൻ പറ്റുമോ? Right, dominant strength, that's one reason. Another reason, male കാരണം they are bike riders. ബൈക്ക് റൈഡേഴ്സിന് എപ്പോഴും ലെഫ്റ്റ് നീക്ക പരിക്ക് പറ്റുക. എന്താ കാരണം? എന്താ കാരണം? അതുകൊണ്ട് ബൈക്ക് ഓടിക്കാൻ നമ്മൾ പറയില്ല, പക്ഷെ സ്കൂട്ടി ഓടിക്കാൻ പറയും, ഫസീൻ ഓടിക്കാം. കാരണം എന്താ? മറ്റേത് കാല് കുത്തി ഇങ്ങനെ റൊട്ടേറ്റ് ചെയ്തെടുക്കാം. ഒരു കാല് ഗ്രൗണ്ടിൽ ഫിക്സ്ഡ് ആയിട്ട് നിൽക്കുമ്പോൾ അപ്പർ ബോഡി റൊട്ടേറ്റ് ചെയ്യുക, എക്സ്റ്റേണൽ റൊട്ടേറ്റ് ചെയ്യുക. ഈ റൊട്ടേറ്റ് ചെയ്യുമ്പോൾ ഇങ്ങനെ ചെയ്യുന്ന സമയത്ത് മെനിസ്കൽ ഇഞ്ചുറി കോമണാണ്. അപ്പൊ എല്ലാവർക്കും ഇടത് കാലിനാണ് മെനിസ്കൽ ഇഞ്ചുറി വരുന്നത്. പക്ഷെ നമ്മളെ ക്ലിനിക്കിൽ ബൈക്ക് ഓടിച്ച് വരുന്ന ആളോട് നമ്മൾ പറയും, നിങ്ങൾ ബൈക്ക് ഓടിക്കരുത്, കാരണം ബൈക്ക് ഓടിച്ചാൽ ഇഞ്ചുറി വരും. That should be your advice, do's and don'ts. Don't do bikes. നിങ്ങൾക്ക് ഇത് ഓടിക്കാം, സ്കൂട്ടി ഓടിക്കുക, നമ്മളെങ്ങനെ കാലുള്ളിലേക്ക് ഇറക്കി വെച്ചിട്ട് ഓടിക്കുന്നത്, മറ്റേ ബൈക്ക് ഓടിക്കരുത്. സ്ത്രീകൾക്കും ഇടത്തെ കാലിനാണ് കൂടുതൽ, പക്ഷെ പ്രൊഡോമിനന്റ്ലി മെയിൽസിനാണ് ഏറ്റവും കൂടുതൽ ഇടത്തെ കാലിന് പരിക്ക് വരുന്നത്. ഇടത്തെ കാലിൽ പരിക്കാൻ നമ്മൾ ലീസ്റ്റ് ഞാൻ പറഞ്ഞു, ബെഡ്ഷീറ്റ് മാറ്റുമ്പോഴാണ് ഒന്ന് കഴിയണയോ മാഡം? 15 minutes ആണ്. ഒരു പ്രശ്നം എന്താ അറിയോ, എനിക്ക് 2020 ക്രിക്കറ്റ് കളിക്കാൻ അറിയില്ല. നമ്മൾ ടെസ്റ്റ് പ്ലെയർ ആണ്. അതുകൊണ്ട് ഞാൻ സബ്ജക്റ്റ് ഇങ്ങോട്ട് വരുമ്പോ തന്നെ ഞാൻ പറഞ്ഞു, ഞാനൊരു ക്ലാസ് എടുക്കുമ്പോൾ മിനിമം 3 hours 4 hours ക്ലാസ്, ഇത് 1 hour കൊണ്ട് എങ്ങനെ ചെയ്യുന്നുള്ളത് ഒരു പിടിയില്ല, എന്നാലും മാക്സിമം തീർക്കാം. അപ്പൊ ലെഫ്റ്റ് നീക്ക് നമ്മൾ പറഞ്ഞ ലെഫ്റ്റ് നീയിൽ ഉണ്ടാവുന്ന ഇഞ്ചുറിക്കാണ് കൂടുതൽ നടന്നത്. ഇനി നീ ഇഞ്ചുറിന്റെ ഏറ്റവും ലീസ്റ്റ് പോസിബിൾ ആയിട്ട് പറഞ്ഞ ഒരാൾക്ക് ഉണ്ടായത്, ഹിസ്റ്ററി നിങ്ങൾ പറയുമ്പോൾ മനസ്സിലാക്കാൻ വേണ്ടിട്ട് കേട്ടോ, ഒരാള് സോഡ മൂടിയില്ലേ, സോഡന്റെ മൂടി തട്ടിയതാണ്, മുട്ടിനുള്ളതൊരു പെയിന്. അപ്പൊ ഞാൻ പറഞ്ഞത് മുട്ടത്തിന്റെ പാട പൊട്ടിയതായിരിക്കും. അപ്പൊ ഈ പാടക്ക് ഇത്ര ഉറപ്പില്ലെന്ന് വെച്ചാൽ അയാൾ എന്നോട് ദേഷ്യം പിടിച്ച് ചോദിച്ചാണ്, ഈ പാടക്ക് ഇത്ര ഉറപ്പില്ല, സോഡ മൂടി തട്ടിയാലുള്ള ഉറപ്പുള്ളൂ. അപ്പൊ ഞാൻ ഇത് എത്രയോ കേസ് കണ്ടത് കൊണ്ട് നമ്മളിത് പറഞ്ഞ് മനസ്സിലാക്കി കൊടുക്കണ്ടേ. അപ്പൊ ഇയാൾ പറയുന്ന ഉടനെ ചെയ്യാന്ന് വെച്ചാൽ ഞാൻ എന്റെ സാറിന് റെഫർ ചെയ്യും, ഡോക്ടർ ഷില്ലർ ജോസ്, ബേബി എംആർ ഹോസ്പിറ്റൽ കോഴിക്കോട് റെഫർ ചെയ്യും. ഉടനെ മൂപ്പര് പിന്നെ നോക്കില്ല, ടേക്ക് MRI. നമ്മൾ പറയുമ്പോൾ നമുക്ക് MRI എടുക്കണമെങ്കിൽ അവരെ കൺവിൻസ് ചെയ്ത് പറഞ്ഞേക്കണം. ഇപ്പൊ അതൊന്നും വേണ്ട കേട്ടോ, ഇപ്പൊ നമ്മൾ പറഞ്ഞ ഉടനെ എടുക്കും. ആദ്യമൊക്കെ തുടക്കത്തിൽ അങ്ങനെയായിരുന്നു, പറഞ്ഞ് കൺവിൻസ്. ഇപ്പം വേണ്ടവർ വന്നാൽ മതി, അത്രയുള്ള പേഷ്യൻസ്, സഫിഷ്യന്റ് പേഷ്യൻസ്, വി ഹാവ് സഫിഷ്യന്റ് പേഷ്യൻസ്. പക്ഷെ ഫസ്റ്റ് നമ്മൾ തുടക്കത്തിൽ നമ്മളെല്ലാം പേഷ്യൻസിനെ കുളിപ്പിച്ച് സോപ്പിട്ട് അങ്ങനെ പറഞ്ഞിട്ട് വരും. അപ്പൊ ഇനീഷ്യലി ഇപ്പൊ ഈ ഡോക്ടർ എന്ന ഉടനെ തന്നെ MRI എടുക്കാൻ പറഞ്ഞു. MRI എടുത്ത് പറഞ്ഞ് മെനിസ്കൽ ഇഞ്ചുറി, കം ടു മൺഡേ ഫോർ ആർത്രസ്കോപ്പി. അപ്പൊ അത്രേ ഉള്ളൂ, ഓപ്പറേഷൻ ചെയ്യണം. ഇയാൾ നേരെ റബ്ബർ പന്ത് അടിച്ചു വിടുന്നത്, നിങ്ങൾ പറഞ്ഞ പോലെ തന്നെ ഡോക്ടർ പാട പൊട്ടി, ഓപ്പറേഷൻ വേണം. അപ്പൊ ഇതാണ് നമ്മൾ സോഡ മൂടി തട്ടിയിട്ടുള്ളൂ. അപ്പൊ നിങ്ങൾ ക്ലിനിക്കിൽ വരുന്ന പല നീ ഇഞ്ചുറീസും നമ്മൾ സസ്പെക്ട് ചെയ്യണം. നിങ്ങളത് വാദവ്യാധിയാണെന്നോ അല്ലെങ്കിൽ സന്ദിഗ്ധവാദമെന്നോ മറ്റൊന്ന് പറഞ്ഞ് ട്രീറ്റ് ചെയ്യാൻ നിൽക്കരുത്. ഇപ്പൊ വരുന്ന 40s വരുന്ന അധിക പേഷ്യൻസിന്റെ നീ ഇഞ്ചുറി, നീ പെയിന്റെ റീസൺ മ്യൂക്കോയിഡ് ഡിജനറേഷൻ. സ്ത്രീകളിലെ ഏറ്റവും കൂടുതൽ മിക്സോയിഡ് ഡിജനറേഷൻ. ഹോസ്പിറ്റലിൽ പോയാൽ നേരെ MRI, ഓപ്പറേഷൻ, ആർത്രസ്കോപ്പി. അപ്പൊ ഈ ആർത്രസ്കോപ്പി ചെയ്ത് കഴിഞ്ഞാൽ എന്താ, പിന്നെ ആർത്രോഫൈബ്രോസിസ് 2 വർഷം കഴിയുമ്പോൾ അവർ പറയും, 5 വർഷം കഴിയുമ്പോൾ വീണ്ടും വേദന വരുമ്പോൾ പറയും, ഓ അന്നത്തെ സർജറിന്റെ അല്ല, ഇത് നിങ്ങൾക്ക് ഇപ്പം വേറെ തേയ്മാനാണ്, നിങ്ങൾ അന്നത്തെ പ്രശ്നമല്ല. പക്ഷെ എന്തുകൊണ്ടാണ് ഈ തേയ്മാനം വന്നത്? ഉള്ളിലത്തെ മെനിസ്കസ് എടുത്ത് കളഞ്ഞോണ്ടാണ്. ഈ പാവങ്ങൾക്ക് അറിയില്ല. യു ഹാവ് ടു എഡ്യൂക്കേറ്റ് ദ പേഷ്യന്റ്. നമ്മളാണ് പേഷ്യന്റ് എഡ്യൂക്കേഷൻ. ഈ മെനിസ്കൽ ഇഞ്ചുറി റിപ്പയർ ചെയ്തിട്ടാണ് എല്ലാവർക്കും എന്ത് വരുന്നത്, ആർത്രൈറ്റിസ് വരുന്നത്, ആർത്രോഫൈബ്രോസിസ്, ആർത്രൈറ്റിസ്. ഇപ്പൊ മോഡേൺ മെഡിസിനിലെ പല ഡോക്ടേഴ്സും ആർത്രസ്കോപ്പി ചെയ്യുന്നില്ല. ഈവൻ ഞാൻ സ്പെയിനിൽ സ്പോർട്സ് മെഡിസിൻ കോൺഫറൻസിന് പോയെന്ന്, ഈ മെസ്സി, റൊണാൾഡോനൊക്കെ ട്രീറ്റ് ചെയ്യുന്ന ഹോസ്പിറ്റൽ ക്യൂറോൺ ഉണ്ട്. അവിടെ കുറച്ചു കാലം ട്രെയിനിങ്ങിന് സിൽവിയ എന്ന് പറഞ്ഞ മേഡം, അവരെ സോപ്പിട്ട് കുറച്ചു നേരത്തെ അവിടെ നിന്നു. അപ്പൊ അവിടെ വലിയൊരു ഓർത്തോപെഡിക് സർജൻ, പുള്ളിന്റെ റൂമിൽ പോയപ്പോ ഞാൻ അന്താളിച്ചു പോയി. FA കപ്പ്, യൂറോപ്യൻ കപ്പ്, വേൾഡ് കപ്പ്, ഇതിനൊക്കെ പോയിട്ടുള്ള കംപ്ലീറ്റ് ടാഗുകൾ നിറച്ച് തൂങ്ങിക്കിടക്കുക അവിടെ. ഇയാള് എല്ലാ ഫേമസ് ഡോക്ടേഴ്സും ചികിത്സിക്കുന്ന ആളാണ് അവിടെ. പക്ഷെ റിസപ്ഷനിലും കൗണ്ടറിലൊന്നും ആരില്ല. പുള്ളി തന്നെ പുറത്തിറങ്ങും, പുറത്തിറങ്ങിയിട്ട് നിങ്ങൾ ഇരിക്കുന്ന വന്നിട്ട് ഫയൽ എടുത്തിട്ട് വിളിച്ചുകൊണ്ട് പോവുക. റിസപ്ഷൻ ഇയാളിനെ വിളിച്ചുകൊണ്ടൊക്കെ പടഞ്ഞു കൊടുത്തെടുത്തിട്ട് ഒരു സർജറിയും ചെയ്യില്ല. PRP ഇഞ്ചക്ഷന് അല്ലെങ്കിൽ ഒരു എക്സസൈസ് പറഞ്ഞിട്ട് വിസിറ്റ്. അപ്പൊ ആഫ്റ്റർ 40 അവിടെ സർജറി ചെയ്യുന്നില്ല. അപ്പൊ സർജറിയിൽ ഔട്ട്കം കുറവാന്ന് പറഞ്ഞു. ഈ സർജറി കണ്ടുപിടിച്ച സ്പെയിനിലും ഇംഗ്ലണ്ടിലൊക്കെ ഈ സർജറി ചെയ്യുന്നില്ല. നമ്മുടെ നാട്ടിൽ നേരെ സർജറി. അപ്പൊ ഇത് നമ്മൾ നിങ്ങളെടുത്ത് വരുന്ന പേഷ്യൻസിനെ നന്നായി എഡ്യൂക്കേറ്റ് ചെയ്യണം. വെറുതെ ആവശ്യമില്ലാതെ സർജറി ചെയ്യാം. മെനിസ്കസ് സർജറി ചെയ്താൽ അവർ വരെ തേയ്മാനം വരും. സർജറി ചെയ്തിട്ടാണ് തേയ്മാനം വരുന്നത്. സർജറി ഈസ് മേക്കിംഗ് മച്ച് മോർ ഡിഫക്റ്റ്. നമ്മൾ ഇതിന്റെ ഒരു ഡെമോൺസ്ട്രേഷൻ സ്റ്റഡി വെച്ചതാണ്. സർജറി ചെയ്തതിന് ശേഷം 3 years ആഫ്റ്റർ സർജറി കണ്ടോ ഒരു ഡിഫോമിറ്റി ഇല്ലാത്തൊരു കുട്ടി 3 വർഷം വയസ്സ് കണ്ടോ 19 വയസ്സായിട്ടുള്ളൂ. ഷീസ് ഹാവിംഗ് അബ്ദുൽ മജീദ് ഹാവിംഗ് 19 years. ആർത്രൈറ്റിസ് 3 വർഷം കഴിഞ്ഞപ്പോൾ ആർത്രൈറ്റിസ് വന്നു. യു ക്യാൻ ദി ദ സ്ക്രൂ ദർ ACL റീകൺസ്ട്രക്ട് ചെയ്താ. ഇതാണ് വാട്ട് ഇസ് ദ ഔട്ട്കം ഓഫ് സർജറി. നമ്മൾ ഇങ്ങനെ ചെയ്തു കഴിഞ്ഞാൽ കേട്ടോ ഇയാളിപ്പോ ഇത് ബനിയൻ കണ്ടാൽ മനസ്സിലാവും. കാലിക്കറ്റ് മെഡിക്കൽ കോളേജിലെ പയ്യനാ. അവര് പല കോഴിക്കോട് മെഡിക്കൽ കോളേജിലെ ക്യാപ്റ്റൻ, നമ്മളെ കുഹാസിന്റെ ക്യാപ്റ്റൻ കോഴിക്കോട് മെഡിക്കൽ കോളേജ് സ്റ്റുഡന്റ്. പുള്ളിയൊക്കെ പരിക്കുറ്റി നമ്മുടെ അടുത്തേക്ക് വരും. അവിടെ പ്ലാസ്റ്റർ ഇട്ടില്ല, പുള്ളി പ്ലാസ്റ്റർ കിട്ടി നമ്മുടെ അടുത്ത് വരും. അപ്പൊ ഇറ്റ് ഗെയിൻ ആക്സെപ്റ്റൻസ്. മോഡേൺ മെഡിസിനിൽ ഒരുപാട് ഡോക്ടേഴ്സ്, നമ്മളിപ്പോ ഓർത്തോപെഡിക് സർജൻസ്, അതുപോലെ ഡെർമറ്റോളജിസ്റ്റ്, ഒരുപാട് പേഷ്യൻസ് നമ്മുടെ അടുത്ത് ഇപ്പൊ മേജർ ഹോസ്പിറ്റൽ ആളുകൾ നമ്മുടെ ട്രീറ്റ്മെന്റ് ആക്സെപ്റ്റ് ചെയ്തിട്ട് വരുന്നുണ്ട്. അവർക്കറിയാം ഇത് മാറുന്നുണ്ട്. പക്ഷെ പ്രൊഫഷണലി അവർ അംഗീകരിക്കില്ല, പേഴ്സണലി എല്ലാവരും അംഗീകരിക്കും. അതിന്റെ ഒരു കോംപ്ലിക്കേഷൻസ് ആണ്. ഇതാണ് ഞാൻ പറഞ്ഞ ബക്കറ്റ് ഹാൻഡിൽ ടിയർ ഹീൽ ചെയ്തൊരു പയ്യന്റെ റിപ്പോർട്ട്, അനസ് ഷെരീഫ്. യു ക്യാൻ സി there is no bucket handle tear in the repeated MRI after 1 year. And 2 cases we are documented and 4 cases totally documented. Only 10 cases only we got for 6 of them not came for the review and they are in the abroad. We are trying to make it out all the things. And under MRI complete heal ആയി, രണ്ടെണ്ണം ഹീൽ ആയിട്ടില്ല. ഇനി ഇത് നമ്മൾ കഴിയണേ മാഡം 5 minutes കേട്ടോ. ഇത് റെക്കറന്റ് ഷോൾഡർ ഡിസ്ലൊക്കേഷൻ വന്നു കഴിഞ്ഞാൽ ഇങ്ങനത്തെ ഒരാള് ഗ്രൗണ്ടിൽ പോകുന്നതിന് മുമ്പ് നമ്മൾ അയാളെ എങ്ങനെ അറിയാം? ഒരു കിനിസിയോ ടേപ്പിംഗ്. ദീസ് ആർ ദ ടെക്നിക് വാട്ട് വി ക്യാൻ അഡോപ്റ്റ് ഇൻ യുവർ ക്ലിനിക്കൽ പ്രാക്ടീസ്. ആന്റീരിയർ ഡിസ്ലൊക്കേഷൻ പ്രിവെന്റ് ചെയ്യാൻ ചെയ്യുന്നതാണ് കേട്ടോ. ഇങ്ങനെയാണ് കിനിസിയോ ടേപ്പിംഗ് ചെയ്യാം. റെക്കറന്റ് ഡിസ്ലൊക്കേഷൻ ഉള്ള ഒരാളെ ഗ്രൗണ്ടിലേക്ക് പോവുകയാണെങ്കിൽ വി ഹാവ് ടു ഡു ടേപ്പിംഗ് വിച്ച് വിൽ ദിസ് ഫങ്ഷൻ റെസ്ട്രിക്ട് ചെയ്യില്ല. പക്ഷെ ഇതിന്റെ മൂവ്മെന്റ് ആണ് നമ്മൾക്ക് ഈ ഡിസ്ലൊക്കേഷൻ. സാധാരണ ബാൻഡേജിന് എന്തോ ഫങ്ഷൻ റെസ്ട്രിക്ട് ചെയ്യും, പക്ഷെ കിനിസിയോ ടേപ്പ് ഫങ്ഷൻ റെസ്ട്രിക്ട് ചെയ്യില്ല, പക്ഷെ ഇമ്മൊബിലൈസേഷൻ ഉണ്ടാവും ചെയ്യും. ഇത് മറ്റൊരു ട്രീറ്റ്മെന്റ്. നമ്മുടെ സൂചിവേദ ചികിത്സ നമ്മൾ പറയുന്ന പോലെ മെനിസ്കൽ ഇഞ്ചുറി, അതുപോലെ പെറ്റലാർ ടെൻഡനൈറ്റിസ്, അതുപോലെ റിട്രോകാൽക്കൈനൽ ബേഴ്സൈറ്റ്സ്, ടെൻഡനോപ്പതിക്ക് വളരെ എക്സലന്റ് റിസൾട്ടാണ്. പെയിൻ ട്രിഗർ റിലീസിംഗ് ആണ് നമ്മൾ ചെയ്യുന്നത് നീഡിൽ സ്റ്റിമുലേഷൻ. ഇതെങ്ങനെ നീഡിൽ സ്റ്റിമുലേറ്റ് ചെയ്യുക, ഇന്റർ ആർട്ടിക്കുലറിൽ നീഡിൽ സ്റ്റിമുലേറ്റ് ചെയ്യേണ്ട ഇത് കാണിച്ചു തരാം വീഡിയോ. ഇവിടെ ട്രിഗർ ഇല്ലെന്ന് നോക്കി ഞാൻ വീഡിയോ ഒന്നുകൂടെ ഫാസ്റ്റ് ചെയ്യാം. ഏത് നീഡിലെ സെലക്ട് ചെയ്യുന്നത് കാണിച്ചു. സോറി, ഇത് കോൺട്രോമലേഷ്യ പെറ്റലിലുള്ള പേഷ്യന്റ് ആണ്, CMP. ഭയങ്കര ബുദ്ധിമുട്ടായി പെയിൻ മാറാം. അപ്പോ നമ്മള് നീ റീഹാബിലിറ്റേറ്റ് ചെയ്യുമ്പോൾ നമ്മൾ മനസ്സിലാക്കേണ്ട ഒരു കാര്യം, നീ റീഹാബിലിറ്റേറ്റ് ചെയ്യുമ്പോൾ നമ്മൾ എപ്പോഴും എക്സസൈസ് കൊടുക്കും. ഈ എക്സസൈസ് കൊടുക്കുമ്പോൾ കോൺസെൻട്രിക് സ്ട്രെങ്ത് ട്രെയിനിങ് ഉണ്ടാവും. ഞാൻ പറഞ്ഞില്ല 2 തരം ട്രെയിനിങ്. കോൺസെൻട്രിക് സ്ട്രെങ്ത് ട്രെയിനിങ് ഉണ്ടാകുമ്പോൾ ക്വാഡ്രിസെപ്സ് മസിൽ എന്താവും? ടൈറ്റ് ആവും. ടൈറ്റ് ആവുമ്പോൾ എന്ത് സംഭവിക്കും? പെറ്റെല്ലാം മേലോട്ട് കയറും. മനസ്സിലായോ? പെറ്റെല്ലാം മേലോട്ട് കയറാൻ നമ്മളെപ്പോഴും കോൺസെൻട്രിക് സ്ട്രെങ്ത് ട്രെയിനിങ് ചെയ്യണ്ടേ. പക്ഷേ ഈ നമ്മളെ പെറ്റലാർ ടെൻഡനൈറ്റിസ് അതുപോലെ കോൺട്രോമലേഷ്യ പെറ്റൽ ഉണ്ടായ എന്ത് എക്സസൈസ് കൊടുക്കരുത്? വെയിറ്റ് ട്രെയിനിങ് എക്സസൈസ് കൊടുക്കരുത്. അത് കൊടുത്താൽ എന്താവും? ഇറ്റ്സ് കോൺട്രാ ഇൻഡിക്കേറ്റഡ്. അത് ചെയ്താൽ എന്തുണ്ടാവും? വീണ്ടും പെറ്റലർ ടൈറ്റ് ആവും. പെറ്റലർ ടെൻഡൻ ടൈറ്റ് ആവുമ്പോഴാണ് ഈ കോൺട്രോമലേഷ്യ പെറ്റൽ വരുന്നത്. അപ്പൊ നമ്മൾ അതിന് എക്സെൻട്രിക് സ്ട്രെങ്ത് ട്രെയിനിങ് കൊടുക്കേണ്ടത്. മസിൽസിനെ സ്ട്രെച്ച് ചെയ്യണം. ക്വാഡ്രിസെപ്സ് മസിൽസിനെ സ്ട്രെച്ച് ചെയ്തുകൊണ്ടുള്ള ഒരു സ്ട്രെങ്ത് ട്രെയിനിങ് കൊടുക്കുന്നത്. അത് എക്സെൻട്രിക് സ്ട്രെങ്ത് ട്രെയിനിങ് എന്ന് പറയും. അത് ചെയ്താൽ കോൺട്രോമലേഷ്യ പെറ്റൽ പോകും. അത് നമ്മൾ മുട്ടുവേദന പേഷ്യന്റ് നമ്മുടെ അടുത്ത് വേദനയായിട്ട് മെനിസ്കൽ ഇഞ്ചുറി ലിഗമെന്റ് ഇഞ്ചുറി ഒക്കെ ആയിട്ട് വരും. ആഫ്റ്റർ ഓൾ ഒരു 5 months കഴിഞ്ഞ് മെനിസ്കൽ ഇഞ്ചുറി ഒക്കെ ഹീൽ ആയിട്ടുണ്ടാവും. പക്ഷെ പേഷ്യന്റിന് പെയിൻ മാറിയിട്ടുണ്ടാവില്ല. അവർ പറയും വേദനയ്ക്ക് ഒരു കുറവില്ല. പക്ഷെ നമ്മളത് മനസ്സിലാക്കണം. ആ വേദന ആവില്ല. പക്ഷെ പേഷ്യന്റിന് ഏത് വേദന ആയാലും വേദനയാണ്. നമ്മൾ ട്രീറ്റ് ചെയ്ത അസുഖം മാറിയിട്ടുണ്ടാവും. നമ്മളത് പേഷ്യന്റിനോട് നിങ്ങൾ മെനിസ്കസിലല്ല അത് മാറി. പക്ഷെ പേഷ്യന്റ് എന്താ വേണ്ടത്? വേദന മാറി വേണ്ട. വേദന മാറുന്നുണ്ടെങ്കിൽ നമ്മൾ പെറ്റലാർ ടെൻഡനെ റിലീസ് ചെയ്യണം. അതിന് എക്സെൻട്രിക് സ്ട്രെങ്ത് ട്രെയിനിങ് കൊടുക്കണം. അതിൻ്റെയൊക്കെ വീഡിയോ ഇതിലുണ്ട്. ഇതിൽ നമ്മൾ മറ്റൊരു ട്രീറ്റ്മെന്റ് പ്രൊസീജിയർ ചെയ്യുന്ന കോമ്പിനേഷൻ വാക്വം തെറാപ്പി, അതുപോലെ ഇന്റർ ആർട്ടിക്കുലർ നീഡിൽ സ്റ്റിമുലേഷൻ. ഇത് മറ്റൊരു കേസ് ഓഫ് മോട്ടൺസ് ന്യൂറോമ. ഇതൊരു അത്ലറ്റ് ആണ്, ഫുട്ബോൾ പ്ലെയർ ആണ്. ഈ ഫുട്ബോൾ പ്ലെയറിൽ ഭയങ്കര ഇത് വളരെ പലപ്പോഴും വരുന്നൊരു മിസ് ചെയ്യുന്ന കാര്യമായിട്ടാണ്. നമ്മൾ ക്ലിനിക്കിൽ സിവിയർ പെയിൻ, ഫുഡ് പെയിൻ, കാല് നിലത്ത് കുത്താൻ പറ്റില്ല ആള് വരുമ്പോൾ. അപ്പൊ നമ്മൾ 3rd and 4th മെറ്റാടാർസലിന്റെ ഇടയിൽ പ്രസ് ചെയ്ത് നോക്കുക. അവിടെ പെയിൻ ഉണ്ടെങ്കിൽ അവിടെ ഒരു കുഷ്യൻ പാഡ് വെച്ചിട്ട് ഇതേപോലെ പാഡ് വെച്ചിട്ട് ടേപ്പ് ചെയ്ത് നടക്കാൻ പറഞ്ഞാൽ പേഷ്യന്റ് ഇൻസ്റ്റന്റ് നടക്കും. സിമ്പിൾ ടെക്നിക്, നടക്കാൻ പറ്റും. അവിടെ മോട്ടോസ് നെർവ് അതിനുള്ളിൽ എൻട്രാപ്പ് ചെയ്യാണ്. അപ്പൊ ഒരു പ്രഷർ പാഡ് കൊടുത്തു കഴിഞ്ഞാൽ ഈ നെർവ് അവിടെ നിന്ന് റിലീസ് ആവും. ഈസി ആയിട്ട് നടക്കാൻ പറ്റുന്നത് നമ്മൾ ക്ലിനിക്കലി ഏറ്റവും കൂടുതൽ യൂസ്ഫുൾ ആയിട്ടുള്ള കാര്യമാണ്. അതേപോലെ ഇങ്ങനെ ഒരു ക്ലാവിക്കൽ ഫ്രാക്ചർ വന്നു കഴിഞ്ഞാൽ യു നെവർ ബാൻഡേജ് ഇറ്റ്. മനസ്സിലായോ? അതിന് ബാൻഡേജ് കൊടുക്കരുത്. ഓൺലി യു ഗീവ് സ്ലിംഗ്. പക്ഷെ ബാൻഡേജ് കൊടുത്താൽ ഇങ്ങനെ ആവും. ഇഫ് യു ഹാവ് എ മിഡിൽ clavicle injury with slightly downward displaced distal end, never give a clavicular bandage. You give a abduction or something like this kind of bandage, sling. അല്ല കൊടുത്തു കഴിഞ്ഞാൽ ഇത് നമുക്ക് ഒരുപാട് അനുഭവമുണ്ട്. ഒരുപാട് പേഷ്യൻസിന് അനുഭവം ഉള്ളതുകൊണ്ടാണ് ഇങ്ങനെ ഒരു ഡിമാർക്ക് വരാൻ പാടില്ല, ചെയ്യരുത്. ഇനി മാനിപ്പുലേഷൻ ടെക്നിക്സിലെ ലാസ്റ്റ് ഒരു വീഡിയോ കൂടി കാണിക്കാം. ടൈം ഇല്ല മനസ്സിലാക്കാം. ഇത് കോഡൈക്വിന കംപ്രഷൻ 0.6 millimeter കനാൽ ഡയമീറ്ററിലുള്ള ഒരാളാണ്. അഡ്വൈസ് ഫോർ സർജറി. സ്പോർട്സ് പേഴ്സൺ, ഫുട്ബോൾ പ്ലെയർ ആണ്. ഇത് നമ്മൾ അതിന്റെ മെത്തേഡ് ഇതിലൂടെ ഉണ്ടായിരുന്നു. ഇവിടെ ചെയ്ത ട്രീറ്റ്മെന്റ് മെത്തേഡ് ടൈം ഉണ്ടെങ്കിൽ കാണിക്കാം. ഒരു 3 days കൊണ്ട് പുള്ളിക്കുണ്ടായി ചേഞ്ച്. ഓൺലി സിമ്പിൾ മാനിപ്പുലേഷൻ. Patient is Vinay Varghese from Thrissur. അപ്പോൾ ഇതിന്റെ മാനേജ്മെന്റ് അതിന്റെ കുറെ വീഡിയോസ് ഉണ്ട്, സമയമില്ലാത്തതുകൊണ്ട് കാണിക്കാം. ജസ്റ്റ് ഒന്ന് കാണിച്ചിട്ട് വരാം. ഇതിന്റെ ലിംബ് ലെങ്ത്, ബോഡി പ്രപ്പോർഷനും ബാക്ക് പെയിനും വരാനുള്ള ഒരുപാട് റീസൺ ഉണ്ട്. അപ്പർ ബോഡിക്ക് ഉണ്ടാവുന്ന ഹൈറ്റും ലോവർ ബോഡിന്റെ ഹൈറ്റും നമ്മളെ ബാക്ക് പെയിൻ എങ്ങനെ കൂട്ടുന്നുള്ളതാണ്. അതായത് ഗ്രേറ്റർ റിസ്ക് ഓഫ് ഡെവലപ്പിംഗ് ബാക്ക് പെയിൻ, ലോങ് ലെഗും ഷോർട്ട് ലെഗും ലോങ് ടോർസും ഉണ്ടാവുന്ന ആൾക്ക് ബാക്ക് പെയിൻ കൂടുതലായിരിക്കും. നേരെ മറിച്ച് ലോങ് ലെഗും ഷോർട്ട് ടോർസും ഉള്ള ആൾക്കാർക്ക് ഹിപ്പ് ആൻഡ് നീ പെയിൻ ആയിരിക്കും കൂടുതലുണ്ടാവുക. ഇതൊരു സ്റ്റാറ്റിസ്റ്റിക്കൽ ആയിട്ടുള്ള ഒരു ബയോമെക്കാനിക്കൽ കൈനമാറ്റിക് സ്റ്റഡിയാണ്. അപ്പോൾ അതിനുള്ള കാരണം നമ്മുടെ അപ്പർ ക്രോസ് സിൻഡ്രോം എന്ന് പറയും. നമ്മളെ ബോഡി ഇങ്ങനെ പല ആളുകൾക്കും ഇത് എൻ്റെ ഒരു പേഷ്യന്റ്, എൻ്റെ ഒരു ഫ്രണ്ട് തന്നെയാണ്, എഞ്ചിനീയർ. പുള്ളി സൗദിയിൽ 17 വർഷം ഇരുന്ന് ജോലി ചെയ്തല്ല. പുള്ളിക്ക് ഭയങ്കര ബാക്ക് പെയിൻ. ഇപ്പൊ ബാക്ക് പെയിൻ റീസൺ എന്താ? നമ്മൾ അപ്പർ ക്രോസ് സിൻഡ്രോം. അപ്പൊ ഇതാണ് നമ്മൾ കറക്റ്റ് ചെയ്യേണ്ടത്. പലപ്പോഴും ബാക്ക് പെയിന്റെ റീസൺ ബാക്ക് പെയിൻ ആവില്ല, അപ്പർ ക്രോസ് സിൻഡ്രോം കൊണ്ട് ഉണ്ടാകുന്ന സ്ട്രെയിൻ വരുന്ന പെയിൻ. അപ്പൊ ഞാൻ എന്നെ വെച്ച് കമ്പയർ ചെയ്താണിത് പുള്ളിക്ക് കാണിച്ചൊരു കണ്ടിട്ട്. അപ്പൊ ഇതാണ് നോർമൽ എന്നുള്ളൊരു കൈഫോട്ടിക് പോസ്റ്റർ വരുമ്പോൾ ഉണ്ടാവുന്ന ഒരു ഡിഫക്റ്റ് എപ്പോഴും നമുക്ക് ബയോമെക്കാനിക്കലായിട്ട് ബോഡിയിൽ വരാം. അതേപോലെ നമ്മൾ പേഷ്യന്റ് ഹിപ്പ് ടിൽറ്റ് ഇതിനെ ചെയ്യുന്ന എക്സസൈസ് ഞാൻ ഫാസ്റ്റ് ആയിട്ട് പോവാം. ഇത് നമ്മൾ സ്പൈനൽ കർവേച്ചർ കറക്റ്റ് ചെയ്യാനുള്ള ഒരു ഡിവൈസ്, നോർമൽ ലോഡോസിസ് കറക്റ്റ് ചെയ്യാൻ മെസിഡോ എന്ന് പറഞ്ഞിട്ട് ഒരു ഡിവൈസ്. അതിന്റെ കൂടെ ഇതാണ് നമ്മൾ ചെയ്യുന്ന ഡിസ്ട്രാക്ഷൻ പ്രൊസീജിയർ. കൗണ്ടർ ട്രാക്ഷൻ തൊറാസിലേക്കും, ലംബാർ ട്രാക്ഷൻ കൊടുക്കാറില്ല, സ്കിൻ ട്രാക്ഷൻ വിത്ത് ഫ്ലെക്സ്ഡ് നീ നമ്മളെ പേഷ്യന്റ്. ഇതും ഇതേപോലെ നമ്മുടെ ഫാസറ്റ് ജോയിന്റ് ഹൈപ്പർട്രോഫി ഞാൻ പറഞ്ഞു ഇപ്പോ ഈ ഫുട്ബോൾ പ്ലെയർ മുഹമ്മദ് ഉവൈസിന്റെ ഫാദറാണ്. അവിടെ കിടക്കുന്ന ഫുട്ബോൾ കളിക്കാരന്റെ ഫാദറാണിത്. ഇതാണ് ലാസ്റ്റ് ഒരു വീഡിയോ കാണിച്ചത് എങ്ങനെ ഹിപ്പ് മൊബിലൈസ് ചെയ്യാം. ഇത് സ്ഥിരമായിട്ട് ബാക്ക് പെയിനുള്ള ഒരാളായിരുന്നു. ഈ ബാക്ക് പെയിനുള്ള ആൾക്ക് ഹിപ്പ് മൊബിലൈസ് ചെയ്തോടുകൂടിയിട്ട് അയാളെ ബാക്ക് പെയിൻ പോയി. ഹൗ ടു മൊബിലൈസ് ഹിപ്പ് യു കെൻ സീ 2-3 വീഡിയോസും കൂടെ കാണിച്ചിട്ട് ഞാൻ സ്റ്റോപ്പ് ചെയ്യാം, സമയമില്ലെന്ന് മനസ്സിലാണ്. ഇത് പൈറിഫോമി സ്ട്രെച്ചും ഹിപ്പ് മൊബിലൈസേഷനും കൂടി ഓൾ ടുഗദർ ഉള്ളതാണ്. 2 കാലിലും ചെയ്യാം. നെക്സ്റ്റ് സ്ലൈഡ്. ഇതിന്റെ റീഹാബിലിറ്റേഷൻ, മറ്റൊരു റീഹാബിലിറ്റേഷൻ. ഷീസ് ഓൾസോ എൻ അത്ലറ്റ്, ഒരു നാഷണൽ അത്ലറ്റ് ആണ്. നെക്സ്റ്റ് സ്ലൈഡ്. ഇതാണ് മറ്റൊരു ഹിപ്പ് റീഹാബ്. You see, this is the very good rehab technique for hip mobilization. വലത് കൈ കൊണ്ട് നമ്മുടെ ആന്റീരിയർ സുപ്പീരിയർ ഇലിയാക് സ്പൈനിൽ നമ്മൾ പ്രഷർ കൊടുത്തിട്ട് അവിടെ ആംഗിൾ പിടിക്കുക, മുട്ടലുകൾക്ക് മടക്കി വെച്ചിട്ട്. ഫ്ലെക്സ് ദ നീ above knee of the other hand and hold the leg, and the elbow should be placed on the anterior superior iliac spine, and next portion other hand നമ്മൾ മറ്റേ കൈ കൊണ്ട് നീനെ ഓപ്പോസിറ്റ് സൈഡിലേക്ക് പ്രഷർ കൊടുക്കുക. ഇതാണ് ഹിപ്പ് മാനിപ്പുലേഷന്റെ എക്സൽ റൊട്ടേഷന്റെ മറ്റൊരു ടെക്നിക്ക്. ഇത് ഹിപ്പ് റീഹാബിന്റെ മറ്റൊരു വീഡിയോ ആണ്. പവർ ബാൻഡ്. ഇത് നാഷണൽ അത്ലറ്റാണ്, സ്വിമ്മർ ആണ്, തമിൽ കുമാർ. പുള്ളി ചെയ്യാൻ വേണ്ടി ശ്രമിക്കണം. അതാണ് എനിക്ക് നിങ്ങളോട് ലാസ്റ്റ് ആയിട്ട് പറയുന്നത്. ഒരുപാട് സ്ലൈഡ്സ് ഇതിന്റെ സാധനങ്ങൾ ഉണ്ടായിരുന്നു, അതൊക്കെ ഞാനിപ്പോ സ്കിപ്പ് ചെയ്തു. ഒരുപാട് സ്ലൈഡ്സുകൾ. ഇപ്പൊ ഇതിൽ ഒരു ഇമ്പോർട്ടന്റ് ആയിട്ടുള്ള ഒരു സ്ലൈഡ് ഇപ്പൊ ഞാൻ കാണിച്ചിട്ടുണ്ടോ. നമ്മൾ ഒരൊറ്റ ഒരു കുഷൻ ആംഗിൾ, ഒരു ഡിഫോമിറ്റി കറക്റ്റ് ചെയ്താൽ തന്നെ നമ്മൾ നീ ജോയിന്റ് പെയിനും ഹിപ്പ് പെയിനും നെക്ക് പെയിനും മാറും. പലപ്പോഴും പല ബാങ്കിള്, ബാക്ക്, കഴുത്ത്, ഇതൊക്കെ ഒറ്റ ഒരു ഫ്ലാറ്റ് ഫുഡ് പെസ് പ്ലാനസ് കൊണ്ടായിരിക്കും ചിലപ്പോൾ വരുന്നത്. അത് കറക്റ്റ് ചെയ്താൽ തന്നെ ഈ ഇന്റർലൊട്ടേഷൻ ഡെഫിസിറ്റ്, ഹിപ്പ് ഡിഫോമിറ്റി മാറുന്ന കുറെ സംഭവങ്ങൾ ഉണ്ടായിരുന്നു. ഇനി അത് നമുക്ക് പിന്നീട് ഒരു അവസരത്തിൽ നമുക്ക് ചെയ്യാം. അപ്പോ താങ്ക് യു ഫോർ ഹിയറിംഗ്, ആൻഡ് ദിസ് ഇസ് ദ ലാസ്റ്റ് ക്യാപ്ഷൻ ഐ ഹാവ് ടു ടെൽ യു. താങ്ക് യു.
Thank you, sir. There was a memorable session. Now I kindly request Dr. Sudhikumar, sir, Chairman of Ayur Sports, to honor Dr. Arshad with a memento as a token of our gratitude for his valuable time and presence in the School of Fundamental Research of Ayurveda as a part of the national seminar in conjunction with the 75th Independence Day celebrations. Sir, please. Acute injuries happen suddenly, such as when a person falls, receives a blow, or twists a joint, while chronic injuries usually result from the overuse of one area of the body and gradually develop over time. The second session will be on acute injury management, focusing specifically on athletic injuries. And this section will be conducted by Dr. Augustine George, Associate Professor, Physical Education Department, Government Medical College, Kottayam. I kindly request sir to lead the session.
സ്ലൈഡ് മാറ്റാൻ പറഞ്ഞാൽ അതെ അതെ അതെ.
Now, I'd like to welcome Dr. Sudhikumar KB to honor Dr. Pradibha G for winning the second prize in research proposal competition, which was held in accordance with the National Seminar of Ayur Sports.
Study. Most respected, hello. Most respected, Dr. Sudhikumar sir, Dr. Sai Lekha madam, and Dr. Sriraj SK sir, and dear participants. As said, I am in the sports field. Okay, I am the physical education teacher of Government Medical College, Kottayam. I am working as the associate professor and head of Government Medical College, Kottayam under physical education department. So I was told to tell you that what all injuries can happen in sports field and what are the causes of those injuries and how we are managing it right now. Okay, so I'll be telling all this. So based on this understanding, I think you can think upon that how to continue your research in which field and how to tap the opportunities which is present in the sports field. So recently, our Honorable Prime Minister Narendra Modi I was listening to one of his lectures, and he was telling the Ayurveda fraternity to step into the sports field, and tap the opportunities which is present in the sports field. For sports persons, I was also a sports person, and for sports person, their 10 to 12 years after school is very important when they perform their maximum. Okay, so and you have seen recently Commonwealth Games has been concluded, and you have seen that how India has fared well. India has finished in the 4th position, but many medals we missed in the Commonwealth Games. One thing is our boxer. What is her name? Anyone can tell? Our star boxer, Mary Kom. Mary Kom missed it because of an injury. Then we have Neeraj Chopra. He also missed it because of an injury. So injury is rampant in sports field. And we badly need doctors or the management techniques by which athletes can manage these injuries. So I'll be finishing by 1 o'clock, because after 1 o'clock, I have another program. So I will finish by 1 o'clock, and within this short span of time, I will just run into, and I hope that you can also understand, because it is not a big thing. I will be just pointing out few facts which is happening. So next slide, sir. So coming with athletics, starting with athletics, we have different disciplines, isn't it? Sports, see, you have professional athletes in the sense sports persons, professional sports persons, those who want performance. With the advent of IPL, with the advent of ISL, with the advent of Pro Kabaddi League, we see that sports has become a multi-crore business, isn't it? And sports persons, as Dr. Arshad was also saying, that a particular sports person was earning 1 crore in a year. So lot of money is there, and they want to perform. And if an injury happens, they are going to miss. If any injury, even a muscle tear, it is going to cost 1 month. And then their performance is going to come down. And how they will, adjust this 1 month of lack of training. ഒരു മാസത്തെ ട്രെയിനിങ് അവർക്ക് മിസ്സാവും. We can't imagine even losing 1 day of training. When it comes to serious sports, professional sports, we can't imagine missing 1 day of training. That much dedicated and that much hard work an athlete is putting so as to excel in his or her game. So starting with athletics, so what all I will be speaking today is based on my personal experience, which I have experienced as a sportsman during my study at LNCP Trivandrum for 5 years, for 3 years degree, 2 years PG, and thereafter in the sports sector from the last 17 years. So I have even consulted the topmost coaches available in Kerala before coming to this seminar to know the exact condition of the present status. Like Dronacharya, our boxing coach, Chandralal sir. So he is the boxing coach of Lekha, who is a world champion. So Dronacharya, that sir, Chandralal sir is involved. Then Gopalakrishna sir from athletics is involved. Satish from the Indian wrestling coach is involved. So I have taken inputs from all of them, and then I am presenting this. So coming to athletics, the previous slide, sir. So the injuries which is commonly seen in athletics. So athletics, you understand, it's just running events, sprint events is there, 100 meter, 200 meter, 400 meter, 800 meter. Okay, then long distance is there. Then combined events is there, decathlon, where you have to do 10 events in 2 days time. So the injuries concerning that event, athletics. So here commonly seen is ankle injuries, Achilles tendon injury, and then hamstring injury, groin injury, shin pain, blisters. Blisters also develop in the new novice athletes, those who come with new shoes and those who jog, the blisters gets developed. So what are the causes? Combined events, decathlon, heptathlon, these combined events is one of the causes. Lack of fitness, then improper warm-ups. Warm-ups is very important, and some of them misses the warm-up and then they land into injury. Then faulty surface or technique. Okay, lack of nutrition, faulty training. All these are causes of injuries. And now management, what we usually do now is if someone is injured with the above injuries, we go for RICE therapy, that you all know it. Rest, you all know it, right? Then we have rest, we give pain relievers. Then for blisters, lubrication or sponge. They put sponge inside their shoes and then they practice so that they can avoid blisters. Okay, so if any of these injury come, the athlete is out of action and they will be taking rest. And if they are taking rest, that means their performance is coming down. They are not getting the time to practice. So next slide. Recently, I said Neeraj Chopra, he missed out of Commonwealth Games 2022 due to injury. It was a sure medal for us and he missed it due to injury. And what was his injury? He injured his groin at the World Athletic Championship in Oregon on Saturday, where he all know that he got a medal there. And that was a groin injury. He got groin injury. He overstretched his groin and the groin injury was there. And because of that, he missed the Commonwealth injury. So what steps can be taken, initiated, so that we can prevent this injury? So as far as Neeraj Chopra is concerned, we cannot say that he lacked fitness. Those who have seen his video doing fitness, we cannot dare to say that he lacked fitness. He lacked fitness. He have technique. He has hired a coach where biomechanics principle was used. And then when he got medal in Olympics, you know that it was in the papers, newspaper, YouTube and everything, that how he threw the javelin and what was the formula. Okay, so technique was also not bad. So it may be because of the overstrain. Okay, when you have to perform, it's a performance, right? So in perform, you have to continuously excel. And when there is a lot of pressure and when you have to perform and you have to win, injuries can happen. Overload, that may be the cause of injury. Whatever the cause, he has missed Commonwealth Games. India has missed one medal. So the next game. Next. Now coming to boxing. Boxing, Mary Kom missed Commonwealth Games. Again, we missed a sure medal. What was the reason? Injuries, the common injuries which is seen is knuckle injuries. Because boxers, they land these knuckles. They have gloves, okay? With gloves, they protect the hand as well as the opponent's face and all. That is the intention of using the gloves. But still, the weight which they put is so high that they injure their knuckles. Mary Kom has knuckle injury. And I was talking to Chandralal sir and he was telling that he has taken Mary Kom to AIMS, where there is a finger expert doctor, Dr. Negi. And his treatment was there and then she could come. And you athletes, they don't want to miss out practice. That is one of the psychological thing of athletes. Because they don't want, Mary Kom and all is so aggressive. They don't want, and he was telling that she was made to wait for 6 hours. And in between, doctor will come out from the surgery and say, wait, I am coming. Because she is a national athlete, an international star. But then, and he has a tough time convincing Mary Kom that please sit. You need to heal your knuckles before going to the next competition. Then thinking about Lekha, who is a world champion in boxing, who was also in newspaper recently. And she has knee injury. Okay, so after knee injury, after knee surgery done, within 3 months, she came back and then she won the world championship. But then 3 months of training, she has lost there. So these all things are, it's a big problem, a real problem, which sports fraternity is facing. I think even the international level, we will come to that. International athletes, famous footballers like Cristiano Ronaldo, Messi, all of them, LeBron James, all of them are facing this problem. Next slide, sir. So knuckle injuries, wrist injuries, cut abrasion, contusion, which they have it on face. And, and he said that if you can reduce the fat in the face, they will get very less cut abrasion and contusion. Because all the blows will be handed on the face. Okay. So if the fat is less, they will have very less cut and abrasion and contusion. So some techniques by which you can reduce the fat apart from training. Then hamstring pull, these all things, hamstring muscles, this pull happens when they have to, can you imagine that while doing a competition, a boxer getting knee injury? Because the agility, they have to move so quickly. their body weight, they have to move so quickly from one step to another step. So because of this quick movement, because of the agility requirement, boxers get knee injuries. Then shin splints. Shin splints is common, right? Those all the new players in almost all the game. When novice players come, they get shin pain. Shin pain. So pain on the shin, and if it continues, it leads to stress fracture. So some ways by which we can overcome this shin pain. Then foot arc pain, because most of the players, they touch the floor or by the ball of their feet. They keep the heels up. Okay. If they are bouncing, they keep the heels up. So that may be the one of the reason why they get the foot arch pain. So what could be done for that foot arch pain? Then knee injuries, and the causes I said: high performance, low fitness, uneven training grounds, poor techniques. Management for wrist injuries, for knuckle injuries, wax treatment. Many boxers, they put wax and then they go for boxing. Then fat reduction, painkillers, rest, surgery, rehabilitation. After surgery, rehabilitation. Knee injury, surgery is done, then rehabilitation. The same day in modern medicine, they do the surgery, and the same day they start rehabilitation. Morning surgery, evening they will start rehabilitation of the knee, exercise with the knee. So that is how the recovery is faster. But as Arsha sir also said, pointed out, but once the body is cut, once the natural mechanism of the body is disturbed, then even in the future, if there is problem is coming, then what is the use of these medals? What is the use of degree if you go crazy, right? So at the age of 45 or 50, if you can't even walk, what is the use of these medals or this fame? So the other day I was talking to one of my classmates who used to be a very good goalkeeper in hockey. So, and he was an inter-university goalkeeper. He was a medalist. Our team won at that time. Dr. Rajit KS, I don't know whether you know, he's from Palagat. And presently he's working in a college. And I was asking him that, how are you? How is your injuries and all? And he was telling, oh, ഇപ്പം ഭയങ്കര പാടാണ്. ഇപ്പം നടക്കാൻ പാടാണ്. ഇപ്പം വണ്ടി ഓടിക്കാൻ പാടാണ്. നീക്ക് ഇഞ്ചുറി ഉണ്ട്, ലംബാറിൽ ഇഞ്ചുറി ഉണ്ട്. ഇതെല്ലാം ഇപ്പോഴാണ് വരുന്നത്, റിഫ്ലക്ട് ചെയ്യുന്നത്. Okay, so at a later time it is coming out. So here I think Ayurveda can play a part. Ayurveda can play a part by which, you know, without disturbing our body, without disturbing the natural body which is given us, something can be done by which our performance increases, injury reduces, and even if injury happens, rehabilitation and back to the same position, if something can be done, then that will be miraculous, and that will be a, you know, it will be a huge step for Ayurveda. Next slide. Next. See, Mary Kom advised surgery on injured knee, says she will make comeback again. Mary injured her knee during the trials for the 2022 Commonwealth Games, updated on 13 June. So here Mary Kom lost and we lost another medal in Commonwealth. Next slide. See, in this bout, the previous slide, in this bout with Neetu, she has injured her knee. In this bout, in this particular bout, just see her fitness level and just think of that, how she can injure her knee. Okay, she is so fit. She is 6 times world champion, and then she has injured her knee by playing with a boxer who is much below her skill level. Next. Now coming to badminton tennis. When we think of badminton, who comes in our mind? Saina Nehwal. And Saina Nehwal is injured. She is also injured. So see, injuries, wrist injury, which happens in badminton, because I think most of you play badminton, and you know that the movement on badminton where the wrist is used maximum. So wrist injury is there. Tennis elbow. One player who has suffered tennis elbow, anyone? Sanchit Tendulkar. Okay. And he was in depression at that time when he was having tennis elbow. And he was used to tell that he was not getting the sleep at night. And he used to call his friends at 2 o'clock at night, at 4 o'clock in the early morning, to come and just go for a drive with him, because he is not getting the sleep. He fell into depression at that time. So that much huge impact injuries plays to professional sports person. Then shoulder injury, rotator cuff tear. which is very hard to heal also. I know a person who had rotator cuff and he was going to allopathic doctors and they were giving painkillers and steroids and all. And then this pain was not going on. So there is a real-time problem. Even people, those who play this shuttle for fitness, they also have this rotator cuff injury because they don't, they don't properly warm up. People are not educated about how to warm up, the importance of calming down, cool down after play. It's very important. How you warm up your body, how you play, and then how you warm down your body. These three aspects are very important. And what we do is when we see a court, we go and we start playing. Because so much of excitement and thrill is in the game. And you see so much of, the players become so offensive in shuttle. And after singles, they go for doubles. Then they again go for singles. And one singles, or double, or singles, energy. We are completely tired. But again, if we have lost, again we are ready. Chetanda Monde would kalikum. Chetanda, he is in engineering final year. So then he is not going to leave. One point I can talk in the singles I am 47. ഞാൻ എനിക്കെല്ലാം അറ്റാക്ക് വരുമെന്ന് ഓർക്കും. അവനോട് പറയട്ടെ നീ കളിക്കണ്ട, നിനക്ക് എന്തെങ്കിലും പ്രശ്നമെല്ലാം വരുമായിരിക്കും, മതി. പക്ഷെ അത് നിർത്താൻ പറ്റത്തില്ല, ഒരു അഡിക്ഷൻ ആയിപ്പോ. ഷട്ടിൽ ഈവൻ കാഷ്വൽ ആയിട്ടുള്ള പ്ലെയേഴ്സ് കളിക്കുമ്പോഴത്തേക്ക് at present I have a non-union scaphoid injury in my wrist which I suffered long back in 1998 during my degree final year. Then I have a ligament injury in my knee. അപ്പോൾ ഇത് വെച്ചിട്ടാണ് ഞാൻ ഇപ്പോഴും I have not gone for any surgery. ഞാൻ എന്നെ തന്നെ മാനേജ് ചെയ്യുവാണ് ത്രൂ എക്സസൈസ് ആൻഡ് ത്രൂ സ്ട്രെങ്തനിങ് ദ ലെഗ്സ്. സോ അത് വെച്ചിട്ടാണ് ഞാൻ ഷട്ടിൽ കളിക്കുന്നത്. ഓക്കെ, അപ്പൊ എനിക്ക് റിസ്റ്റ് മൂവ്മെന്റ് കിട്ടത്തില്ല ബിക്കോസ് ഓഫ് ദിസ് ഇഞ്ചുറി. അത് വെച്ചിട്ടാണ് അവൻ ഏജ് എന്തുമാത്രം വ്യത്യാസമുണ്ട്. ഈവൻ ദെൻ വി ആർ നോട്ട് ഏബിൾ ടു ലീവ്. എനിക്കും വിടാൻ തോന്നുന്നില്ല, അവനും വിടാൻ തോന്നുന്നില്ല. ദാറ്റ് ഈസ് ദ ആ ഗെയിമിന്റെ ഒരു എസൻസ് എന്ന് പറയുന്നത് അതാണ്. നമുക്ക് വിടാൻ പറ്റത്തില്ല, കളിച്ചുകൊണ്ടിരിക്കാൻ തോന്നും നമുക്ക്. ആൻഡ് നൗ ബിക്കോസ് ഓഫ് ദിസ് ടർഫ്, ഫുട്ബോൾ ടർഫ് വന്നിട്ടുണ്ട് ഇല്ലേ? അപ്പൊ ഈ ഫുട്ബോൾ ടർഫിൽ കളിക്കുന്ന മിക്കവർക്കും ഇഞ്ചുറീസാ, ബിക്കോസ് ആ ഷോക്ക് അബ്സോർബ് ചെയ്യാൻ പറ്റുന്നില്ല. സോ സാറ് പറഞ്ഞ പോലെ ഒരു 60 ഇഞ്ചുറീസ് പെർ ഡേ വരുവാണെങ്കിൽ ജസ്റ്റ് തിങ്ക് ഓഫ് എത്ര സ്പോർട്സിന്റെ ഈ ഗ്ലാമറൈസ് ആയപ്പോഴത്തേക്ക് എന്തുമാത്രം ടർഫാണ് ഇവിടെ വന്നിരിക്കുന്നത്. എറണാകുളം യു സി പത്തനംതിട്ട, വേർ ഐ സ്റ്റേ, കോട്ടയം, കാണുന്നതെല്ലാം ടർഫാണ്. ആൻഡ് ഇവർക്ക് ഒരു ദിനചര്യയില്ല, രാത്രി 1 മണി 2 മണി 3 മണി വരെ കളിയാ യങ്സ്റ്റേഴ്സ്. സോ ഇഞ്ചുറീസ് അതിനെ നമുക്ക് അവോയ്ഡ് ചെയ്യാനേ പറ്റത്തില്ല. ദെൻ നീ ഇഞ്ചുർ, ACL, PCL, MCL, LCL എല്ലാ ഇഞ്ചുറീസും വരും. ബിക്കോസ് മുട്ട് ജോയിന്റ് നമ്മുടെ ഹിഞ്ച് ജോയിന്റ് ആണെങ്കിലും അതിൽ സ്ലൈറ്റ് റൊട്ടേഷൻ പോസിബിൾ ആണ്, സ്ലൈറ്റ് റൊട്ടേഷൻ. ആൻഡ് സ്പോർട്സിൽ ബിക്കോസ് ഓഫ് ദിസ് വേരിയസ് മൂവ്മെന്റ്സ്, കോംപ്ലക്സ് മൂവ്മെന്റ്സ്, ഈ റൊട്ടേഷൻ എപ്പോഴെങ്കിലൊക്കെ സംഭവിക്കുമ്പോൾ ഇഞ്ചുറി സംഭവിക്കും. Then groin injury, ankle injuries. And ankle injuries is one thing where I think Ayurveda is playing a role right now. Because I was talking to the basketball coach of Marivanius. Basketball coach was in newspaper a few months back. I didn't conduct the newspaper cutting. Basketball coach, because the team was not able to go by train. He fully protest and the government sanctioned flight for the team. And Kerala team went by flight. His name is Jose Philip. He's a very dedicated coach. And he was telling that ankle injury vanal, he never sends his athletes to modern medicine doctor. He knows a Ayurveda specialist and pull it at the vidum, and within 1 week the player is ready. Modern medicine 1 month poka. Moreover, plaster uri kayumbom visually you can see one leg is thin, one leg is normal. പിന്നെ ഈ തിന്നായിട്ടുള്ള ലെഗിനെ തിരിച്ചു കൊണ്ടുവരണമെങ്കിൽ എത്ര നാളത്തെ പ്രാക്ടീസ് പിന്നെയും വേണം. അപ്പൊ ഇവൻ അത്രയും പ്രാക്ടീസ് മിസ്സാവും ഇല്ലേ? അത്രയും പ്രാക്ടീസ് മിസ്സാവും, അത്രയും റെസ്റ്റ് ആവും, ബോഡിയുടെ ഫിറ്റ്നസ് കുറയും. പ്രോബ്ലമാണ്. സോ അവിടെ ആയുർവേദമാണ് എടുക്കുന്നത്. വിത്തിൻ 1 week ദ സംഗതി ഈസ് റെഡി. സോ അങ്ങനെ if we can go for other injuries also, groin injury. The other day I saw a SB college level football player and he was telling he had groin injury. We met by chance in the bus. Ore bus travel, so he sit by my side and he was asking me endo പേര് ഞാൻ പറഞ്ഞു എൻ്റെ പേര് ഇതാണ് നീ കളിക്കാരനാണെന്ന് ചോദിച്ചു. ഹൗ യു നോ? ഞാൻ പറഞ്ഞു നിന്റെ സ്ട്രക്ചർ കണ്ടാ അറിയാം കളിക്കാരനാണ്. എവിടെ പോയാന്ന് ചോദിച്ചാൽ പറയും ഞാൻ ആയുർവേദ ട്രീറ്റ്മെന്റ് വേണ്ടി പോയതാണ്, ഗ്രോയിൻ ഇഞ്ചുറി തൊടുപുഴയിൽ അങ്ങോട്ട് പോയത്. And he was telling that sir modern medicine അലോപ്പതിയിൽ പോയിട്ട് കാര്യമില്ല, ആയുർവേദയിൽ പോയിട്ട് നല്ല വ്യത്യാസമുണ്ട്. So these are the areas where you need to tap. നമുക്ക് വേണ്ടത് സമയം ഏറ്റവും കുറച്ച് പെട്ടെന്ന് ഹീൽ ആകണം. രണ്ടാമത്തത് എക്സ്പെൻസീവ് ആകല്ല, ഇറ്റ് ഷുഡ് ബി വിത്തിൻ അവർ. മൂന്നാമത് നമ്മുടെ ബോഡി സ്ട്രക്ചേഴ്സിന് ഹാം സംഭവിക്കില്ല ഭാവിയിൽ. The causes, most of the causes are same. Most of the management techniques are also same. കേട്ടോ, എല്ലാം അതുകൊണ്ട് അത് എപ്പോഴും റിപ്പീറ്റ് ചെയ്ത് പറയുന്നില്ല. I will just go. Next slide. And see our reigning Commonwealth Games gold medalist in the women's singles, former world number 1 Saina Nehwal, will not be participating in the upcoming 2022 Commonwealth Games. 32. She is 32-year-old. And why she is not able to qualify? Because she had an injury. She is also suffering from groin injury. Groin injury ഉണ്ട്, knee injury കൂടെ ഉണ്ട് മുൻകാലത്തെ. And see how many medals we missed now in Commonwealth Games. Neeraj Chopra, Mary Kom, Sneha Nehwal. 3 sure medals are there. Okay, and you know how much government is spending for the training of these athletes? Statistics available ആണ്, ജസ്റ്റ് നോക്കിയാൽ മതി. ഹൗ മച്ച്, എന്തുമാത്രം പൈസ. ഇവിടെ ജീവിരാജയിൽ ഞാൻ സ്ഥിരമായിട്ട് പോകാറുണ്ട്. അവിടെ ഒരു കോച്ചിന്റെ ഖേലോ ഇന്ത്യ സ്കീമിൽ ഒരു കോച്ചിന്റെ സാലറി 1.5 lakhs ആണ്. 1.5. They have strength and conditioning coach. Salary is 75,000 per month. They have physiotherapists. They have masseurs. Food in വേണ്ടി പൈസയുണ്ട്. So how much money government is spending so that our athletes can bring medals and laurels to our country? അപ്പൊ അവിടെ നമുക്ക് വേണ്ടത് ഇവർക്ക് ഇഞ്ചുറി വന്നു കഴിഞ്ഞാൽ പോയി, അത്രയും പൈസ വേസ്റ്റ് ആവുകയാണ്. So you understand the significance of the problem? Next slide. Now coming to cricket, tennis elbow, knee injury, spine injury. Cricket spine injury because of the wrong നമ്മുടെ ബോൾ ചെയ്യുമ്പോഴത്തേക്ക് കാലിന്റെ റോങ് പൊസിഷൻ. യു ഹാവ് സീൻ ബോളിന്റെ സ്പീഡ് നിങ്ങൾക്ക് അറിയാം അല്ലെ, എത്ര സ്പീഡിലാണ് ബോൾ ത്രോ ചെയ്യുന്നത് നിങ്ങൾ അവിടെ എഴുതി കാണിക്കും. അപ്പൊ അത്രയും സ്പീഡിൽ ത്രോ ചെയ്യണമെങ്കിൽ ഒന്ന് ഓർത്ത് നോക്കിയ കാലിന്റെ ഇമ്പാക്ട് എത്ര ഹാർഡ് ആയിരിക്കും, എത്രമാത്രം ഫോഴ്സ് ആയിരിക്കും കാലേ വരുന്നത്. അത് നേരെ സ്പൈനിലോട്ട് എഫക്ട് ചെയ്യും. സ്പൈൻ ഇഞ്ചുറി ഈസ് കോമൺ. Wrist injury, shoulder injury, again groin injury avadeyundu. Okay, these are the causes and management. Next slide. And see, this is Sachin Tendulkar's word. I thought my career was finished. It was done. Sachin Tendulkar on his tennis elbow injury. Sachin Tendulkar revealed how he had almost gone into depression after his tennis elbow injury. He has gone into depression. Depression aviyavalo. Depression is a state where you stop talking. നമുക്ക് suicidal thoughts വരും ഇല്ലേ, അതാണ് ഡിപ്രഷൻ. നമ്മൾ കോമൺ ഇതിൽ പറയുന്ന ഒരു ഡിപ്രഷൻ അല്ല. ആ ഒരു ഡിപ്രഷൻ സ്റ്റേജിലോട്ട് എത്തിയിട്ട് ഇത്രയും ഹൈ ലെവലിലെ ഒരു പ്ലെയർ ആ ഒരു ലെവലിൽ എത്തിക്കഴിഞ്ഞാൽ then how difficult it is to come back, isn't it? ഞാൻ ഇടയ്ക്ക് ഒരു റിസർച്ച് ചെയ്യാൻ നേരം just I was searching the net and I was seeing that which is the most effective method to come out of depression. എന്താന്ന് പറയാം ആർക്കെങ്കിലും? Most effective method to come out of depression. എന്താണ്? സ്പോർട്സ് ആണോ? സ്പോർട്സ് കളിക്കാൻ തോന്നത്തില്ല. അപ്പൊ സ്പോർട്സ് ആണ്, ഡോപാമൈനും അതൊക്കെ റിലീസ് ആവും. ഓക്കെ, പക്ഷെ നമുക്ക് കളിക്കാൻ തോന്നണ്ടേ സ്റ്റാർട്ട് ചെയ്യാൻ വേണ്ടി. പക്ഷെ നെറ്റിൽ ഞാൻ റിസർച്ച് ചെയ്തപ്പം പബ്മെഡിൽ ചെന്ന് ഞാൻ ഇത് നോക്കിയപ്പോഴത്തേക്ക് ഏറ്റവും കൂടുതൽ ഒരു മെറ്റാ അനാലിസിസ് സ്റ്റഡി കണ്ടു. അതിൽ ഏറ്റവും കൂടുതൽ പറഞ്ഞത് സോഷ്യൽ സപ്പോർട്ട് ബൈ യുവർ പിയേഴ്സ്, ഫ്രണ്ട്സ്, relatives, social support. And this is what exactly Sachin has taken, because he is accessible to all this. അല്ലെ, ഈ അഡ്വൈസ് കൊടുക്കാനും ആൾക്കാരുണ്ട്. Because he can take the world's best doctor, world's best psychologist, അദ്ദേഹത്തിന് കിട്ടും. But what about the common sports person, those who are striving, those who are coming up? ആർക്കും അറിയാൻ വയ്യാത്ത സ്പോർട്സ് പേഴ്സൺസ് ഉണ്ട് ഇല്ലേ? അപ്പൊ അവര് വളർന്നു വരുന്നതേ ഉള്ളൂ. മയൂക ജോണിയൊക്കെ എപ്പോഴാണ് അറിയാൻ തുടങ്ങിയത്? when she started getting medals. ഇല്ല, ശ്രീശങ്കറിനെ എപ്പോഴാണ് അറിയാൻ തുടങ്ങിയത്? ഇല്ലേ? റീസെന്റ് ആയിട്ടല്ലേ ശ്രീശങ്കറിനെയൊക്കെ അറിയാൻ തുടങ്ങിയത്? നമ്മുടെ അബൂബക്കറിനെ എപ്പോഴും അറിയാൻ തുടങ്ങിയത്? ട്രിപ്പിൾ ജംപ് റീസെന്റ് അല്ലെ? അതിനു മുമ്പ് നമുക്ക് അറിയത്തില്ല. പക്ഷെ എത്രയോ അത്ലീറ്റ്സ് അവിടെ എത്താൻ പറ്റാതെ അവര് പോയി ബിക്കോസ് ഓഫ് ഇഞ്ചുറീസ്. ആൻഡ് വൺസ് വൺ ഇഞ്ചുറി കംസ്, ഷാറ്ററിങ് ഓഫ് ഡ്രീംസ്, ഇഞ്ചുറി, ഇതെല്ലാം നമ്മളെ കോർണർ ചെയ്യും. ഡിപ്രഷൻ വന്നില്ലെങ്കിലേ സംശയമുള്ളൂ. Because the amount of hard work which a sports person spends is unimaginable. Unimaginable. I was a taekwondo player. And the schooling നടന്ന ചണ്ഡീഗഡിലാണ്. I remember I used to practice 3 times a day. Morning, afternoon, evening. 3 നേരം. ഒന്ന് ഓർത്തു നോക്കിയേ എത്ര മണിക്കൂർ. ഇപ്പൊ ഞാൻ ചിന്തിക്കുമ്പോഴേക്ക് ഒരു കാല് വെച്ച് 1000 കിക്ക്, മറ്റേ കാല് വെച്ച് 1000 കിക്ക്, 4 കിക്ക് പെറ്റായിട്ട്. ടൈക്കോണ്ടോ അറിയാമല്ലോ അല്ലേ? കാല് വെച്ചാണ് കൂടുതലും കിക്സ്. 4 കിക്ക് പെറ്റാക്കാൻ പറയും. അതായത് 4 കിക്ക് ഏത് സമയത്തും സ്പീഡും അക്യുറസിയിലും വരണം. അതിന് 4 കിക്ക്, ഒരു കിക്ക് 1000 പ്രാവശ്യം ഒരു കാല് വെച്ച് മറ്റേ കാല് വെച്ച്. ജസ്റ്റ് തിങ്ക് ഓഫ്, ചിന്തിക്കാൻ പറ്റുമോ? അപ്പൊ വീട്ടുകാർ ഓർക്കും ഇവന് വട്ടായെന്ന് വിചാരിക്കുമായിരുന്നു അവര്. സോ ലക്കിലി ഐ വെന്റ് ഇൻ ടു ഫിസിക്കൽ എഡ്യൂക്കേഷൻ കോളേജ്. ഞാൻ രക്ഷപ്പെട്ടു. സ്പോർട്സിലായിരുന്നെങ്കിൽ ചിലപ്പം പറ്റത്തില്ലായിരുന്നു. ആ സമയത്ത് തൈക്കോണ്ടോ ചണ്ഡീഗഡൊക്കെ സ്റ്റോപ്പ് ആയിരുന്നു. നാഷണൽസിലൊക്കെ പോയി. കേരളത്തിൽ തൈക്കോണ്ടോ ഒന്നും തുടങ്ങിയിട്ടില്ല. വേ ബാക്ക് ഇൻ 1995. ഓക്കെ, സോ അത്രമാത്രം ട്രെയിനിങ് ആണ് ഒരു അത്ലീറ്റ് അല്ലെങ്കിൽ ഒരു സ്പോർട്സ് പേഴ്സൺ ചെയ്യുന്നത്. അത്രയും ട്രെയിനിങ് ചെയ്തിട്ട് ബിക്കോസ് ഓഫ് ഇഞ്ചുറി ഇഫ് ഹി ഹാസ് ടു ലീവ് ഹിസ് ഡ്രീംസ്, then that is really pathetic. As a country, you have a moral responsibility also as a doctors to help these athletes come out in flying colors. It's not only about money. At the end of the day, it's a satisfaction. Towards retirement, when you think back what you have done, it's not about you have 2 crore, 3 crore balance. That how much, how much you have helped people. ഒരാളുടെ ലൈഫ് നന്നാക്കാൻ വേണ്ടി നമ്മൾ ഹെൽപ്പ് ചെയ്തിട്ടുണ്ടെങ്കിൽ അതല്ലേ ഏറ്റവും കൂടുതൽ സാറ്റിസ്ഫാക്ഷൻ തരുന്നത്? isn't it? It's not money. നമ്മൾ എന്തുമാത്രം ഇൻസ്ട്രുമെന്റൽ ആയി ഒരാളുടെ സക്സസിന്, that gives the satisfaction. Next slide. Now coming to football, again knee injuries, ankle injuries, hamstring injuries, lumbar injuries, goalkeepers വരുന്ന. ഓക്കെ, അവര് ജമ്പ് ചെയ്ത് ബോൾ സേവ് ചെയ്യുന്ന കണ്ടിട്ടുണ്ടോ? എന്നിട്ട് അവര് ലാൻഡ് ചെയ്യുന്നത്. ലംബാർ സ്പൈന് നല്ല സ്ട്രെയിൻ ആണ്, എസ്പെഷ്യലി ലംബാർ L4 ആൻഡ് L5. അവിടെയാണ് മാക്സിമം ഇഞ്ചുറീസ് വരുന്നത് ഇവർക്ക്. അപ്പൊ ഈ ഇഞ്ചുറി വരുന്നത് അതിനെ എങ്ങനെ കുറയ്ക്കാൻ പറ്റും? ഈവൻ ദേ ഹാവ് ദ പാഡ്സ്. ഹോക്കി ഗോൾ കീപ്പർ, ദേ ഹാവ് ഓൾ ദ പാഡ്. അവരെ കണ്ട റോബോട്ട് പോലെ നമുക്ക് തോന്നുന്നത്. ബട്ട് ഈവൻ ദ പാഡ്സ് കനോട്ട് ലെസൺ ദ ഇമ്പാക്ട്. ചെറിയ ഇമ്പാക്ട് വന്നുകൊണ്ടിരിക്കും ഇല്ലേ? നമ്മൾ കണ്ടിട്ടില്ലേ, ഒരു ഡ്രോപ്പ് വെള്ളം ഒരു കല്ലിന്റെ മണ്ടേ വീണുകൊണ്ടിരുന്നാൽ കല്ലിനെ ഹോളാക്കും 1 വർഷം കൊണ്ട്. അപ്പൊ ഇവര് എല്ലാ ദിവസവും രാവിലെയും വൈകിട്ടും ഒരു 10 പ്രാവശ്യമെങ്കിലും വീഴുന്നുണ്ട് ഇങ്ങനെ ഒരേ സൈഡില്. ഒരു 5 വർഷം അല്ലെങ്കിൽ 10 വർഷം അങ്ങനെ വീണ് കഴിഞ്ഞാൽ തിങ്ക് ഓഫ് ദ കണ്ടീഷൻ ഓഫ് ദ vertebra, isn't it? So അതിനെ what can be done for that? Next slide. And you have seen Sahil Samad, and he missed the ISL final. And what was his injury? Hamstring injury. And hamstring semi-final കളിക്കാൻ നേരം ഹാംസ്ട്രിങ്ങില് ചെറിയൊരു ടിയർ വന്നു. ആൻഡ് ദെൻ പിന്നെ പെർഫോമൻസ് പോയി, കളിക്കാൻ പറ്റുന്നില്ല. സോ ഇവരുടെയൊക്കെ പെർഫോമൻസ് പോയി കഴിഞ്ഞാൽ ഇപ്പം ഈ സ്പോർട്സ് അനലിറ്റിക്സ് ഉണ്ട്, സ്പോർട്സ് അനലിറ്റിക്സ്. സോ ദർ ആർ പീപ്പിൾ ഇൻ ISL, IPL ആൻഡ് ഓൾ. അവരൊരു ചാർട്ട് റെഡിയാക്കും, സ്റ്റാറ്റിസ്റ്റിക്സ് റെഡിയാക്കും, എത്ര തവണ ഇഞ്ചേർഡ് ആയി. ഓക്കെ, ഇപ്പൊ ഇഞ്ചുറി ഒത്തിരി കൂടുതലാണെങ്കിൽ their rate will come down next auction വരുമ്പോഴത്തേക്ക്. ബിക്കോസ് he is more prone to injury. ഒത്തിരി പ്രോൺ ആയിട്ട് ഒരു ആൾ ഇഞ്ചുറിക്ക് വേണ്ടിയാണെങ്കിൽ നമ്മൾ അയാളെ ടീമിൽ എടുക്കുവോ? we will not take, we will take substitutes. There are many players coming up ഇല്ലേ? എത്രമാത്രം പ്ലേയേഴ്സ് ആണ് ഇപ്പൊ ഈ ഇവരുടെ ISLന്റെ കേരള ബ്ലാസ്റ്റേഴ്സിന്റെ സെലക്ഷൻ നടന്നായിരുന്നു. ജീവിരാജ ട്രിവാൻഡ്രത്ത് വെച്ച് അവരവിടെയാണ് എടുത്തത്. അവിടെ അവര് ജസ്റ്റ് ഒരു പേപ്പറിൽ ഒരു ന്യൂസ്, ഫേസ്ബുക്കിൽ ഒരു ഇത് കൊടുത്തപ്പോ തന്നെ അവിടെ വന്നിരിക്കുന്ന ക്രൗഡിനെ കണ്ടാൽ നമ്മൾ ഞെട്ടിപ്പോകും. ജീവിരാജ സ്പോർട്സ് സ്കൂൾ ട്രിവാൻഡ്രം എന്ന് വെച്ചാൽ ഹൈടെക് ആണ് ഇപ്പം. അവിടുത്തെ പ്ലേ ഗ്രൗണ്ട്, ഹോക്കി ടർഫ്, അവിടുത്തെ ഇൻഡോർ സ്റ്റേഡിയം, അവിടുത്തെ കോച്ചസ്, അവിടുത്തെ ഫുഡ്, പിള്ളേരുടെ താമസം എല്ലാം ഹൈടെക് ആണ്. ഹൈടെക്. crores of rupees was spent. And അത്രയും വലിയ വലിയ ഗ്രൗണ്ടില് പേരൻസും പിള്ളേരും ഫ്രം ഓൾ ഓവർ കേരള ഹാസ് കം. അത് നിറഞ്ഞിരിക്കുകയാണ്. അത്രയ്ക്കാണ് കേരള ബ്ലാസ്റ്റേഴ്സിന്റെ റീച്ച്. സോ അത്രയ്ക്ക് പുതിയ പിള്ളേരാണ് സ്പോർട്സിലോട്ട് കയറി വരുന്നത്. അപ്പൊ ഇവർക്കെല്ലാം ഇഞ്ചുറീസ് വരും, isn't it? അപ്പൊ അവരുടെ കോച്ച്, ഐ വാസ് സീയിങ് ദർ കോച്ച്. അവരുടെ ഒരു കോച്ച് ഈ പിള്ളേർക്ക് സെലക്ഷൻ നടത്തുക, ഗോൾ കീപ്പറിന്റെ സെലക്ഷൻ. രാവിലെ തൊട്ട് വൈകുന്നേരം വരെ. ക്യാൻ യു തിങ്ക് ഓഫ്? രാവിലെ ഞാൻ കണ്ടതാ പുള്ളി. ഐ വാസ് ദർ അറ്റ് ജീവരാജ ഫോർ സം അതർ പർപ്പസ്. അപ്പൊ അവിടെ കാണുമ്പോൾ രാവിലെ ഹി വാസ് ഓൺ ദ ഗ്രൗണ്ട് ആൻഡ് ഹി വാസ് ട്രെയിനിങ് ദ സ്റ്റുഡൻസ് ആൻഡ് ഹി വാസ് സെലക്ട് ചെയ്യുക. അപ്പൊ അതിൽ ഒരു ഗോൾ കീപ്പേഴ്സ് ഒരു 10-30 പേര് വന്നിട്ടുണ്ട്. അപ്പൊ അവർക്ക് ഇങ്ങനെ ഓരോരോ സൈഡിൽ ബോൾ ഇട്ട്, അസിസ്റ്റൻസ് ബോൾ ഇട്ട് കൊടുക്കുന്നു. പുള്ളി ഹി സ്റ്റാൻഡിങ് ഓൺ ദ സൺ, സ്കോർച്ചിങ് സണ്ണിന്റെ അണ്ടറിൽ നിൽക്കുക ഫ്രം മോർണിംഗ് ടിൽ ഈവനിങ്. ഹി മേ ബി അറൌണ്ട് 50 ഏജ്. പക്ക ഫിറ്റ് ആയിട്ടുള്ള ഒരു മനുഷ്യൻ. സോ തിങ്ക് സയൻസ് അവിടെ ആക്ട് ചെയ്യുന്നുണ്ട്. അവരുടെ സയൻസ് ഈസ് മച്ച് ഹയർ. അത് വെച്ചിട്ട് അവരുടെ ഫിസിക് മെയിൻറ്റെയിൻ ചെയ്യുന്നുണ്ട്, അവരുടെ ഫിറ്റ്നസ് മെയിൻറ്റെയിൻ ചെയ്യുന്നുണ്ട്. ദർ ഇസ് നോ ഇഞ്ചുറി, ദർ ഇസ് നോ ടയർഡ്നെസ്. നമ്മളാണെങ്കിലോ പേരൻസ് വെളിയിൽ കിടന്ന് ക്ഷീണിക്കുന്നുണ്ട്. പിള്ളേരുടെ കൂടെ വന്ന പേരൻസ് അയ്യോ നിർത്തുന്നില്ല. പിള്ളേർക്ക് ഒരു കുഴപ്പമില്ല, പിള്ളേരും സ്റ്റഡി ആയിട്ട് നിൽപ്പുണ്ട്. ചിലരൊക്കെ ക്ഷീണിച്ച് വിട്ടിട്ട് പോയി. കുറെ പിള്ളേർ സ്റ്റഡി ആയിട്ട് 10-30 പേരെ ഞാൻ വൈകുന്നേരം ചെന്നപ്പോഴും 10-30 പേര്. ഡാർക്ക് ആകാൻ തുടങ്ങിയപ്പോൾ അവർ നിർത്തി. അതുവരെ കൃത്യമായിട്ട് ഉച്ചയ്ക്ക് ലഞ്ച് കഴിച്ചു, ഹാഫ് ആൻ അവർ കഴിഞ്ഞിട്ട് പിന്നെയും ഗ്രൗണ്ടിൽ. അത് കാണണ്ടാണോ? പ്രൊഫഷണൽ പ്രിപ്പറേഷൻ. യെസ്, നെക്സ്റ്റ് സ്ലൈഡ്. സി ദ ഇഞ്ചുറി ലിസ്റ്റ്. ഞാൻ പറഞ്ഞില്ല, സ്പോർട്സ് അനലിസ്റ്റുകൾ നമ്മുടെ ഇവിടെ നടത്തുന്നുണ്ട്. ഇപ്പൊ ഇത് ഇഞ്ചുറി ലിസ്റ്റ് എനിക്ക് നെറ്റിൽ നിന്ന് കിട്ടിയതാണ്. ക്രിസ്ത്യാനോ റൊണാൾഡോയുടെ സി സീസൺ എഴുതിയിട്ടുണ്ട്. 13-14 സീസണിൽ മസ്കുലർ പ്രോബ്ലംസ് ഉണ്ടായിരുന്നു. എത്ര ദിവസം റെസ്റ്റ് എടുത്തു? 14 days. ഗെയിംസ് മിസ്ഡ് 2 ഗെയിം. തൈ പ്രോബ്ലം 17 days. ടോൺ മസിൽ ഫൈബർ 11 days. കാണാമല്ലോ അല്ലേ? 21-22 പ്രോബ്ലം വിത്ത് ഹിപ്പ് ഫ്ലെക്സർ 4 days, 7 days. ആംസ് ഇഞ്ചുറി 4 days. ടോപ്പ് മോസ്റ്റ് അത്ലീറ്റ് Cristiano Ronaldo. See this injury list, they prepare the injury list and it affects their career. അപ്പൊ ഇന്ത്യയെ സംബന്ധിച്ച് ഈ ഇംഗ്ലീഷ് പ്രീമിയർ ലീഗിനെ വരെ ഒരു കാലത്ത് ISL will overcome that. Do you think that? അങ്ങനെ പറ്റുമോ? What is the reason? സെക്കൻഡ് മോസ്റ്റ് പോപ്പുലേഷനിൽ ഏറ്റവും കൂടുതലുള്ള കൺട്രി ഇല്ലേ? മലപ്പുറത്തെ കാര്യം പറഞ്ഞു. മലപ്പുറത്ത് ഇവിടെ ഒരു ISL മാച്ച് സന്തോഷ് ട്രോഫി നടന്നു. അവിടെ ടിക്കറ്റിന്റെ റേറ്റ് കണ്ടോ? സീറ്റ് വേക്കന്റ് ഉണ്ടായിരുന്നോ? ഇല്ല. ബിക്കോസ് ഇത് സോഷ്യൽ മീഡിയയിൽ കൂടെ എല്ലാം ഇത് വരുമ്പോഴത്തേക്ക് ഇവിടെ ഇന്ത്യ ഇസ് ഗോയിങ് ടു ബി എ ട്രില്യൺ എക്കണോമി. അതിൽ സ്പോർട്സിന് വലിയൊരു പങ്ക് വരാൻ പോവാണ്. സ്പോർട്സിന് വലിയൊരു പങ്ക്. ഫോറിൻ പ്ലേയേഴ്സ് ആർ കമ്മിങ് നൗ. നീ പേര് കേട്ട ഫോറിൻ പ്ലേയേഴ്സ് ഇവിടെ വരും. ചെറിയ ഏരിയ അല്ല, ഇത്രയും വലിയ ഏരിയ, ഇത്രയും വലിയ പോപ്പുലേഷൻ, ഓക്കെ, ഇത്രയും വലിയ ടാലന്റ് ഡെവലപ്പ് ചെയ്യുന്നു. അപ്പൊ അതിൽ കൂടെയൊക്കെ ഇന്ത്യ ഇസ് ഗോയിങ് ടു ബി സൂപ്പർ പവർ. ദർ ഇസ് നോ ഡൗട്ട്. യെസ്, നെക്സ്റ്റ് സ്ലൈഡ്. ദെൻ വോളിബോളിലെ ഇഞ്ചുറീസ്, ആങ്കിൾ ട്വിസ്റ്റ്, നീ പെയിൻ, ഷോൾഡർ പെയിൻ. അപ്പൊ ഇതില് വോളിബോളിന് ഞാൻ വിളിച്ചത് സണ്ണി സാറിനെ അറിയാവോ? നമ്മുടെ വോളിബോൾ ലീഗ് ഈ പ്രാവശ്യം ജയിച്ച ഏത് ടീമാ അറിയാമോ? ഏത് ടീമാ ജയിച്ചെന്ന്? വോളിബോൾ ലീഗ് നടന്നായിരുന്നു. ടിവിയിലേക്ക് നിങ്ങൾ കണ്ടു കാണും. കൽക്കട്ട എന്നൊരു ടീമാ ഇല്ലേ? ആ ടീമിന്റെ കോച്ച് ആയിരുന്നു സണ്ണി സാർ. ഓക്കെ, സണ്ണി സാറിന്റെ മോനാണ് സന്ദീപ് സാർ എന്ന് പറഞ്ഞിട്ട് തേവര കോളേജിലെ ഫിസിക്കൽ എഡ്യൂക്കേഷൻ പ്രൊഫസർ. So Sunny sir, he is in Khelo India, ജീവരാജയിൽ. ആഫ്റ്റർ റിട്ടയർമെന്റ് he is serving. അപ്പം സണ്ണി സാർ പറയുകയായിരുന്നു, ഇവരുടെ ഈ കൽക്കട്ട നൈറ്റ് റൈഡേഴ്സ് അവരുടെ ടീം കോച്ചായിട്ട് ഇരിക്കുമ്പോഴത്തേക്ക് ഒരു കളി ജയിച്ചാൽ 1 lakh rupees. ഒരു കളി ജയിച്ചാൽ 1 lakh rupees. He got 9 lakh rupees out of that one season. Okay, just think of the money involved. ഇത് തുടക്കമാണ്. നീ ഇവിടുന്ന് കയറി വരാൻ പോവാ. ജസ്റ്റ് തുടക്കമാണ്. എനിക്ക് തോന്നുന്നു 2-3 സീസണേ അതായിട്ടുള്ളൂ. നീ മുന്നോട്ട് വരാൻ പോവാ. സോ അവിടെ സൺസാർ വന്ന പിള്ളേർക്ക് ട്രെയിനിങ് കൊടുക്കുമ്പോഴത്തേക്ക് ഞങ്ങളിപ്പം പിള്ളേരെ സെലക്ട് ചെയ്യാൻ പോയി ജീവരാജയിലേക്ക്. ഐ വാസ് ഓൾസോ ഇൻ ദ ഇന്റർവ്യൂ ബോർഡ്. സണ്ണി സാർ ഇരിക്കുക വോളിബോളിലെ പിള്ളേരെ സെലക്ട് ചെയ്യുമ്പോഴത്തേക്ക്. ഒരുത്തനോട് പറഞ്ഞു നീ അങ്ങ് പോയിരുന്നേ, അങ്ങ് അറ്റത്ത് പോ. അപ്പൊ അവരുടെ ഹൈറ്റ് എന്ന് വെച്ചാൽ 190 ഒക്കെയാ ഹൈറ്റ്. 190 8ാം ക്ലാസ്സിൽ പഠിക്കുന്ന കുട്ടികളുടെ ഒന്ന് ഓർത്ത് നോക്കിയേ. അവരെയൊക്കെയാ കൊണ്ടുവന്നിരിക്കുന്നത്. അതായത് 14 ഡിസ്ട്രിക്റ്റിലും സ്പോർട്സ് കൗൺസിലിൽ നിന്ന് ടീം പോയി, എക്സ്പേർട്സ് പോയി, അവിടുന്ന് പിള്ളേരെ സെലക്ട് ചെയ്തിട്ട് ഫൈനൽ സെലക്ഷന് വേണ്ടി സെലക്ടഡ് പിള്ളേരെ ട്രിവാൻഡ്രത്തോട് വിളിച്ചിരിക്കുക. അതിൽ നിന്ന് 1/3 പിള്ളേരെ സെലക്ട് ചെയ്യും ഫൈനലി ജീവരാജയിലേക്ക് വേണ്ടി. അപ്പൊ ഇവരെ വോളിബോളിലെ അങ്ങേയറ്റത്ത് പോയി നിൽക്കാൻ പറയും. ഞാനുണ്ട്, സണ്ണി സാറുണ്ട്, ഹൈ പെർഫോമൻസ് മാനേജർ ഉണ്ട്, ഞങ്ങൾ 3 പേര് ഇന്റർവ്യൂവിന് നിൽക്കുക. അവനോട് പറഞ്ഞ് നിക്കർ ഊരാൻ പറഞ്ഞു. ഞങ്ങൾ ഞെട്ടിപ്പോയി, എന്തോ സംഭവം. അപ്പൊ നിക്കർ ഊരി, അവൻ നിക്കർ ഊരി അണ്ടർവെയർ നിൽക്കുക. നിന്റെ കാലിന് പ്രശ്നമുണ്ടല്ലോ എന്ന് പറയും. കണ്ടപ്പോഴേ മനസ്സിലാവും. അപ്പൊ അവൻ പറഞ്ഞു ഇല്ല സർ, കാലിന് പ്രശ്നമില്ല. നീ സൈഡിലോട്ട് തിരിഞ്ഞേ. അപ്പൊ അങ്ങനെ ഫുൾ അനലൈസ് ചെയ്തിട്ടാണ് ഒരു പ്ലെയറിനെ അവിടെ എടുക്കുന്നത്. ഓക്കെ, അപ്പൊ ഇതുപോലത്തെ എക്സ്പീരിയൻസ്ഡ് ആയിട്ടുള്ള കോച്ചസ്. അപ്പൊ സാറിനോട് സംസാരിച്ചപ്പോൾ സാറ് പറയുമായിരുന്നു ഇഞ്ചുറി വോളിബോളിൽ വരുന്നത് ഷൂസ് ഈസ് വെരി ഇമ്പോർട്ടൻറ്റ്. ഓക്കെ, അപ്പൊ നമ്മുടെ ഷൂസിന്റെ സൈഡ് കർവ്ഡ് ആയിരിക്കും. ആ ഷൂസ് ആണ് വോളിബോളിൽ യൂസ് ചെയ്യേണ്ടത്. പക്ഷെ ചില പിള്ളേർ എന്ത് ചെയ്യും, ഫ്ലാറ്റ് ആയിട്ടുള്ള ഷൂസ് യൂസ് ചെയ്യും, ഷാർപ്പ് ആയിരിക്കും. അപ്പൊ ഈ സൈഡ് മൂവ്മെന്റ് വരുമ്പോഴത്തേക്ക് അവരുടെ ആങ്കിൾ ഇഞ്ചുറി വരും. ഓക്കെ, ഹൈറ്റ് കുറഞ്ഞ പിള്ളേർ കൂടുതൽ ജമ്പ് എടുത്ത് ലാൻഡ് ചെയ്യുമ്പോൾ അവർക്ക് നീ ഇഞ്ചുറി വരാം. അവരുടെ വെർട്ടിക്കൽ ജമ്പ് കൂടുതലായിരിക്കും, നീ ഇഞ്ചുറി വരാം. ബ്ലോക്കിങ്ങിലൊന്നും പ്രശ്നമില്ല. ബ്ലോക്ക് ചെയ്യുന്നത് നിങ്ങൾ കണ്ടിട്ടില്ലേ, ജമ്പ് ചെയ്ത് ബ്ലോക്ക് ചെയ്യുന്നത്. അവരുടെ ഒന്നും കൈക്കൊന്നും പറ്റത്തില്ല. സാറിന്റെ ഭാഷ്യമാണ്, അവരുടെ കൈക്ക് ഫിംഗേഴ്സ് ഒന്നും പറ്റത്തില്ല, വെൽ ഇഞ്ചുറി ഒന്നും വരത്തില്ല. പിന്നെ ഈ സ്മാഷ് ചെയ്ത് പ്രാക്ടീസ് ചെയ്ത് കുറെ ചെയ്യുമ്പോൾ ഷോൾഡറിന് ഇഞ്ചുറി വരും, ഷോൾഡർ പെയിൻ വരും. അപ്പൊ അതിന് നമുക്ക് ട്രീറ്റ്മെന്റ് വേണം, ഷോൾഡർ പെയിൻ. അപ്പം ഈ ഇഞ്ചുറീസ് ആണ് നീ പെയിൻ ഇഞ്ചുറി. അതിന്റെ മാനേജ്മെന്റ് നോക്കിയാൽ അത് സാർ പറയുന്നത് സ്റ്റാബിലൈസിങ് ആങ്കിൾ വിത്ത് ബാൻഡേജ് ഡ്യൂറിങ് പ്രാക്ടീസ്. പ്രാക്ടീസിന് പിള്ളേർ ഇറങ്ങുമ്പോൾ നിർബന്ധമായിട്ടും 2 ആങ്കിളിലും അവർ ബാൻഡേജ് ചുറ്റിപ്പിക്കും. സാർ പറയും ബാൻഡേജ് ഇട്ടിട്ട് ഷൂ ഇട്ടാൽ മതി, നീ സോക്സ് ഇട്ടില്ലെങ്കിലും കുഴപ്പമില്ല, ബാൻഡേജ് ഇട്ട് ഷൂ ഇട്ട് പ്രാക്ടീസിന് ഇറങ്ങിയാൽ മതി. അപ്പൊ ആങ്കിൾ ഇഞ്ചുറി വരത്തില്ല. സാറിന്റെ കണ്ടുപിടുത്തമാണ്, ബിക്കോസ് ഓഫ് ഔട്ട് ഓഫ് ഹിസ് എക്സ്പീരിയൻസ്. ഇവർക്കൊക്കെ ഒരു 35 വർഷം എക്സ്പീരിയൻസ് ഉണ്ട് വോളിബോൾ കോർട്ടിൽ. സോ അവരുടെ വായിന്ന് വരുന്ന നല്ല നമുക്ക് നെറ്റിൽ നിന്ന് അല്ലെങ്കിൽ എന്റെ എക്സ്പീരിയൻസ് 5 വർഷത്തെ എക്സ്പീരിയൻസ് അല്ലെങ്കിൽ പ്ലേയേഴ്സിനെ കണ്ടുള്ള എക്സ്പീരിയൻസ് ഈസ് ഇൻസഫിഷ്യന്റ്. അവര് പറയുമ്പോഴത്തേക്ക് അതെന്ന് വെച്ചാൽ ദാറ്റ് ഈസ് ദ ഫൈനൽ ഇല്ലേ. സോ ആ ഒരു ഇഞ്ചുറി അതിനെ മാനേജ് ചെയ്യുന്നത് അങ്ങനെയാണ്. സ്റ്റാബിലൈസിങ് ആങ്കിൾ വിത്ത് ബാൻഡേജ് ഡ്യൂറിങ് പ്രാക്ടീസിന് ഇറങ്ങുമ്പോഴത്തേക്ക്. ടൂർണമെന്റിനെ കണിശമായിട്ട് അവർ ചെയ്യും. നെക്സ്റ്റ് സ്ലൈഡ്. ബാസ്കറ്റ്ബോൾ, ഹാൻഡ്ബോൾ, നെറ്റ്ബോൾ, ഈ 3 ഗെയിമും ഏകദേശം ഒരേ മൂവ്മെന്റ്സ് ആണ്. ഓക്കെ, ബാസ്കറ്റ്ബോൾ യു ഓൾ നോ. ഹാൻഡ്ബോൾ നിങ്ങൾക്ക് അറിയായിരിക്കും, നമ്മൾ കളിക്കുന്നത് ഇല്ലേ, ഒരു ഗോൾ പോസ്റ്റിലോട്ട് ഗോൾ അടിക്കുകയാണ്. ബാസ്കറ്റ്ബോൾ തന്നെ ഡ്രിബിൾ ചെയ്താ പോകുന്നത്. നെറ്റ് ബോൾ ബാസ്കറ്റ്ബോൾ തന്നെ ആയിരിക്കും, പക്ഷെ ഒരു ബോർഡ് കാണത്തില്ല, ഡയറക്റ്റ് നെറ്റിലോട്ട് നമ്മൾ ഷൂട്ട് ചെയ്യും. അപ്പൊ ഇതിൽ വരുന്ന പ്ലേയേഴ്സിന് വരുന്ന ഇഞ്ചുറീസ് ആണ് ആങ്കിൾ ട്വിസ്റ്റിംഗ്. ബിക്കോസ് ബാസ്കറ്റ്ബോൾ എല്ലാം ഈ ആങ്കിൾ ട്വിസ്റ്റിംഗ് ഉണ്ട്. ഓക്കെ, അപ്പൊ ആങ്കിൾ ഇളകും, ആങ്കിളിൽ സ്പ്രെയിൻ വരും, സ്ട്രെയിൻ വരാം. ദെൻ നീ ഇഞ്ചുറീസ്, ഞാൻ പറഞ്ഞ ഒരു റൊട്ടേഷൻ നീയിലോട്ട് വന്നു കഴിഞ്ഞാൽ നീ ഇഞ്ചുറീസ് കണിശമായിട്ട് വരും. ഷോൾഡർ ഡിസ്ലൊക്കേഷൻസ് ബാസ്കറ്റ്ബോളിൽ കാണുന്നുണ്ട്. ഷോൾഡർ ഡിസ്ലൊക്കേഷൻ നമ്മൾ എന്റെ കണ്ണുവെച്ചൊക്കെ ഞാൻ കണ്ടിട്ടുണ്ട്, ഷോൾഡർ ഡിസ്ലൊക്കേറ്റ് ആയി ഡിഫോംഡ് ആയി പോകുന്നത്. പിന്നെ അപ്പം തന്നെ അത് പിടിച്ചിടും, ചിലപ്പോൾ അത്ലീറ്റ് തന്നെ പിടിച്ചിടും. ഓക്കെ, അപ്പൊ ഇതിന്റെ വേറൊരു പ്രശ്നം എന്ന് വെച്ച് കഴിഞ്ഞാല് ചില അത്ലീറ്റ്സ് ഇവർ സ്വന്തമായിട്ട് ഇവർക്ക് ഷോൾഡർ അളകും, ഇവർ എന്തായാലും പിടിച്ചങ്ങിടും. ഓക്കെ, അവർ യൂസ് ടു ആയി. പിന്നെ ലിഗമെന്റ് ഇഞ്ചുറിയുടെ പ്രത്യേകത അറിയാലോ, ഒരു പ്രാവശ്യം പോയി കഴിഞ്ഞാൽ ജോയിന്റ് വിൽ ബിക്കം അൺസ്റ്റേബിൾ. പിന്നെ അത് കൂടുതൽ ചാൻസസ് ഓഫ് ഗോയിങ് ഈസ് ഹയർ ആണ്. എന്റെ മുട്ട് 9 ടൈംസ് ഇളകി, 9 ടൈംസ്. ഓക്കെ, ഇപ്പം കൃത്യമായിട്ട് രാവിലെ ഒരു 3 എക്സസൈസ് കാലിന് വേണ്ടി ഞാൻ ചെയ്യും കൃത്യമായിട്ട്. ഫ്രം ദ ലാസ്റ്റ് 3 years പ്രശ്നമില്ല. പിന്നെ അതേപോലെ കളിയും കൂടെ പതുക്കെ സ്റ്റോപ്പ് ചെയ്തു, ഷട്ടിലൊന്നും ഇപ്പം കളിക്കുന്നില്ല. ഓക്കെ, സോ അങ്ങനെ ഞാൻ മാനേജ് ചെയ്യുന്നത്. പക്ഷെ ഒരു പ്രൊഫഷണൽ അത്ലീറ്റിനെ സംബന്ധിച്ച് അത് പറ്റത്തില്ല. സോ ഹി ഹാസ് ടു പെർഫോം. അവന്റെ കഞ്ഞിയാണത് അല്ലെ. സോ അവന്റെ ഡ്രീംസ് ആണത്. സോ അവിടെ അവർക്ക് അത് പറ്റത്തില്ല. സോ അവിടെ നമുക്കൊരു എന്താ പറയുക, ഒരു ഇന്റർവെൻഷൻ വേണ്ട വരും. Then quick movements, overtraining is the causes. Management, the same management. Ayurveda treatment, ankle injuries എടുക്കുന്നുണ്ട്. നെക്സ്റ്റ് സ്ലൈഡ്. ലെബ്രോൺ ജെയിംസിനെ അറിയാത്ത ആരും കാണത്തില്ല, പ്രൊഫഷണൽ ബാസ്കറ്റ്ബോൾ പ്ലെയർ. ആൻഡ് ഇദ്ദേഹത്തിന് ഏറ്റവും കൂടുതൽ ഇദ്ദേഹമാണ് ബാസ്കറ്റ്ബോൾ NBA സർക്യൂട്ടിൽ ഈ മാച്ചസ് മിസ് ചെയ്തതും കുറെ കാലമായിട്ട് കളിച്ചുകൊണ്ടിരിക്കുന്നത് ലെബ്രോൺ ജെയിംസ്. പക്ഷെ ഹി വാസ് ഓൾസോ ഇഞ്ചുറി ഇഷ്ടം പോലെ വന്നിട്ടുണ്ട് അദ്ദേഹത്തിന്. See, after missing practice and shoot around for the Lakers of the last 2 days, the latest report indicates LeBron James is exploring all option to make his return. ഇപ്പോഴും ഇഞ്ചോർഡ് ആണ്. February 2, 2022 ഏറ്റവും കൂടുതൽ റിട്ടേണിൽ വന്നിട്ടുള്ള ആളാണ് ലെബ്രോൺ ജെയിംസ്. ലെബ്രോൺ ജെയിംസിന്റെ ഇഞ്ചുറി ഹിസ്റ്ററി ഉണ്ട്, ഞാൻ ക്രിസ്ത്യാനോ റൊണാൾഡോയുടെ കാണിച്ച പോലെ തന്നെ. അതിൻ്റെ അകത്ത് ഭയങ്കര ഇഞ്ചുറീസ് ആണ് പുള്ളിക്ക് ഉള്ളത്. അബ്ഡോമിനൽ ഇഞ്ചുറി ഉണ്ട്, ഓക്കെ, ആങ്കിൾ ഇഞ്ചുറി ഉണ്ട്, നീ ഇഞ്ചുറി ഉണ്ട്, ഗ്രോയിൻ ഇഞ്ചുറി ഉണ്ട്, ഇതെല്ലാം ഉണ്ട് ഇദ്ദേഹത്തിന്. And then he has come back. അപ്പോ നെക്സ്റ്റ് സ്ലൈഡ്. റെസ്ലിംഗ്, ജൂഡോ. റെസ്ലിംഗ് നമുക്കറിയാം, ഈ പ്രാവശ്യം നമുക്ക് കോമൺവെൽത്തിൽ ഏറ്റവും കൂടുതൽ മെഡൽ നേടിയെടുത്ത സ്പോർട്ടാണ് റെസ്ലിംഗ്. ഇന്ത്യൻ സ്പോർട്ടാണ്. പണ്ട് തൊട്ടേ നമുക്ക് റെസ്ലിംഗിലെ മെഡൽ നമുക്ക് ഇഷ്ടം പോലെ നമുക്ക് കിട്ടുന്നുണ്ട്. സുശീൽ കുമാറിനെ നിങ്ങൾക്ക് അറിയാം ഇല്ലേ? ഹീസ് ഇൻ ജയിൽ നൗ. പിന്നെ വേറെ സാക്ഷി മലിക്കിനെ അറിയാം, വിജയകുമാർ ദാലിയെ അറിയാം. ഇവരെല്ലാം ഇപ്പം മെഡൽ വാങ്ങിച്ചിട്ടുള്ളവരാണ്. അപ്പൊ അതിൽ ഇഞ്ചുറീസ്, നീ ഇഞ്ചുറീസ്, ആങ്കിൾ ഇഞ്ചുറീസ്, ഷോൾഡർ ഇഞ്ചുറി, സർവിക്കൽ വെർട്ടിബ്ര ഇഞ്ചുറി, എൽബോ ഇഞ്ചുറി. സർവിക്കൽ വെർട്ടിബ്ര ഇഞ്ചുറി എന്താ ഇവർക്ക് വരാൻ കാര്യം? നിങ്ങൾ കണ്ടു കാണുക, ഇവര് തലയിലാണ് നിൽക്കുന്നത് ഇല്ലേ? നെക്ക് ഭയങ്കര സ്ട്രോങ് ആയിരിക്കണം. കാല് പോലത്തെ സ്ട്രെങ്ത് വേണം നെക്കിന്. നെക്ക് വെച്ചാണ് റെസ്ലിംഗ് കളിക്കുന്നത്. ബാക്ക് പോർഷൻ ഇവിടെ നമ്മൾ മാറ്റ് ടച്ച് ചെയ്ത് കഴിഞ്ഞാൽ 3 seconds ടച്ച് ആയി കഴിഞ്ഞാൽ ആള് ജയിച്ചു, മറ്റേ ആൾ ജയിച്ചു. അതുകൊണ്ട് അവര് ബാക്ക് പോർഷൻ ടച്ച് ചെയ്യുമ്പോൾ ഉടനെ അവർ ബ്രിഡ്ജ് ചെയ്യും. തലയിലാണ് നിൽക്കുന്നത്. അപ്പൊ അവിടെ നെക്കിനാണ് ഭയങ്കര പവർ. അതുകൊണ്ട് അവർക്ക് സെർവിക്കൽ വെർട്ടിബ്ര ഇഞ്ചുറീസ് കോമൺ ആണ്. അപ്പൊ അവിടെ ഇന്റർവെൻഷൻ വേണം. കോസസ് ക്വിക്ക് ആൻഡ് ഹെവി മൂവ്മെന്റ്സ് ആണ് റെസ്ലിംഗിൽ ഇല്ലേ? നിങ്ങൾ കാണാം 54 kg എന്ന് പറയുന്നത് ആളിനെ കണ്ടാൽ 54 kg തോന്നത്തേ ഇല്ല, ഭയങ്കര സ്റ്റൗട്ട് ആയിരിക്കും ഇല്ലേ? അപ്പൊ കേരളത്തിലെ ഒരു 100 kg എന്ന് പറഞ്ഞ ഒരാൾ പോകുമ്പോൾ വയറൊക്കെ ചാടി ഭയങ്കര ഹെവി ആയിരിക്കും. അവിടെ ഹരിയാനയിൽ ചെന്ന ഈ 100 kg ആളിനെ കാണുമ്പോൾ നമ്മൾ അയ്യോ അവന് 100 kg ഉള്ളു, അവനെ കണ്ട ഒരു 54 kilo ഒക്കെ തോന്നുള്ളൂ. മെലിങ്ങിട്ട നല്ല ബിൽഡ് മസിൽ ഉള്ള ആളായിരിക്കും. നോക്കിയ ആ ഒരു അവസ്ഥ. സോ ഈ റെസ്ലിംഗ് സ്പോർട്ടില് ഇവരെയൊക്കെ നിങ്ങൾ കണ്ടിട്ടുണ്ടല്ലോ, സുശീൽ കുമാറിനെയും ഇവരൊക്കെ എന്തുമാത്രം സ്റ്റൗട്ട് ആണ് അവര്. അപ്പൊ അവർ അത്രയ്ക്ക് ഹാർഡ് എക്സസൈസ് ചെയ്ത് ഫുൾ ബോഡിയാണ് അവരുടെ എക്സസൈസിൽ എടുക്കുന്നത്. ബൗട്ട് ചെയ്യുമ്പോൾ അതുപോലെ തന്നെ ഫുൾ ബോഡി. അപ്പൊ അവർക്ക് ഫുൾ ബോഡിയിൽ ഇഞ്ചുറി വരാൻ ചാൻസ് ഉണ്ട്. മാനേജ്മെന്റ്, റൈസ് തെറാപ്പി, ഫിസിയോതെറാപ്പി, സർജറി. നെക്സ്റ്റ്. ദങ്കൽ മൂവി കണ്ടിട്ടുള്ള എത്ര പേരുണ്ട് ഇവിടെ? ദങ്കൽ, യെസ്. ദങ്കലിലെ ഹീറോയിൻ ആണ് ഇവർ, ഗീത ആൻഡ് ബബിത ഫോഗട്ട്, സിസ്റ്റേഴ്സ്. സൈറ്റ് ഇഞ്ചുറീസ് ഫോർ ഇന്നബിലിറ്റി ടു അറ്റൻഡ് നാഷണൽ ക്യാമ്പ് ആഫ്റ്റർ WFI സാങ്ഷൻ. WFI എന്ന് വെച്ചാൽ നമ്മുടെ റെസ്ലിംഗ് ഫെഡറേഷൻ ഓഫ് ഇന്ത്യ, അവരുടെ സാങ്ഷൻ ചെയ്യാൻ കാര്യം അവർക്ക് ഇഞ്ചുറീസാ. രണ്ടുപേർക്കും ഇഞ്ചുറീസാണ്. എനിക്ക് വന്ന ഗീത ഫോഗട്ട് ഈ പ്രാവശ്യവും പോയില്ല, കോമൺവെൽത്തിനും പോയില്ല, ഇഞ്ചുറി കാണാൻ തന്നെ മിസ്സായെന്ന് എനിക്ക് തോന്നുന്നു. സോ ഇതൊക്കെ നമ്മുടെ ഷുവർ മെഡൽസ് ആയിരുന്നു. ഇതെല്ലാം നമുക്ക് മിസ്സായി ബിക്കോസ് ഓഫ് ഇഞ്ചുറീസ്. നെക്സ്റ്റ്. Okay, so with this I finish, and I hope you have got a fairly good picture of sports and what is happening in the sports field and how you can, contribute your interventions and contributions through research study. Thank you very much.
Thank you so much, sir, for your valuable information. Now, I would like to welcome Dr. Sriraj SK, Associate Professor, SFRA Convener, Ayur Sports, to honor Dr. Augustine George, Associate Professor, Physical Education, Government Medical College, Kottayam, with a memento as a token of gratitude for his valuable time and this wonderful session. Now, the time is approaching for lunch. We request all of you to kindly assemble here before 1:45. After the lunch break, there will be a seminar by Dr. Sheila Karalam B., Chief Scientist, Head R&D, Vaidyaratnam Ayurveda Research Institute, Olur, on the topic Innovative Formulation. Thank you.
പവർ കുത്തിയിട്ടുണ്ടാവും. ഈ സ്വിച്ച് ബോർഡ്, ആ സ്വിച്ച് ബോർഡ് പവർ ഉണ്ടോ? ആ ഓഡിയോ ഉണ്ടോന്ന് അറിയാൻ പാടില്ല, നോക്കാം. ആ കൊടുക്കണേന് കുഴപ്പമൊന്നും. ആ ഇതിൻ്റെ അകത്ത് ഏതാണോ? ഇതിൻ്റെ അകത്ത് ഏതാണ്? ഏത് ഫയലാണ്? SRF ആണ്. ആ അപ്പൊ കുഴപ്പമില്ല. Wow, very good. സമണ്ടില്ല അതുകൊണ്ട് പിന്നെ കുഴപ്പമില്ല.
Now, we would like to call Dr. Sheila Karlam B, Chief Scientist, Head R&D, Vaidyaratnam Ayurveda Research Institute, Ullu, to give knowledge of innovative formulation. She was graduated from Vaidyaratnam Ayurveda College, Taikatasheri, Thrissur, and did post-graduation diploma in Dravyaguna Vijnanam from Government Ayurveda College, Trivandrum. She has a 35 years experience. She is a retired district medical officer, ISM Department of Ayush, Kerala. She was a former state quality consultant, quality control ASU drugs and medicinal plants, National Ayush Mission, former special officer in research and development, Aushadhi, Thrissur. She was honored with Order of Merit Gold Coach Award and Emerging India Health Category Silver Award, Coach Group, New Delhi, for the Community Healthcare Intervention Program of National Ayush Mission. The Dhanvantari Award, Best Doctor Award, Kerala State 2017 category for the contribution to treatment and research field in Ayurveda. Saktayam Award for Best Researcher in ISM Department. Clean Office Award of Shujitwa Mission, Kannur. I kindly request ma'am to lead the seminar.
Thank you very much. I would like to thank SFRA for giving me a chance to address you. My topic is on innovative formulations. In the forenoon session, I think that you have so many best classes on sports Ayurveda, and the matter given to me is innovative formulations. Considering my experiences in the research and development program in Aushadhi as well as in ISM department, I am very, with pleasure, I would like to share my some knowledges I have gathered from this system to you. I remember my colleagues in ISM department, Dr. N.V. Srivals, Dr. Jayan, Dr. Suresh Kumar, Dr. P.R. Jaya, Dr. Pillai, then ISM directors. So many people are very much interested in sports Ayurveda research program. And initially, I had an experience with the Department of ISM department in the research, Ayurveda research team art. And fortunately, I had a chance to work with the SARC, that is State Sports Ayurveda Research Cell in ISM department. And during my tenure in Thrissur as a DMO, I got a chance to work with the SARC cell as well as the KISAR, Kerala Institute for Sports Ayurveda Research. And with all the experiences myself gathered from this experience, this activities, I would like to share to you some valuable points on the innovative formulations. Sports Ayurveda focus on physical fitness, performance, prevention and management of sports injuries. You know, during the pre-event session, on-field session, post-event event management, it is done through the principles and practices prescribed in Ayurveda. And let me see the SWOT analysis on this. After that, we could develop this innovative formulations. What is the strength of Ayurveda in this segment? It is doctrine of fundamental principles, diagnostic tools, treatment protocols based on Ashtanga Ayurveda. During my tenure in Thrissur, we developed a protocol for the sports Ayurveda based on this Ashtanga Ayurveda, that segments. And our strength is mainly on prevention, rehabilitation, formulations and applications, and expertise. And we are having unique treatment procedures like Panchakarma and Bandhana Karmas, massaging techniques like that. Then what are the weaknesses? Limited emergency medicine. In sports Ayurveda, emergency medicines are of very high importance. Then lack of clinical documentation. From my experience, it is noticed that so many activities are going on in sports Ayurveda, but the proper documentation is not yet done properly, not yet done. So it is a gap in our documentation program, and proper courses focusing on Ayur Sports. But recently, School of Research in Ayurveda, Fundamental Research in Ayurveda, has developed a syllabus for sports Ayurveda. I think that's it is it started that next year onwards. Fortunately, I got a chance to go through the syllabus, and based on that syllabus, I taken some points from that particular syllabus too in my this paper. And lack of sportsman spirit in action. Everywhere it is, the sportsman spirit is not there in our actions. Then lack of policies regarding this sports Ayurveda implementation in our segment. What are the opportunities? When we go through the opportunities, that's SWOT analysis. The opportunities are of high concentration. That is development of event-based protocols and diet, development and research in nutriculary system, development of supportive aids in physiotherapy, sports cosmetics, and sports psychology, development of unique dietary pattern in sports nutrition, event-based, like Dhatu Samrakshanam, etc., based on the sports nutrition calendar. Technology transfer from CFTRI Mysore. Central Food Technology Research Institute, Mysore, they have developed so many food patterns. So some food patterns we could hire from, we could purchase from them, and we could implement in our compositions. Then capacity building programs for policymakers, sports authorities, coaches, and athletes. In our Ayur Sports program, SARC program, we have done that kind of activities for sports authorities, coaches, and athletes as a part of its outreach activities. Then the threats, regulatory issues regarding the licensing issues for drugs, FSSAI drugs for nutrition, FDA cosmetic licenses, etc. Then lack of documentation and product validation. That is why we are afraid about this, afraid of this doping mechanism. Because if we are having the process product validation that the Shimulanishnam is not containing any steroids, if we validate it and it is documented, it will be the supportive. So it will be supportive for the product validation program. Then concepts. We have some concepts. This I have taken from our the syllabus of this fundamental principles in sports Ayurveda. this our Panchabhuta Siddhanta Tridosha, knowledge on Asti Sandhi, Marma Sharira, then treatment principles like Bahya Bhendra, Sattva Vijaya, Panchakarma, Rasayana, etc. And I have included Agada Tantra, Balaji Gulsa, Shalya Tantra, Bandhana Vidhi, Parasurgical practice. Everything is related with this sports Ayurveda. Then Manasika Arogyam, Swastha Vrta, nutrition, exercises, code of ethics, and a range of practices of single drugs and formulations. This is the major area of my presentation. Sports pharmacology. If you analyze the sports pharmacology, we would see this Debaniyam, Jivaniyam, Brahmaniyam, Santhaniyam, Balyam, Hridyam, Ojasyam, Trishna Nigraham, Shobhaharam, Shramaharam, Shida Prashamanam, Daha Prashamanam, Angamarda Prashamanam, Shula Prashamanam, Shonida Stabanam, Vedana Stabanam, Sapnya Stabanam, Rekta Prasadanam, Vayastabanam, Methyam, and Rasayanam. These are the common sports pharmacology seen. Then, what are the sources? We are having our own compositions for the management of various disorders, diseases, conditions. Everything is there. We have so many that compositions are having various indications. If we analyze the fallosrudi of these compositions and effectiveness from our clinical experience, we could develop a very unique segment for the management of sports injuries as well as its post-event management and preparedness. It's based on this Ekaushidis, Vargas, Ganas, Yogas, Anubhuta Yogas or applications, then pharmaceutical modification practices. This purpose of innovation, my text is innovative formulations. So based on the pharmaceutical modification, and what is the purpose of innovation? It is to come up with new ideas and technologies that increase productivity and generate greater output and value with the same input. These innovations could be done in classical formulations, procedures too, then applications. Some in our application, this kinesiology, we could it is possible to develop some medicated tapes could be used in the kinesiology. Then here comes the new drug delivery system. What is the method by which a drug is delivered can have a significant effect on its efficacy. For example, I have selected this Nagaradi labor because I have done I had an opportunity to guide a student from Parashanikadava, and it was based on a hydrogel based out of this Nagaradi labor. It's an input. The lead is traditional product Nagaradi labor churnam plus the juice of tender coconut rind for Abhigadaja Shopam. The management of Abhigadaja Shopam, it is applied. The process I adopted is hydrogel technology. Output was user-friendly, cost-effective Nagaradi hydrogel. It was practiced in the sports medicine division of Kannur Ayurveda district hospital. And we got a very good result in that particular composition. And the Nagaradi, the usage of Nagaradi, if you put it in our practices, if we mix it with this tender coconut juice, tender coconut rind juice, we should take 10 gram or 15 gram or 20 gram for the application. If we analyze, if we prepare this into the Nagaradi gel form, this hydrogel form, the percentage of Nagaradi will be reduced, but its activity is more in a minimal dose itself. New drug delivery, relative terminologies. So technology upgradation should be there. Then modification, it is a terminology. Then reformulation. Reformulation means the process of altering composition to improve the product's health profile. Combination, we are having permutation combinations with so many additives or some other combination of one or two drugs. Then repurposing, this is done by modifying a product to fit a new use or by using the product in a new way. It is, for example, Vaishvanara Churnam. Vaishvanara Churnam, it is mentioned in the management of digestive disorders, isn't it? So it could be in our practice in palliative care, we developed a suppository out of this, made out of this Vaishvanara Churna. And it was very good result. for this, Vaishwana Churna was combined with this jaggery and prepared a varti, and that rectal suppository was done, and it is practiced in palliative care, where this habitual constipation is there, then manual bowel evacuations should be done. At that places, we provided this varti, and we got a very good result in this. That is Vaishwana Churna made into a varti. It is made into a suppository, and it is practiced in palliative care. That's for the management of constipation. So this is repurposing of some compositions. The new drug development, here we require the interdisciplinary approach, because we need the support of pharmacy, my biotechnology, or my biochemistry, or like that. So many interdisciplinary practices we should have. Then translation research. Here, some translations of our procedures into a modern, with the support of this modern technology, we will analyze and propagate our compositions or our practices in a user-friendly or in a translational mode. Then drug research methodology. Here, the advantage is new drug development based on traditional pharmaceutical principles and practices, user-friendly presentations, handy operations, cost effectiveness, targeted approach, minimum dose at maximum efficacy. It's the advantage of this new formulation, new drug delivery mechanisms, and how it is designed. Here, the selection of the component is of very important. Then component quality, its a ratio. Then method. If you prepare the product, if you are preparing a water in oil preparation, what should be the control points? Like that, so many control points are with this kind of modification practices. Then process time, fuel, then temperature, then dosage form, which dosage form we require, the mode and time of administration, what are the vehicles to be followed, then selection of technology, which kind of technology we should take, then product presentation, how it is presented. Innovation in formulations. This is these are the segments, that pharmaceutical products or dosage forms, nutraceutical products, cosmeceutical products. This could be taken from classical compositions or user-friendly modification, new design and development. These are required in the innovation steps. This is the Nagaradi Lepa Churna in the form of a herbal hydro gel. This is a translate. This is translation research. This is translated. That particular churna is translated into gel form. And our program is also a translation. That is this sports Ayurveda. We are creating a new product, that is sports Ayurveda. This is kind of reformulation too. We are reformulating Ayurveda to sports Ayurveda. Then Konnaila Kadagadi labum, it was done as a water soluble cream. It is a label, Keke labum of Avashidhi. Amardutrin Kashay, one of my colleague, Dr. Sridarshan from Medical Officer ISM, he has done a rectal suppository Amardutrin Kashay as an antipyretic drug. Then Vaishwana Churna suppository, I have told you about that. Then Kamadukhairasam, oral liquid syrup from effect of Kamadukhairasa. It's a value-added product modification of Kamadukhairasa. Then which are the possible dosage forms to be followed, to be handled in this sports Ayurveda? Tablets, kind of tablets, our existing tablets could be around, manually rolled tablets could be made into tablet form, punch tablet form, then capsules, then kashayas are converting to kashaya to tablet. That is 15 ml kashaya is equal to 2 tablets. Like that, we should keep our activities, that procedure, and that should be given 30 minutes before the food, because the disintegration time should be restricted under 30 minutes. More than 30 minutes, its action will not be properly done. So that kind of control points we should adapt there. Then chewable tablets, lozenges, soft gel capsules, effervescent tablets. Ashtachurna could be made into effervescent tablet. Like that, sublingual nanofilm. One of my students, she is doing nanofilm and antacid. In modern medicine, nanofilm is provided as antacid. Disposable tablets, internal and external. Recently, we got information on bath bomb. Saji, do you know about bath bomb? So it is a dispersible tablet form. So the 15 to 20 gram will be the dose. So it is put in the boiling water. We are not having enough time to prepare this water for this bathing. That is avagaha for avagaha or for bathing. Some medicated bath bathing water, that is it is not prepared. So this is a new form. The avagaha products could be made into a bath bomb. That bomb could be made put in this bathtub having this hot water. So it will disperse easily, slowly, and the water will get medicated like that. Some recently we got an idea like this regarding this bath bomb. So then dispersible tablets, then granules, syrup, suspension, lotion, liniments, water-soluble topical applications, transdermal patches, or plain plasters. This is the major thing we could adopt in this sports medicine. Sprays, hydrogel, immugel, microemulsion, cream, gel, polymerized gel. Polymerized gel means once one polymer chemistry engineer approached Aushadhi. And he was having one or two gels from turmeric, then the juice of this haridra and juice of the kashaya for rectajana. He has made some gels. And he came there and asked me why we are not, why don't we prepare a gel from this Dhanandaran Kashayam? Dhanandaran Kashayam, that could be used as the base for the micro massaging in physiotherapy. Micro massaging. So that, but he cannot, he was not able to prepare the gel from Dhanandaran Kashayam because it is having starch. Dhanandaran Kashayam is having starch, that is Seva Kola Kulatha is there. So the starch is having high level starch. So the Dhanandaran Kashaya cannot be made into a gel. That was his query. So like that, so many polymerization techniques in the polymer chemistry could be adopted here for the preparation of gel. But we are having gel as base. That is normal gels as base. Then ointments, balm, inhalers, suppository, dental cons, paste, gargles, mouthwash, plasters, medicated tapes, like that. Then here, proper novel drug delivery, water-based external applications, hydrogel. In sports Ayurveda, water-soluble creams, spray, oil-based soft gel capsules with the potentiating methods. Then ointments, creams, emulgels, liniments, spray, herbal transdermal patches, creams, plain plasters, bandages, suppositories, powder sachets, sublingual drops, tabs, discs, nanofilms, phytoslab, phyto-POP. That could be done with this Tudinda Pala, phytoslab. Phyto-POP could be done with Elundishadi lepam. It is having this Tudinda Pala. I'm not remembering its botanical source, but some studies are done in Tripuntra Ayurveda College regarding its pharmacognostical assessment. Then cold packs. Morivenna, the juice of Morivenna leaves could be made into cold pack. Cold pack is frequently used in sports medicine. Then dietetics, Nutri-bars, Nutri-balls, noodles, granules, microfine powders, health drinks, fruit drinks, soup. These are coming under this dietetics. We are having Sevika in our system, isn't it? One dietetic form is Sevika. That could be made into noodles. We are having so many patya, this Odana, like that, so many patyapatyas given in our system. For why should we, why we are not thinking about a noodle? Noodles could be developed based on our system. Then hydrogel. For hydrogel, we could analyze this Kumari, Nagaradi Lebam, Kolakulathadi, Kottam Chukadi. Kolakulathadi is applied in Vipugadi and Dhani Amla. So Amla product is there. It is aqueous. It is aqueous media. So hydrogel, it will be a very good composition. Kottam Chukadi. Kottam Chukadi could be applied in Dhanyamalam or in Kanjigam or in Chinjaswarasam or like that. So many various types of media vehicles could be analyzed and that could be incorporated in the preparation of this hydrogel. Then Murivenna leaves could be made into hydrogel. So, but some lipid medium is required for some compositions because that is for some dry skin, lipid medium is required. Then shigru juice. Idinil, Kilimaram, Commiphora cordata. It is a very good composition. Then hydrogel. Hydrogel, the composition, carbopol, gelling agent, pH regulator. These are the content of hydrogel. TDP2. Here okra gum, Arabic kundirikam, shigru bijam. Shigru bijam is moringa gum. Moringa gum. Moringa gum could be used. Moringa gum is also an analgesic and anti-inflammatory drug. Moringa gum. Moringa bijam. Transdermal patches, Narayana Thailam, Kanjiga Arkam, Marmavatta, Chenjili egg white, Rasnadi Churna, Marmavatta, Saintha egg white, CTS, it is very good combination in CTS, carpal tunnel syndrome. Elanishadi labum, especially in the bala, could be made into transdermal patches. Then liniments, ointments, balm spray, Pyranadagiri, it is a very good liniment. It is having this anti-inflammatory action because its composition is made out of this the juice of nimbu and the juice of nisha. Nimbu plus nisha in a lipid medium will act as a very good anti-inflammatory composition. Sports nutrition is coming. Here, what is the importance of nutrition that you know about it? It's optimal performance, fast discovery and mental clarity, injury prevention, healthy living. Then guideline in Ayurveda, avoid medogara ahara, abhishendya ahara, add belly ahara, special diet for mamsa and asti, proper management of Agni. Ideal sports diet, it should be Agni Dibana, Stodha Shuddhikara, Vadanulomana, Bandya, Ojokara, and Manasharira Anugulagara. Selected Paniyas, Kharjuradi Mandham. In our during our sports Ayurveda exhibition, we have developed this Kharjuradi Mandham. Drakshadi Toyam, Shadanga Toyam, Shishira Panagam. It is mentioned in Bhaishya Ragnavali, Surya Khadam, sunstroke. So here sunstroke is sunscreen ointment is required in sports Ayurveda, sports events, and this kind of sunstroke we should attend that area too. Shishira Panaga, it's a very good composition. It is mentioned in Surya Khada Jigisa in Bhaishya Ragnavali. Guluchadi Toyam. Amalavarga compositions Panagam, Chinja Panaga, Nimbu Panaga like Manda Peya, Naligerodaga, Kshiravarga, Nimbu Ardraga Panag. Kshiravarga here, the probiotics, the role of probiotics should be attended. Then nutrition basics. How nutrition can affect athletes' performance, that should be assessed. What type of diet you should be on during the training season? What you should eat before, during, and after competition? How to maintain a proper hydration? These are the major nutritional basics of sports nutrition. Then very good nutrition is essential to preserve build muscle, maintain healthy bones, maximize oxygen support and use, repair existing cells and create new tissue, maintain optimal fluid and electrolyte balance, and provide energy. Here is a calendar. Based on this calendar, we have ISN department have developed a sports calendar for nutrition among these sports students. That was related to the Sports Council. We had a very good interaction with Kerala State Sports Council, and ISN department developed a calendar for the nutritional calendar for this sports person, and it was based on conditioning, training, pre-event, during event, and post-event. Then suggested formulations as nutrition, for diet, the product drug cum diet that could be analyzed regarding this Amrita Prasham. This Prasham model is very good for this sports person. If you analyze the structure of Amrita Prasham, you could see various types of fruits, juice of fruits, that is juice of Datri, juice of Vidari, and the fruits, various types of fruits like this almonds, plantain, then badam, various types of fruits, and it is having a fat media, it is having a protein media, it is made of the mamsarasam, and it is basis ghee, and it is having the various types of phenol content from the composition of this kashaya, and overall it is a balanced diet. Prasha means balanced diet. We could see also it is in the Chavana Prashan too. Then Vidaryadi Lehyam, Kushmanda Rasayanam. It could be made into cookies. One of my student, she's doing cookies on this Kushmanda Rasayanam. This Narasimha Rasayanam. It is mentioned in Rasayana Pragarana, but its efficacy is in sports medicine. Ashwagandha preparations, various Ashwagandha preparation, Jeevaniya Ganam. Laksharasam. For Urakshada, we are having Laksharasam. Laksha, the churnam, as Palkashaya, this medicated milk, Kshirapagam, various types of Kshirapaga, Ajamamsa Rasayana, Tilaprayogam. Tilam is a very good single drug for sports person. Then Gandhadailam. Gandhadailam is made out of various tedious processes of tila, and it is prepared as Gandhadailam. Then various Avartana, Patyahara Kalpana. In the case of Avartana, we have observed one thing, that if we are going over this up to 50 or 60 Avartana, the long fatty acids we could see. But after this 50 or 60 Avartana, it will change into short chain fatty acids. That short chain fatty acids are antioxidants. It could be utilized in the chronic inflammatory conditions. That's why Shirabala 101 Avartana is managed for, it's proposed for the management of chronic inflammations, because it is having it is rich in short chain fatty acids. Then Patyahara Kalpana. Ahara Kalpana, Patyahara Kalpana, Rasala is there, Panagam is there, Veshavaram, some snacks we could provide. Then Krisara, Payasam, Tarpanam. Tarpanam is a very good composition for this sports person. It is a Ahara Rupam, Paniyam, Mamsarasam, Sevika, Modagam like. Then user-friendly food patterns, candy. We could develop some candies based on this gooseberry or draksha, like that. Nutribars, like this. What is the latest Nutribar? Not Snickers, Fuse. Fuse is the latest Nutribar, isn't it? Like that, so many Nutribars we could develop. Nutriballs. We have developed Nutriballs for these students. Granules, tea bags, powders, malt-based health drinks, noodles, muffles. These are the new user-friendly food patterns. Sports cosmetics. Here, mainly skincare products. Skin damage, isn't it? For swimmers or gymnastics, aesthetic cosmetics are preferred. That's for gymnastics. Then swimmers, some aesthetic makeups are there. Then it is for the protection and prevention during this pre-event, during exercises, and during event and post events. Sunscreen and UV protection, cosmeceuticals, dermatological disorders adjunct to prescription medicines. Some insects bites. So we could link into Agatha Tantra. Then personal hygiene, cleansing formulations, skincare with regard to pH value, moisture content, and cleansing capacity. These are the three criteria we should think of this regarding this skincare products. Then cleansing products. For regular body cleansing, mild emollient rich body washes more more than moisturizing. Emollient, that will be more moisturizing. Daily skincare, moisturizing emollient cream or lotion containing a lipid system to rehydrate and restore the dry skin. Here comes our Thaila preparations. Then product design, some product designs, creams. Creams are semi-solid emulsions of oil and water. These are the information regarding creams. And water in oil creams are more moisturizing. Then creams work better in skin condition because they evaporate much quickly than ointments. Most people use cream or dry skin because they spread easier and tend to feel soothing. Then oil in water. These are the structure of a oil water type emulsion. Here, the medicated oil will be the oil part, and water, that could be medicament portion. That could be juices or juice of this durva, or juice of hibiscus, and juice of turmeric, like that, or kashaya prepared out of veladiganam or manjishtadi, like that. That could be compositions could be developed. Then water in oil creams is the base. Here the ointments, major medicinal properties through thoroughly mixed with a suitable base. Then this is the hydrocarbon basis ointment. It is having various, the ingredients are taken from modern pharmacy, and as Ayurvedic part is, that is our choice. Then shampoo, then soap, then liniment, then pain balm, liniment to pain gel. It's a very good composition now. Then hydrogel, the hydrogel composition. And one of my friend, Dr. Sharat Chandran, he is a professor in Kannur Medical College Pharmacy. He has developed one transdermal patch having the methanolic extract of leaves Moringa oleifera. Methanolic extract, it is there, and he has developed a transdermal patch, and it's a paper he has presented, and I took that. I have given only an information that the juice of Moringa is effective in soft tissue injury, but he has translated it into TD patch. That's the result. This is repurposing. Then, dear young minds, focus on solutions, not on our weakness. Energize your thoughts with the strength of Ayurveda in sports medicine. Research on novel drug delivery system and propagate and document. Tap the possibilities of the propagation for Ayur Sports nationally, internationally. Enrich our wisdom by adding sports Ayurveda, that is Krida Ayurveda, as 9th Anka plus Ashtanga plus 1. It is the essence of Ashtanga, but could be considered as the 9th Anga, Navanga of Ayurveda. Thank you all. Thank you very much.
I kindly request Dr. Sutikumar KB, Chairman of Ayur Sports, to honor Dr. Sheila with a memento as a token of her gratitude for her valuable time and presence in the School of Fundamental Research of Ayurveda as a part of the national seminar in conjunction with the 75th Independence Day celebrations.
Thank you for this lovely presentation. And one thing I forgot. There's one of my friend, Mr. Saji, is there. He's the brain behind the composition of Aushadhi for a sprain. There's a sprays. developed out of this ISM composition. The composition is from ISM, but it's innovation in Aushadhi, it is done in Aushadhi with myself, Dr. Josti Paigada, and Dr. Lija Putur. We are the team. We were the team, and with the help of the inputs from Mrs. Saji Jose has supported us, helped us to develop 3 products of Aushadhi, that is pain spray for the Abhyanga, and spray for on-field management, and special labor for soft tissue injury. And I thank Dr. Ramakumari Madam, Dr. Anida Jacob, and our Sports Ayurveda Research Cell people, and Dr. Matthew, he's one of my best friend. And these people are giving me so many advices to develop this kind of thought process in Sports Ayurveda. Thank you once again. Thank you all.
Thank you, ma'am. Repetitive strain injury is the term used to describe damage and pain caused by repetitive movement and overuse. Repetitive strain injury impacts the muscles, nerves, and tendons. The last session of this day will be conducted by Dr. Matthews Vempeli, founder and chief consultant, Vempeli Ayurveda Hospital, Muatupura, on the topic of management of sports injuries with special reference to repetitive strain injuries. Welcome, sir.
Hold on.
അല്ല പുള്ളി ഇതിലും മറ്റതില്ല ഞാൻ ആ റെക്കോർഡിങ്ങിൽ വന്നത് ഇതിൽ മാറ്റാം ഇപ്പൊ കഴിഞ്ഞ പ്രാവശ്യം ചെയ്തില്ലേ നേരത്തെ ചെയ്തത് അത് മാഡം തന്നെ ചെയ്തേ ഞാൻ എന്റെ സൂം റെക്കോർഡിങ്ങിൽ വരുമ്പോഴത്തേനും ഇത് ക്ലിയർ ആവില്ലല്ലോ അപ്പൊ ആളെ മാത്രം ഫോക്കസ് ചെയ്താണ് ബാക്കി പി പി ടി ആള് ഒരു മിനിറ്റ് തുടങ്ങല്ലെന്ന് പറയാം ഒരു മിനിറ്റ് ആയില്ല
all the delegates here. It's the final session of today's seminar.
ഒരു മിനിറ്റ് ഓഡിയോ കണക്ട് ചെയ്തിട്ടാ ഓഡിയോ കണക്ട് ചെയ്തിട്ടാ
How many of them from PG departments? Yes. Well, thank you. Anybody from IS? Practice service. Thank you. Just to get a clear.
So we will start. It's a time of Commonwealth. No. So I shall start from 2010 Commonwealth Games. I was a medical officer specialist working in District Ayurveda Hospital during the period of 2010 Commonwealth Games. Before that, I was not so focusing on sports Ayurveda, but I used to get a lot of cases as I was in Marma practitioner. A lot of orthopedic conditions were coming to the District Ayurveda Hospital. So the available that if 100 cases are coming, 10 were from the nearby sports schools and the sports academies like that one. So I used to observe that sports person needs some care, especially at least injury management. So that was a time, 2010. There was no, in the department, there was no sports Ayurveda, no sports medicine, no platform for sports medicine. So at that time, he was the beginner. He was the founder, actually, Dr. Arshad. I'm very happy that he has presented a very good part in the initial session itself. He is the founder, actually. He was after passing the graduation, he went for a diploma course in the sports medicine, and he started his career with the sports person itself. That was an inspiration for me also. As I was from the Kottakkal Ayurveda College, he also belongs to the same academy. So in that time, next one. Mr. Sajeesh Joseph, who was planning for a Commonwealth game, 800 meters. Prija Sridharan, Prajusha, and the pole vault, Bimin, all these people were, they were in that very same batch who was preparing, they were preparing for the 2010 Commonwealth Games. These people came to Munnar, our high altitude center, for training. While training going on in Munnar high altitude center, this guy had an injury. See, some person called me, is there any remedy in Ayurveda for this guy? He is preparing for the Commonwealth and he will be attending the Commonwealth in the 5th day. So we have only 5 days. See, he approached our hospital and we were having a lot of difficulties. There was no pay ward,
There was the wards were full as doctors were there. They were having very good IP, and I was not able to accommodate any sports person at that time. Anyway, we made a try. So the attenders were, yeah, he had severe pain. Minimum period for treatment, 5 days were left. High expectation from the patient. He was having a very good career record before going to the high altitude center. He was a top one in the 800 at that time. Needs rehabilitation before the event. No scope for medication. As at that time, the doping was very strict. Say, a lot of athletes were excluded from our team of India with the doping as if they were kept in abandoned for 5 years or 10 years, like that one. So he was a very genuine person, and he want to, even a Vettumaran was not allowed. A Dhanvandaran Guliga not allowed. So this was a situation. So pain you have to manage the pain. Minimum period was there. High expectation from the patient, needs rehabilitation. So you can imagine even now the situation of ISM hospitals. Even now, if you are admitting a patient, you have to get a care, you have to wait for days and days like that one. That may not be possible for a sports person. That was the first challenge we were facing. Anyway, we took the challenge. And this was the sloka which helped me. That was a sutra behind treating that sports person and obtaining that target. Yeah, we admitted him. Mr. Sajesh was admitted at the limited facility of District Ayurveda Hospital, Thodupuzha. And we did according to that sutra. A dhara was given, not taila, dhanyamla dhara. Then and Upanaha was available drugs with the maximum potentiated things. We did for 2-3 days. And finally, we did an Agnikarma. And the 4th day, he went to the nearest college ground. We were not having a ground for practice. He started practice in the early morning. And at noon, he told me that, doctor, there is no pain so far. Let me see. He went to Commonwealth game. And he won with the gold medal with records. How do you say? This was a challenging and very great inspiration for all of us in that team who were in the sports department of District Ayurveda Hospital. Nurses were there, attendants were there. All of them helped me to achieve this target. And he win with the gold with a record of 46.86 seconds, a meet record that erased the old mark of Gamandaram, an Indian itself. That was a milestone for Ayurveda sports medicine as far as government Ayurveda hospital was concerned. After that, around 6,000 patients, right from school level to academies and even Sai Sports Center, right from the Punjab to Trivandrum, came to Thodupuzha for treatment. We treated almost 6,000 patients as outpatients and 1,800 patients as inpatient. So that was a very good start for a small specialty. And the department gave us tremendous support. And even these are the 2 Olympians attended. One with the Mr. Long jump winner, and then other one is who was participating for the 400 relay team. A lot of sports persons national, international level sports persons came to us, and we treated, and we could do a little bit, at least the injury management. As you all know that, as Sheila was presenting Dr. Sheila was presenting the paper, it's a broad, vivid area. Injury management, it's a very, very small portion. And a lot of things are there. Sports psychology, sports nutrition is there, injury prevention methods are there, sports psychology is there. A lot of things can be done right from Ayurvedic side to help the sports person to win the game. So that was a very good thing. And I just wanted to share this thing because it is a time of Commonwealth Games. And 2010, we started the program, and in 2020, now it's having a hospital in Thrissur and having treatment given to sports person exclusively. So during that period, this was a statistics of patients came there, and most of them were from athletics. And next, we will pass on to my own subject, which is allowed to me. This is repetitive strain injuries. It's a special reference to sports person. As you all know that trauma is having 3 diversions. One, direct trauma. Second one is indirect. And third one is my subject, repetitive strain injuries. As you all know that sports persons, while from their practice, their event, and in their entire period of time, they'll be subjected to repetitive strain injuries, maybe to the elbow, to the knee, to the hip, to ankle, entire way. See, you can see our little master is batting with a heavy bat. He is giving repeated extension activities. See how much time he must have done his extension activities. You cannot imagine, you cannot count. So that can injure the lateral epicondyle, the extensor muscle, which is connecting to the lateral epicondyle, which will be subjected to a non-specific inflammation, which we call it as tennis elbow. There's a right example for repetitive strain injury. So repetitive strain injury is very, very, very common in almost all the sports persons. Next one. It can manifest right from skin to bone. A repetitive strain can injure the tissues right from skin to bone. At the level of the skin, it can be a blister, bursitis, muscle tears, muscle hernia, tendinitis, rupture, endoesophagus, ligament can be a strain and a full strain or a partial strain with instability. Joint, it can go for a synovitis, capsulitis, and at the level of bone, there can be stress fractures also. So right from skin to bone, there is chance for repetitive strain injuries. Next. So these are the mechanisms which culminate in sports injuries. Too much, too quickly, too heavy, inadequate warm-up. See, nowadays, the sports persons are getting some information how to warm up, how to go for matches, how to warm down, how to go for rehabilitation, such things. So 10 years back, there was no guidance for the sports persons. Even now, in our country, sports persons are not getting proper training, proper information regarding their not only for the nutritional activities, their activities, their prevention of injury issues, etc., etc. Poor equipments, incorrect surface, poor techniques, mechanical imbalance, previous injury. That's a major thing. They may not treat for an injury, which will be again subjected to repeated strain and will go for a major injury like ligament tear, ligament partial or complete tear, or a tendon injury like that one. Poor healing, competitive pressures. So these are the mechanism of repetitive strain injuries. In another way, whereas most of the injuries are obvious and direct due to overuse, that's why they call it as sporting injuries without adequate training. too much, too soon, too fast. This is the mechanism of repetitive strain injury. There is another term, overuse injury also, cumulative stress injury also. Some texts, they say that it's a cumulative stress injury. Pain and inflammation in the soft tissue components of the locomotor system, tendon, ligaments, capsule, fascia, etc. are common in all age groups and represent the result of minor, often repetitive trauma or overuse. Commonest RSI. At the level of each tissue, you can say at the level of a muscle, it can be an extrinsic lesion or an intrinsic lesion. We just compare it with the intrinsic lesion as well as extrinsic lesion. I'm not going into details about that one. Tendon, it can be a complete or a partial rupture or a tendinitis or an enthesopathy. So at the level of tendon itself, there can be a partial injury or a full injury or a enthesopathy, cumulative stress which results in an enthesopathy. Yeah. Next one, at the level of ligament, as you all know that ligament are the structures which give stability to the joint. So ligament damage is always a result of sudden trauma. So it can go for a instability and finally the joint may damage. So the most commonest ligament injury is medial collateral ligament injury of the knee joint. There are a lot of injuries also. Footballers are most subjected to ACL tear. According to sports event, there are areas which subjected to more stress and injuries. Next one. So as far as the joint is concerned, it can be a synovitis or a capsulitis. Next one. At the level of bone, commonest lower limb pelvis, this is a stress fracture, which is a normal. Yet you can see a lot of patients, even not sports person, those who are going to Sabarimala after 1 or 2 or 3 days, they may come with a swelling in the foot. And if you're taking an X-ray, foot oblique view, you can see a small hairline, 5th metatarsal base or something like metatarsal, 2nd metatarsal base. So this is very evident in most of the OPs. OPDs sports person കാണുന്നവർ എത്ര പേരുണ്ട്? Sports person കാണുന്നവരുണ്ട്, ഉറപ്പായിട്ടുണ്ട്. I think so. Not formally, informally, persons are coming for a treatment, Ayurvedic treatment nowadays. അതാ ഞാൻ പറഞ്ഞ ആദ്യം ഞാൻ ട്രീറ്റ് ചെയ്തപ്പോൾ ഒഫീഷ്യലി ആയിട്ടല്ല ചെയ്തിരുന്നത്, എങ്കിൽ പോലും ഒരു 10% സ്പോർട്സ് പേഴ്സൺസ് നമ്മുടെ അടുത്ത് വരുന്നുണ്ടാവും unofficially. Now it has become a branch and you can treat with a more confidence, with more these type of proven papers and like that one. So these are the areas which are more commonly liable for stress fractures and commonly occurring some specific repeated strain injuries. One is carpal tunnel syndrome. As you all know that the medial nerve is being subjected to severe inflammatory component or a carpal tunnel compression, which results in numbness or pain of the ulnar nerve area. So that will result in advanced cases, it can go for, you have to rule out cervical spondylosis and EMG is confirmatory. In advanced cases, there can be thenar or hypothenar muscle weakness. In sports persons, you will get initial level, that the painful numbness stage, you will get it. And another one is a lateral epicondylitis, which we call it as tennis elbow. It's very common. It's a non-specific inflammatory condition of the lateral epicondyle. Tennis or other racket sports items which can cause these type of injuries. Next one. Symptoms. As you all know that you can, from your academy itself, you will be getting a lot of information regarding how to examine a case of elbow and ask the patient to clinch the feet. They will say that pain is here. And ask the patient to, you just put a thumb here and ask the patient to again put the press. Patient will say that patient will not be having that much of pain. That means you have blocked the extensor muscles. In the OPD itself, you can confirm the diagnosis without too much investigations and you can go for the treatment, right? You have to rule out C7 neuropathy. That's one. So just opposite medial epicondylitis, which we call it as golfer's elbow, which is very common in weight bearers and wrestlers, and like that one, archers, weightlifters. And symptoms are very similar, but it will be prominent in the medial epicondyle. And the flexors are the main causes. Too much strain of the flexors of the forearm are the cause for a repeated strain of the golfer's injury. Next one. And shoulder. As you all know, the rotator cuff stress is very, very common in not only cricketers, basketballers. A lot of sports persons are coming with this shoulder injuries, which we call it as supraspinatus, infraspinatus, teres-minor, subscapularis. Apart from these things, there can be bursitis also. Bicipital tendinitis, subacromial bursitis, subcoracoid bursitis. And if not getting treated in the right time, it can go for a periarthritis and chronicity, which leads to frozen shoulder. Next. And this is very common in jumpers, hurdlers, iliotibial band syndromes, and walkers. Very, very common. And the thing is, the ITB runs along the length of the thigh. IT bands is a thick band which fascia on the lateral aspect of the knee, extending from the outside of the pelvis over the hip and knee, inserting just below the knee, stabilizes the knee. Ask the patient to stay like this. Patient will say that there's a tightening of the fiber. Confirmatory sign with iliotibial band syndrome, which is very, very common in sports person. But you have to rule out LCLTR, chondromalacia patella, patellar femoral syndromes. So this is the sharp pain, burning sense above the outer part of the knee. Pain worsens with the continuance of the running or the other repetitive activities. Swelling of the outer side of the knee. Pain during early knee bending. That's very, very common. But you have to rule out these things. Patellar femoral syndrome, chondromalacia patella, LCLTR, and also in adolescent period, which is we will go next one. Patellar tendinitis is very, very common in jumpers and hurdlers and like that events, and basketballers, volleyballers. Very, very common. Injury to the patellar tendon leads to pain and inflammation, which we call it as jumper's knee. Commonly occurs in athletes who are involved in jumping sports such as basketball, volleyball, but can affect any athlete. But here you have to rule out. In most of the sports person, they may be coming from the school level. Adolescent period, you have to rule out. Or Osgood slatters. What is slatters? It is primarily seen in adolescent boys. The tibial tubercle is not fixed. So repeated extension, which can create pressure on the tibial tubercle, and it will be slightly avulsed, which with a swelling, the patient will be coming. There will be a prominence in the tibial tubercle. So that is something different from patellar tendinitis. So that is a usual thing, usually seen in the adolescent, mostly boys, where you have to immobilize that particular part with the patellar support. And in patellar tendinitis, the treatment protocol is Upanaha, like that one. But if it is a case of Schlatter's disease, there is no point in giving too much medicine just to arrest the movement of the patellar quadriceps tendon, which is attaching to the tibial tubercle, with the help of a small band, which we call it as patellar support. Have you seen that one? Patellar support? Nobody is reacting. School going children, adults, it's mostly boys. Long jump, focus on the practice on focus. The grounds are uneven, proper and repeated strain swelling tibial tubercle avulsi. അവിടെ ചെറിയൊരു സ്വെല്ലിങ്ങോട് കൂടി നീരോട് കൂടി പേഷ്യന്റ് വരും. അപ്പൊ നിങ്ങൾ ചെയ്യേണ്ടത് ഒരു ടോട്ടൽ നീ ഫുൾ ആയിട്ട് സപ്പോർട്ട് ചെയ്യണ്ട, ആ ടിബിയൽ ട്യൂബർക്കിളിനെ മാത്രം സപ്പോർട്ട് ചെയ്യാനായിട്ട്, ജസ്റ്റ് ലൈക്ക് യു ആർ ഗിവിംഗ് എ ടെന്നിസ് എൽബോ സപ്പോർട്ട്, ദർ ഈസ് എ പാറ്റലർ സപ്പോർട്ട് വിച്ച് ക്യാൻ ബി വെരി simply applied for that patient and give some labor. and ask the patient to give for rest for 1 or 2 weeks and rehabilitation gradually. This is very, very important thing. Next one. Shin splint, very, very common during the very powerful matches, very, powerful games. Shin splint, which defines as the pain along the inner edge of the tibia. Overpronation is a common factor which results in a severe pain of the shin bone, usually seen in the very sprinters, usually seen. Next one. Retrocalcaneal bursitis, which very commonly seen in walkers. Because why? Walking, you have to put the heel on the floor and you have to accelerate. So there will be a load on the tendocalcaneum, which is attaching to the calcaneum. So that area is getting overused. And to prevent that friction, there is a bursa, which usually getting pressure and inflamed. So that is called the retrocalcaneal bursitis. We can see this is a. So you have to rule out Achilles tendinitis. This is something very different from tendinitis. This is bursitis. So bursitis and tendinitis you have to treat in 2 lines, like. And Mars fracture, very common in athletes and sprint events, long races, and especially our grounds are not so good. So there is chance for repeated strain of the foot. So fatigue so you have to rule out metatarsalgia. A digital X-ray will be very powerful. A powerful digital X-ray will be excluding the possibility of a bone lesion. And if it is not getting, go for a CT. Very rarely needed. And these are the basic pathology behind this thing. Friction, stress, ischemia. Basically, these are the 3 factors operating in repeated strain injuries. I'm not going into details about that one. Time is very limited. So diagnosis is very important. So not only in any disease, you have to examine properly. The history is very important. As of course, how the patient fell down, how was his practice since last 7 days, or like that one. What is his event? What is his nutritional status? All these things you have to take into consideration, and you have to accurately diagnose the sports person. Otherwise, you may make mistakes. So just like Kadam Bidi Vekkan Pattilla, you have to pinpoint. You have to pinpoint and then operate. Then only you will get the focused action. It's very important. So for that, clinical examination is very important. More than imageology, clinical examination is the basic thing in sports medicine. To examine the patient in full swing. I seen from the YouTube channel, Dr. Arshad was narrating, you have to unstrip the patient and examine in full swing. If it is a spinal pathology, it's sure. What he said was absolutely right. You are not, nowadays we are not, most of the newcomers, they are hesitating to do the clinical examination. If you are properly examining, there is no need for higher investigations. Only simple investigations will guide you, like an X-ray or ultrasound. That will be sufficient for most of the lesions. MRI is not at all needed in all the cases. See, nowadays the trend is to investigate maximum and examine minimum. If you are a sports physician, the thing should be reversed. You have to examine properly. You have to give more time for examination and less time for investigating. That is the key, right? And as a part of the generalized disease, there can be soft tissue lesions and this type of repetitive strain injuries. If a tennis elbow or a golfer's elbow or a tendinitis or something is coming, you have to rule out the possibility of a systemic diseases which causing tendinitis or ligament injuries. Polymyalgia rheumatica, early phase of RISLD, viral infections, bacterial osteoarthritis, endocrine disease, osteomalacia, Pediatric disease, malignancy, akinetic phase of Parkinsonism, fibrositis, psychogenic rheumatism. So you have to rule out all these things. And finally, you have to investigate minimally investigate minimally and arrive at a professional diagnosis and go for the treatment. Next one. Treatment should start within 48 hours. That is a major key rule in sports medicine. And it is applicable to Ayurveda also. Do you think that this protocol should be changed? Treatment before 48 hours and treatment after 48 hours. It has come from evaluation since centuries. It is absolutely right. 48 hours and after 48 hours, the treatment protocol is entirely different, not only in modern medicine, Ayurveda also. Initially, you may have to go for Sithopacharas like that, one bandage, such things, labors, such things are very, very important. And after 48 hours or 2-3 days, the thing is different. So in Ayurveda also, the thing is different. So rest, ice packs, compression, elevation, non-steroidal anti-inflammatory. You might have seen in the morning class. Okay, next one. The role of heat is coming after 48 hours only. And physiotherapy exercise programs are highly relevant in sports person. Next one. And coming to Ayurveda protocols, before going into the Ayurveda protocol, how we are arriving at a conclusion, how to treat a repeated strain injury, this is very important. Marma, Abhigada, Samanya Lakshana, which you will be very familiar as you are coming from the academy. And you just go through just something Marma Viddha Lakshana, intense pain, limping, reduced range of movement, reduced power, reduced muscle bulk, joint swelling. This is very relevant in almost any joint injury. This is very important. Only these things are very coming in most of the conditions. So you have to interpret in terms of our own methodology. Next one. And this is my conclusion regarding how to treat before treating a RSI. This will be the etiopathogenesis of Marma Bhigada. Yeah. So the line of treatment which I adopt for repetitive strain injuries is derived from 4 components. One is Marma Bhigada Chikilsa, and next one is Uttana Vadarakta Chikilsa, and 3 Bhagna Chikilsa, and 4 Snayu Sandhigata Vada Chikilsa. These 4 things attribute to the line of treatment for repetitive strain injuries in sports persons. Next one. So Marma Bhigada, what is Marma Bhigada Chikilsa? This is a very, very, very vague thing as far as no academy is giving a protocol regarding what is Marma Bhigada Chikilsa. So this should evolve from seminars like this one and continuous efforts. And I think Dr. Sudhikumar is trying very hard to get into touch with the academy to promote sports medicine, to go for MPhil courses and diploma courses. And I think there will be a good discussions and there will be a lot of theoretical and practical things adapted. And I think we can evolve within 1 or 2 years. I hope so. So Marma Bhigada Chikilsa, generally Marma stimulation techniques are highly specific according to the physician, just like chiropractics. Chiropractics, there are a lot of schools. Vadakkan Karali, Tekka Kalari, Marma Bhigada techniques used for pain management and initial range of movement improvement. These things are highly specific and lot of labors. Dr. Sheila was telling a lot of things, so which can be included in labors, Shiradhara, Thailadhara, which can be used for Marma Bhigada Chikilsa as a part. Uttana Vadarakta Chikilsa, as you all know that, superficial. See, most of these soft tissue injuries leads to superficial manifestation. So go for Lebana Abhyanga Parishega Avagaha. This is very, very relevant. And apart from the classical line of management of the following modalities, also found helpful. Puttapaga Lepam, some special Marma Lepas run in some families, which is to be evaluated in terms of pharmacology, which is found very effective. Pushmasveda, pressure bandages, Jalugajarna, and even Agnikarma is also useful in management. Right. And Bhagna, as you all know that this is the line of management. Next. So Snayu Sandhikata Vada Chikilsa, which is the key which give me an entrance into sports medicine. and very obliged to Lord Vagbada, Acharya Vagbada, and this is very, very convincing, and this is a very useful tool for treating most of the conditions. Next one. And as you all know that as a prophylactic conditions, role of Dinacharya, role of the Rituracharya, yoga is very, very relevant. Next one. Types of injuries, including fitness improvement programs reported at during that period. I told you that 5 to 7 years of my service, this was the result. And traditionally used, I will just show you some traditionally used herbs in the management of pharma practices in especially sports medicine. Pavata, Sringala, Vallikanjiram, Tardaval, Veliperuthi, Chadiramulla, Uഴിഞ്ഞ, Ella. ഇത് വളരെ കീ റോളിൽ ഉപയോഗിക്കാൻ പറ്റുന്ന ചില നമുക്ക് കേരളത്തിൽ അവൈലബിൾ ആയിട്ടുള്ള കുറച്ച് പൊട്ടൻഷ്യൽ ഡ്രഗ്സ് ആണ്, which can be used as local application, as an adjuvant. Some are for internal application, especially Tilam. It's very good to improve the fitness program, fitness improvement for sports person and for healing in most of the soft tissues. Tila is highly valuable and very cheaply available, and genuinely it can be administered. That's why Gandhadailam, I think it is working well. And of course, as you all know that our Muruvenna is doing a fantastic job, which can be used as a cold Muruvenna pack or warm Muruvenna, or according to your condition which require. If it is a case of within 48 hours, I used to put cold Muruvenna packs. After 3 to 4 days, you can use Muruvenna as such. So according to the situation, you can treat, you can consider Muruvenna as also a basic tool. So this is very important. Here my juniors. So make it a habit. Observe any elder physician treating, just like anybody from Malappuram district. Yeah, they have a very good platform there, as Dr. Arshad and Samir are there. So interact with them. When you get a case, just discuss with them and make a protocol and treat it. Then you will be successful. And here also in the southern area, anybody from Trivandrum, Kollam, Dr. Jayan, Suresh, Dr. Sajeev, all these things are, they're all my seniors. So make a habit that observe, learn, practice, develop skill. That is very, very important, especially examining a patient. How gently you can examine the patient. So images are images only. Don't treat images. നിഴലിനെ ചികിത്സിക്കാതെ നിജത്തെ ചികിത്സിക്കണം. അങ്ങനെ കേട്ടിട്ടുണ്ടോ? See, a lot of, I saw that Dr. Arshad was presenting a lot of cases with heavy investigations. See, you can treat it. Conservative management. Now the modern medicine, they are rejecting conservative management. So that we have a very good role in conservative management, especially soft tissues. And bony lesions may not be possible for a youngster, but you can treat soft tissue lesions in a very good manner, conservatively, without going for surgical management. You can treat even shoulder injuries, minor grade 1 to 2 ligament injuries, tendinitis, tendon injuries, bursitis, all these things you can treat well and develop your skill, interact with the parallel medical school. This is very, very important. കൂവസ്തമണ്ഡൂകങ്ങളാവരുത്. പാരലൽ ബ്രാഞ്ചുകളെല്ലാം കൺസിഡർ ചെയ്യണം. See, doctor is here. He is from a modern pharmaceutical level. So അദ്ദേഹത്തെ കൂട്ടിക്കൊണ്ട് ഡോക്ടർ ഷീലയ്ക്ക് ചെയ്യാൻ പറ്റിയ ഒരുപാട് കാര്യങ്ങളുണ്ട്. So if you can interact with the parallel medical school, I don't mean that a modern medical doctor also is helpful. Imageology like നമുക്ക് ഒരുപാട് ഹെൽപ്പ് ചെയ്യാൻ പറ്റും. പക്ഷെ നല്ലൊരു പ്രാക്ടീഷണർ ആവുക എന്നുള്ളത് ഒരു വളരെ ഒരു അംബീഷ്യസ് ആയിട്ട് നിന്നാല് interact with the parallel, all the relevant things that you think which can contribute to your treatment, not only in treatment but diagnosis also, and treating with the medicines with the very patient friendly approach way. ഈ സ്പോർട്സ് പേഴ്സണെ ട്രീറ്റ് ചെയ്യുമ്പോൾ ഉണ്ടായിട്ടുള്ള ഒരു ദുരനുഭവം പറയാം. ആയുർവേദക്കാർ മാത്രമുള്ള ഒരു സദസ്സിലായിട്ട് ഇത് പറയാം. അതായത് വിഷമം തോന്നരുത്. സ്പോർട്സ് പേഴ്സണെ ട്രീറ്റ് ചെയ്യുമ്പോൾ അവർക്ക് ഒരിക്കലും വാമപ്പ് എക്സസൈസ് കാര്യങ്ങളൊന്നും ഇടയ്ക്ക് മുടക്കാൻ പറ്റില്ല. മുടക്കി അവരുടെ കരിയർ പോയി. അപ്പൊ നമ്മളൊരു വാർഡിൽ ട്രീറ്റ് ചെയ്തിട്ട് മറ്റു രോഗികളെ ചികിത്സിക്കുന്ന പോലെ കയറി കിടന്ന് 55ാമത്തെ ദിവസം നിന്നെ വിടാന്ന് വിചാരിച്ചാൽ സംഭവം പോയി. ഇറ്റ് ഷുഡ് ബി ഫോക്കസ്ഡ്, ഫാസ്റ്റ് ആയിരിക്കണം. അവർക്ക് ഫ്രണ്ട്ലി ആയിട്ടുള്ള മെഡിസിൻസ് ഏറ്റവും ഭംഗിയായിട്ട് കൊടുക്കാൻ നമുക്ക് ഇന്ന് ഫാർമസ്യൂട്ടിക്കൽ ടെക്നിക്സ് ഉണ്ട്. ഒരുപാട് പാരലൽ ബ്രാഞ്ചസിൽ നിന്ന് നമുക്ക് ഒരുപാട് ഒബ്സർവ് ചെയ്യാൻ പറ്റും. മയോഫേഷ്യൽ റിലീസ്, ട്രിഗർ പോയിന്റ് റിലീസ്, ഓൾ ദീസ് തിങ്സ് യു ഹാവ് ടു അഡാപ്റ്റ്. ഫിസിയോതെറാപ്പി ഈസ് നത്തിങ്. മോഡേൺ ഫിസിയോതെറാപ്പി എന്ന് പറഞ്ഞാൽ ഇലക്ട്രോ തെറാപ്പി ആയിട്ടാണ് ചിലർ കാണുന്നത്. ഇറ്റ് ഈസ് നോട്ട് ഫിസിയോതെറാപ്പി. ഫിസിയോതെറാപ്പി ഈസ് നത്തിങ് ബട്ട് മയോഫേഷ്യൽ റിലീസ്, ട്രിഗർ പോയിന്റ് റിലീസ്, ഗെയ്റ്റ് മാനേജ്മെന്റ്, മസിൽ ഇംബാലൻസ് കറക്ഷൻ. All these things are coming in modern physiotherapy techniques. So നിങ്ങൾ ഒന്നിലെ പഠിക്കുക, അല്ലെങ്കിൽ അത് സ്വയം ഒരാളെ കൂടെ കൂട്ടി നിർത്തി make a team. That is very, very important. Interact with the parallel medical school, integrate with the relevant concepts of the field of physical medicine without compromising our basic concepts. Relevant concepts ഒരുപാട് വരുന്നുണ്ട്, പുതിയ പുതിയ കൺസെപ്റ്റ് ഫിസിക്കൽ മെഡിസിനിൽ. അപ്പോ നോൺ സർജിക്കൽ ആയിട്ട്, അതായത് നമുക്ക് കൺസർവേറ്റീവ് ആയിട്ട് ട്രീറ്റ് ചെയ്യാൻ ഒരുപാട് മേഖലകൾ വരുന്നുണ്ട്. അപ്പൊ അതെല്ലാം പുതിയ യങ് graduates and postgraduates should explore, and let this institution be a platform for that one, and make a team. ഒരു ടീം ഇല്ലാതെ ഒരു കാരണവശാലും സക്സസ്ഫുൾ ആവില്ല. ഒരു വൺ മാൻ ഷോയിൽ ഒരിക്കലും നടക്കില്ല സ്പോർട്സ് മെഡിസിൻ. നോട്ട് ഓൺലി സ്പോർട്സ് മെഡിസിൻ, ഇനി നമുക്കറിയാമല്ലോ നമ്മൾ 4 പാദങ്ങൾ എന്ന് പറയുന്നുണ്ടല്ലോ. എങ്കിൽ പോലും സ്പോർട്സ് മെഡിസിനെ സംബന്ധിച്ചിടത്തോളം ഇറ്റ്സ് വെരി വെരി ഇമ്പോർട്ടന്റ് ദാറ്റ് യു മേക്ക് എ ടീം. വിത്ത് എ ടീം യു അപ്രോച്ച് with your ideology and logic, and you will be successful. And this is my hospital. Next one. Thank you once again for your valuable time for attending my small session.
Thank you so much, sir. Now, I'd like to welcome Dr. Sudhikumar KB to honor Dr. Matthews Wempeli, founder, chief consultant, Wempeli Ayurveda Hospital, Muatupura, with a memento as a token of gratitude for his valuable time and this wonderful session. Now, it's time for a video presentation which got first and second prize in the research paper competition held by Kerala University of Health Science School of Fundamental Research in Ayurveda as a part of National Seminar on Ayur Sports in conjugation with 75th Independence Day celebration, Azadi Ka Amrit Mahotsav.
Video presentation. നിങ്ങൾക്ക് വാല്യൂഷൻ അതിനകത്ത് കയറും. ക്ലാരിറ്റി കുറവായിരിക്കും അതിനകത്ത് കാണാമല്ലോ. അതിനോട് ഈ സ്ക്രീനിലേക്ക് ഫോക്കസ് ചെയ്യാൻ പറയണം. School of Fundamental Research.
Respected teachers and members, I am one all of you and regulations. Respected teachers and members, I am one all of you and regulation teaching PhD scholar and department of Theology for National Institute of Ayurveda, Jaipur. I did the lesson here and since the person which is formulated with the help of Dr. Lord Krishnan, who is the assistant professor and head of our department of Ayurveda College, Toronto. The public area of study is a study to evaluate the effectiveness of axial practice made of Dislocation Shira in muscle spasm exercise. Scientific area of study is a pragmatic operable randomized trial on continuous of axial practice made of Dislocation Shira in exercise associated muscle grabs with listed electromagnetic. Exercise muscle grabs are the common conditions experienced by recreational and athletes where intense painful contraction of cellular muscle soccer. And local grabs have spasmodic in various muscle.
In fact, it would swing 2 to 10 to weigh significantly more than those who got enough concentration.
The cause of development PMS is not clear, and since the cause is unclear, the treatment strategies adopted for PMS often remain unsuccessful. Intake of people sports, cryotherapy, thermotherapy, passages are considered some of the methods employed to optimize these plans, and passive stretching is a commonly employed method which is found to be helpful in relieving pain. As we write about whether the stretching was spasm there is associated variability and also much share. And so vestibular is a competition between drugs which are movement to the regulated powder, and it is mainly to cheat the powder which is the account of the question. So this vestibular Shira, which is located in the context of Vardishamudra, Chikitsa Yashanamudra, it is said as subject to the pain fever and acted as spike shape by water abdominal posture. Diagram and crashing paper. As we know, water is the root cause of pain as started principles. Here, the drugs Deshamudra, which by nature water are having choices. And really analysis formation under extreme lacking, formations are there are only intermediate institution activities. So here, normally about practice of preparing fresh chemotherapy and different applications. This formation has been made into IC practice. This is not a difficult design, easy to carry, easy to apply, location expert, area to gather and customize, easily wherever it's following this. These are some of the benefits. Aim of the study is to find the effectiveness of NC practice in visual institution during the management of exercise associated muscle plans with respect to electromagnetic. Primary objective is to compare the effectiveness of NC practice in visual institution with the trial to the passive and passive alone in exercise associated muscle plans. Second objective is to develop pieces of NC practice out of visual institution to study about the parts of electromagnetic muscle plans and also study about the changes in electromagnetic inducers and the visual practice are applied. Research question: are the NC practice made visual effective in the management of exercise associated muscle plans with respect to electromagnetic? Null hypothesis: there is no difference in effectiveness of NC practice in visual in the passive stretch and passive stretch along PMS with respect to electromagnetic. Alternate hypothesis: there is difference in effectiveness of NC practice in visual Shira, even in passive stretch and passive stretch along methodology. The study is planned to continue to source of another district. Problem studies exercise assessment. Sample size has probably information to compare the proportion.
was found to be 90 and considering dropouts and lower exercise to be 100 units. Pace of trials phase 4, estimated duration of trials 12 months, sampling method is random sampling, method allocation considered is loss method, as there is no stop for blood masking, and ethical consideration the extremely time if you have to make see connection of etc. Please stop normal things. Strictness, policy inclusion criteria. The individuals from ages 6 ratio 80 to 40 years who suffer from exercise has to muscle cramps will be included, and those who have often moved allergic diabetes, pregnancy, different purposes, and who have had into lower will be excluded from the trial. Documentation, the school is to treatment will prepare and immediately participate so that it can be handled with this thing. And using exploratory techniques, the best piece of patch will be developed to rapidly manage technology judgment. And this is a long that is why those common injuries are excluded. Application time is usually 8 hours. Study design is the individuals of the sports school of environmental institute set up exercise associated muscle grants and satisfy the input exclusion criteria into randomly selected for the study. And the ability to value and control disease no symptoms. EMG, the parent score, employee investigation, and other subjective parameters will be recorded. And those in the control group, they will be given passive stretches as management grants, and those will be tried along with passive stretches, the passive at this moment the children will also be adhered in that. And this will be continued for 5 days. The diet taking the grants will be completed. Taking weights for adult institutions and subjective parameters will also be assessed after 5 days. Follow-up will be done after 2 weeks to check for the records of episode. Changing the data reinforces difference between statutory analysis software and the scope of the study is that if we could find any effect for this adhesive patches, it will be a very big step in the added intention in soft injury, as we may open up the scope of utilizing our formulations to develop advanced scientific case that help to prevent the mishappenings of sprains, cramps, specific features and it must often exist in all of these, including the academics and sports, which is an inspiration. But they do serve related stories which they often later. Utility incontinence is one such condition which they often later. But not that it can still make functional life. These are not Thanks to review and meta-analysis perspective, final impacts is 25.9% of the male who participate in various sports activities have overwhelming confidence. It was also found that thousands of independent practice with high activity athletes with high impact sports potentially increasing the risk of stress-related confidence. The International Confidence Society (ICS) and International Neurovascular Association (INVA) define movement confidence as a symptom, namely the complaints of any involuntary behavior. Stress-related confidence in athletes, how many athletes are subjected to increased abdominal pressure, which is caused by a contraction of abdominal muscles. In high impact activities, without proper awareness and strengthening of pelvic muscles. Strain sensitive activities activity that involves intra-abdominal pressure and chronically damaged pelvic, thus decreasing contraction and strength of pelvic floor muscles and decreasing risk of stress urinary incontinence. Muscle fatigue occurs during this activity when two fibers are affected. These fibers have no capacity to maintain muscle tone of pelvic floor muscle, one of the factors that can compromise urinary incontinence of cancer. This can quality of life, causes embarrassment, anxiety, and reduced participation in social activities and early retirement. A. To study the impact of Ayurveda protocol, we can know immunity incontinence of female athletes of age group 18 to 50 years. Objectives: study the efficacy of Ayurveda protocol with healthy muscle strength in female athletes having immunity incontinence of age group 18 to 50 years. To study the impact of Ayurveda in quality of life in female athletes having urinary incontinence of age group 18 to 50 years. Research question: is Ayurveda effective in controlling urinary incontinence in female athletes of age group 18 to 50 years when compared to standard care control? Methodology: the proposed study is a multi-center randomized controlled trial. Inclusion criteria: female athletes of age group 18 to 50 years who is currently active in the field and complaints of urinary incontinence are taken as a study. Exclusion criteria: those who are pregnant, those having irregular menstrual cycles in terms of vitamin and nutrition, having any history of surgeries done on the pelvic region, having history of pelvic floor injuries following normal vaginal delivery are excluded from the study. From the 9 to 1 cases of urinary incontinence, according to the revised urinary incontinence scale, study participants are included and randomized after they decide on the incontinence. Random allocation of participants to Ayurveda care or standard care is carried out in one patient. Non-randomized using statistical software that allocation is conceived in instruction number series of 8 members until randomization. Studies results must enroll all participants. After each participants are taken and all the participants are checked for pelvic floor muscle strength versus pelvic. They are also advised to incontinence impact questionnaire assess how much urinary incontinence is affected. In the study, the treatment plan included and Ashwini. In case 1, we emphasize the combination education, facilitating activities of daily living such as sitting, lifting, carrying, and response training that giving support to their parents' success. In phase 2, the gynecologist usually offers training and pelvic floor muscle contraction for participants. They are then given yoga with Paralaya for 15 minutes for 21 days. Start with the from the posterior abdominal wall, continue with the anterior wall, massage is done, then on the lateral wall. After treatment, these patients are advised to do 10 sets of contractions to Ashwini Yoga daily for 5 days. In the control group, the treatment plan includes education, nerve topics, and previous exercise. In phase 1, patient education is done same as that study. In phase 2, nerve topics are given for 21 days, and the patient is advised to do 10 sets of contractions to previous exercise per day for 21 days. The post-assessments of the study are done using pelvic revised urinary incontinence scale, and incontinence impact questionnaire. Data analysis. The data can be analyzed using SPSS software. The Recurrent test is used to analyze the pre and post assessment, and manually tests can be carried out to compare the values between two groups. Conclusion: the first line of treatment must always be training of patients. In the same mistake that this can be done along and future by the in their simple sports field. The yoga cannot expect to improve the strength of pelvic muscles. By applying strength to the pelvic floor muscle, thus preventing any movements dystrophy, recursive or relapse to dislocation. Which also acts as a level. The present study, once systematically, can be accounted for median situation. Thank you.
ഞാൻ വന്നു എന്റെ ഫ്രണ്ടിന്റെ വീടുണ്ട് ആ ഫയർഫോഴ്സ് അടുത്ത് വന്നുണ്ടോ? അവിടെ ഞാൻ 2 ദിവസം വന്നിട്ടില്ല. ഇവിടെ താമസം പറഞ്ഞു.